it is no sound. So you please check any of that proof.
கொஞ்சம் கேமரா உங்க ஃபேஸ் ஹாஃப் தான் மேம் தெரியுது நளினி மேம்.
Is that okay?
No ma'am, half face only we can see.
Yes.
No, if you start presenting that sound, now it is coming, ma.
Yeah.
I don't know what's the problem with that.
Is that fine now?
Yes ma'am.
Can we proceed?
Yeah,
Yes ma'am.
you start doing
Yes, ma'am.
slightly
Yes, ma'am.
only.
Yes ma'am.
Yeah.
Yeah. Just to continue over there, I know technology always gives us from some trouble in the beginning, but then as we proceed and move on, it gets rectified.
Yeah.
Proceed. Just to tell you that research evidence is what you create using doing your research. So when you do research, you do get some data, and this knowledge is what you create as information for your nursing science. That becomes the knowledge, and when you try to shift it inside the practice arena, it becomes the practice of the future. So now Madam has given me an important topic where I'm going to connect both the healthcare transformation along with nursing research. So this is what I'm trying to do now. So at the end of this session, these are the objectives I have set. You will be able to identify the challenges in the healthcare, identify how the healthcare transformation has occurred in India, and what are all the research perspectives which is going to help us in the healthcare, and describe the nurses' role in transforming healthcare through research, and how we can connect ourselves being academicians with the healthcare research, and also to analyze the potentials of yourself as a researcher, because I thought this is something I should definitely share with the youngsters over there, because Madam has given a perfect platform for so many youngsters to come inside. So I thought it's the best way to analyze your potentials, how good you are in research. So today, as being an Indian, definitely we have a great challenge where we are trying to care for about 1 billion people in this country. You know that the death rate has definitely declined, but the birth rates are still high. And you can also find the healthcare structure is definitely overburdened by the increasing population. And we are able to witness this in the current COVID pandemic. Now, there are lots of healthcare issues and challenges that we face. It's a fast-growing population, or it's the re-emerging diseases or the newly emerging diseases, something which is unexpected like COVID, and the changing disease profile. And then you have multi-layered healthcare system and landscape that is giving trouble to us, infrastructural deficiencies. There is lack of manpower, adequate manpower is still deficient in our place, and we have low public health expenditure particularly for the health, and we also have inaccessibility to healthcare from different parts of our place. Now you can see a big boom of urbanization is taking place, and slowly it is said that in 2050, you will definitely change a slit in the population where the number of people residing in an urban area is going to become more compared to the rural region. Currently, we have the rural population more compared to the urban. Now this tilt will happen by 2050s where you're going to change. You can see the change. And it is also predicted that India will take over China, being the first in the world populous country across the globe. So this is going to happen very soon. And you can also find that lots of new emerging diseases, non-communicable diseases are given greater strength. Cancers and cardiovascular diseases are going to definitely take the toll of our life. Whereas you can also find something unexpected like COVID coming inside, and you also have road traffic injuries and other intentional injuries that is going to take a great remarkable part in bringing about mortality and morbidity in our country. Now, healthcare in India, there are two important people over here. One is the private practitioners, others are the hospitals, the public sector and the private sector. And there are also a lot of alternate systems of medicine which is given importance in our country. And a lot of issues or concerns are always there regarding ethics, medical negligence, commercialization of medicine, and incompetence. And definitely there is increasing cost of medical care, and the threat is always there. The relationship between the healthcare professionals and the patient, you can see, is not up to the mark nowadays. Now you can see that shift in the urban areas and the drastic discrepancy we have, where you can find healthcare is more dominantly present in the urban areas than in the rural areas. And you can see this curious use of pharmaceutical companies which are trying to give medicines that is not up to the mark in the rural areas compared to the urban areas. And a lot of rural healthcare challenges exist. The affordability of care is very difficult. People have to come to the urban areas to go in for super specialization. Accessibility is very less. Awareness is also very less, and we have to toil a lot in order to create awareness among the rural health people. And the quality of care, what they get in the rural area, is also deficient. There's something called as human development indicators, which is actually depending on three important factors. You call it as longevity, how many years you're able to live, literacy, and the GDP. GDP is gross domestic product. It tells you the value of the product that is produced by the country as such. Now, these three factors definitely tell you upon the human development, and you can see the top 5 countries, whereas India is ranked about 129 out of so many countries over there. It tells that we are not up to the mark. And also you can see our own counterpart Sri Lanka is ranked 71 compared to India. So where do we lie? It all depends on the state of health, and it is also linked to the income and education. So this tells that our concentration on health has to go up further, and we have as a role, as a healthcare professional, we have in the transformation also. Telling about all the challenges, we also should see to the transformation that is happening in the healthcare. And today, India is recognized as a knowledge economy, and you can find a scenario that is changing, and it is becoming a big healthcare hub. Nobody can deny this fact. India is becoming a big, big healthcare hub. And you can see this transformation is because of the healthcare itself, the pharmaceutical industry, the biotechnology, the ICT, the information communication technology, which has in fact created a big boom with the transformation. And there are also lots of changes that is happening with the aging demographics, the chronic illness, and the increased longevity. You find that we have to give currently more importance to geriatric care and palliative care, and we have to educate a lot in order to approach the people's behavior changes rather than going for curative aspects alone. Today, being in the COVID arena, we speak about a lot of awareness creations where we talk about hand washing, social isolation, putting on the mask every time, and distancing yourself. All these are behavioral approaches that has been taught again and again to the public in order to concentrate on the prevention rather than on the curative aspects or the rehabilitative aspects. And you can see that insurance companies do spend a lot on patients who have more than 5 or more chronic illnesses. There is also cost. You can see that usually in India especially, you can find that healthcare sector is one of the largest sector as such. It is going to provide revenue as well as employment to people. There's healthcare in the hospitals, medical devices are produced, clinical trials are being conducted, telemedicine, tourism. There are lots of healthcare activities that is going on. And Indian healthcare sector is just growing like anything in a brisk pace, both with public as well as private players. And you know, the cost. Government is trying to concentrate more on the primary healthcare centers, and it is more on the preventive aspects. Then you have the private players coming inside and helping us with the secondary and tertiary care institutions. And there is a large amount of medical professionals and healthcare professionals over there. Now you can see the number of cardiac surgeries are just moving away. You know, the number is such a great number, and lots of multiple organ transplants are taking place in our country. And you can identify that about 55 countries, people from 55 countries are treated in Indian hospitals. And this is what we call it as medical tourism. You can find that a big boom is happening, about 20 to 25% growth is happening in medical tourism in our country. And 80% of the antiretroviral drugs are in fact from the Indian pharmaceutical companies. So what does it tell you? The cost of Indian healthcare is less compared to that of other countries. So this gives an advantage for people from all over the other countries to come over to India for getting the treatment. So in fact, this is an advantage. So as a nurse, you are supposed to be a multicultural person who's able to tackle those patients from different cultures and those who have different values and practices. So, and again, one more important thing is India is a country which is trying to put all the best practices always together. And we try to have a link between the Western and the Eastern healthcare systems. And this you can see is Indian systems of medicine is actually coming back, and Ayurveda is recognized as an official healthcare system even in other countries. And Ayush is actually being developed everywhere in all the hospitals. And even US has found that natural approach is preferred by people over there in their country. So what does it say for all of us in healthcare? physicians, nurses, medical technicians, as well as other scientific occupations will actually become growth industries, which is going to become next to the IT sector in the next decade. This is the Vision India 2020 report that says, and the reason why India has an advantage is because of the excellent research laboratories, and we can find that India is giving a tough fight for many of the countries today because we are trying to equip ourselves with a vaccine very soon. We also have a lot of well-developed base industries. There's a rich biodiversity. There's extensive clinical trials that is going on, and there is trained manpower, both for the nurses as well as the doctors and other healthcare professionals. And we have a very, very good knowledge base. So then, what is your role as a nurse? Now, nurses, the IOM report, the Institute of Medicine report in 2010 very clearly states that nursing has a very critical contribution in healthcare reform. And as nurses, they are expecting from us safe, quality, patient-centered, accessible, and affordable care to the patients in the healthcare system. I think this is possible for all of them if we all come together using one weapon as research. Now, there you can also find there are some shifting paradigms from past to future. Before, it was the patient who was trying to pay for the illness or sickness. So if he wants to undergo a CABG, well, he has to pay for the procedure. That's it. But today, payment is even done for the preventive aspect, care coordination, and care management. Again, the patient is now considered as the center of treatment and never the expert, and patient has become the partner in the treatment aspect. There was no accountability before in the past for quality, but today we are all talking only about quality, and each and every person who's treating and taking care of the patient is responsible for providing this quality concept to him so that he gets the best care ever. And then you also find that quality is just not for one individual department to give some records and reports of quality. Every person is being considered and taken up for the quality measures we are trying to utilize in the hospital. And we also try to get the aggregate levels of all the quality measures. Now, quality is measured for longer duration of time, and people are able to get same day appointments, same day surgeries, same day discharge. So many things are happening, and there's a lot of respect being given to us. And you also find team, collaborative care, all these are taking an important pace today compared to the previous sector where nobody bothered about team or collaborative care over there. Now, you also find nursing definitely has a voice. Nurses has a voice today, and this voice is getting slowly recognized even in our country like India. And this you can find in this COVID scenario where nurses are in direct contact even with the Prime Minister to voice out their feelings. So that tells how well we are connected and how well we are valued upon in this system. And we are supposed to utilize this scenario to develop our profession further. And nurses are actually just not following orders alone. They are trying to advocate to the patient and the family members and focusing on excellence. You know, CMC has become the trendsetter in order to bring about nursing excellence, quite unique for nursing alone. And this has been now followed by many other hospitals. Everybody is trying to get the nursing excellence, and even Ramchandra is one trying to going in for excellence in nursing. So all of us are concentrating and focusing on the nursing care as such. You can also find some important statistics which says that many of the startup companies are now looking for some cost-effective measures or devices, and you can find that devices which are having ECG monitoring, point of care services that is just one step ahead to provide services, or tailor-made product which is more Indianized in nature, which can be utilized for Indian population is now being considered. Now, as important is, as nurses, don't detach yourself from technology. It's more important that we try to connect ourselves. And yesterday, I just saw one of the report by a person who is working in a Bangalore hospital, a nurse over there who was just sitting in isolation after taking care of COVID patients, was able to identify one small, device which is going to actually give your solutions, your sterilium solutions or disinfectants directly on hand, because every time we touch the bottle of a disinfectant on the top of the head, press it so that the liquid will pour. This may be a cause for infection. So now he has identified a chip which has been set, which automatically just you put your hand down and it tries to give you, the solution just drops down. This is what we even see in airports and in case of hotels where just water drops in when you put your hands inside. The same technology he has utilized as a nurse for this system of disinfectants too. So this is what we are just have to put our brains inside to identify so many devices. Your concept is always welcome. You have to collaborate with technology people as well as all those people, engineers over there, so that you try to devise so many instruments because you know what is required rather than people, the technologists who are sitting there. Unless you tell this is what is required, they will be able to identify what is our need. So there are lots of good things that is happening, tele-education, tele-consultation, and we are part of all these good things that is going on in the country. And we also have lots of low-cost machines, portable ultrasound, lullabies, warmers, all these are their part. And you can also be a person in constructing a device, contributing to the device construction and encouraging that in service and practice of nursing profession. A lot of care bundles is now being used. Now, what is this care bundle? You know that there are care bundles are nothing but a group of interventions that are being put together so that you can significantly improve the patient outcomes. So you can find that care bundles try to improve the patient outcomes, and measurement of this outcomes are possible, and it reduces the risk for infection. So if you perfectly use this care bundles, your compliance with the care bundles is very high, then the risk of getting infection becomes very low. So that is the advantage. And in the hospital, as students, you have come across so many care bundles like central vascular catheter care bundle, you have UTI, urinary catheter care bundle, you have vascular catheter care bundle, surgical site infection prevention bundle, especially you have Clostridium infection care bundle, and you also have ventilator associated pneumonia care bundles. All these tells you that we have a set of designated interventions that we are supposed to carry on for the patient. And if we carry out that, definitely there is a reduction in the infection rates. The next thing that is coming up is the evidence-based practice. All of us, we talk a lot about research, but research, when it gets converted into practice and when it's been substantiated by clinical practice and then as well as justified and accepted by the patient values and systems, definitely it becomes more evidence-based in nature. So this is what we try to tell you. Just a word about evidence. Evidence is nothing but you're trying to integrate the best research evidence with the clinical expertise and the patient needs and values. So you have to do research at all levels. It can be from the weakest to strongest levels of research is being done. It can be a meta-analysis, it can be a clinical trial, it can be a simple descriptive study, no problem. But research is more important because research is something which is going to provide the evidence for you. And nurses try to use this practice in order to promote the quality, the cost-effective outcomes for the patients, families, and healthcare providers. Again, do remember, evidence-based practice is not like a case in the court. It is not like that. It is to help you to make changes so that the best care is being provided to the patient. Now, the next important setup that is being spoken in all the sectors of health is quality. Now, there are 6 components of quality that is always taken care into. Whatever care you provide should be safe. It should be with low risk or no risk, and it should not cause any injury to the patient. And what care you give to the patient should be timely. Efficient care has to be given, which is more evidence-based in nature. Effective care and it should be patient-centered in the sense your patient should be the center person. His value, he should be a partner in your care that is being given. His decision making should be taken into consideration when you are taking care of the quality care that has to be given to the patients. So when you try to take up an intervention, always check whether that intervention is appropriate to the patient, appropriate to the setting, whether patients have accessibility to it, whether this intervention can be available across all over the period of time, whether continuity is possible, effectiveness, is there any literatures that say that it is effective, and efficacy can be tested, whether efficiency is there, because you cannot misuse or overuse resources when you're trying to bring about new interventions. And always think about the respect and caring and safety and timeliness of the intervention that you're going to take up. Now, this is a model which we have been studying from our fourth year on in nursing management. We call Donabedian as actually a father of quality as such, and he has given this Donabedian's theory of quality healthcare, which in fact takes into consideration three important concepts of structure, process, and outcome. Now, structure talks about the equipment and the personnel who is there in order to carry out the functions, and process is actually the actions you do for the patient, what interventions you do, what actions you do in order to treat the patient, the assessments you carry out on the patients. All this becomes your process. And ultimately, what is the outcome of the care that you give? What are the results that the patients come out as the outcome of the patient? So any quality depends on these three features if you want to give the best of quality healthcare. Now, why I told this is normally there's a big debate going on in this country whether we should measure the outcome or the process. And there is also a critic that always exists that most of the medical indicators are process oriented rather than outcome oriented, because most of them considered how many surgeries are being done in the hospital, how many angioplasties are being done in the hospital. It is like that. So they only speak about the process and not about the outcome. But if you see all the nursing measures, they are all outcome oriented. We speak about the number of falls, number of pressure ulcers. So this is depending on the care that you give as a nurse, the infection rate, the filtration rate, the IV filtration rate, all these are outcome measures. And also you can find that outcome measures are also accompanied by best practice interventions or process that has been prepared. So for the fall, we have a fall risk assessment. We have a fall risk protocol over there. We try to implement it. So all of our outcomes has a detailed version of the practice measures or policy measure protocol that we are supposed to follow so that we achieve good outcomes, which is going to be valuable for the patient care. The most important thing as a nurse you are trying to do is to collect the data. So understand the importance of data. All data has to be tracked. It can be clinical, the cost, and across the time and across the setting has to be done. And these are what you call it as key metrics, which is going to help in the treatment, the health status, functionality, and the quality of life. All these metrics has to be collected both at the individual level and population level so that it can be collected as data for the future and it can be disseminated to the whole nursing community. Now, this is an example of a nursing sensitive care. As I told you before, the structure, process, and outcome are all there. And you can see that structure is the size of the hospital, the teaching status of the people over there, whether the hospital is accredited, the staff mix, what you have, the education of the staff nurses over there, whether the nurses have some specialty certification, turnover of the nurses, all this becomes the structure. And then process is what you do as nurses, counseling, medication administration, implementation, all this is being considered. And the outcome you can see depends on the falls, the pressure ulcer rates in the hospital, the nosocomial infections, all these are outcome measures. Now I'm just going to take one concept over here, the specialty certification. So you are trying to identify as a nurse, if in case your nurses in the hospital do have some specialty oriented education that is going to help them be more supportive to give an additional knowledge for them, how is it going to transform in the outcome of the patient care? So there are lots of studies which is trying to link the certification with the improved process and outcome. And one you can see is a study by Nelson, which says actually nurses who are there, employed and certified rehabilitative nurses who are certified in rehabilitative aspect, they found that the patient's length of stay is now decreased by 1 day if in case you identify and put these people in the rehabilitation units rather than regular nurses. So what does it tell you? 1 day I'm able to save the cost of the hospital. So that's a great, remarkable one. And also Lange has told that if you have lots of nurses who are certified in fall prevention, you can find that there are lower fall rate in the units also. Now, there are another study which found out that certified wound ostomy continent nurses, they have in fact helped in creating a big remarkable drop in the preventive pressure ulcer prevalence from 29% in the unit. The pressure ulcer has come up to 0%. So what does it tell you? If in case your nurses are having certified, better qualified education, their contribution to the quality care is better. So it tells you that employ such nurses. So try to go in for higher education, and the organization should employ. And this is what we are supposed to project to our administrators, saying that how remarkable the services improves if in case nurses have certification. And this can be even done in case of higher education, BSc nursing. What makes difference? So we haven't done so far. So this is a question I keep to you all. Try to identify what is the change your BSc nurses or MSc nurses after qualification they are trying to bring out with your quality care in the hospital. A big national sample of hospitals in US also found a significant reduction in all the problems of pressure ulcers when compared to the other nursing care which is being given to the hospital. So this is just one example I have quoted for you. And a lot of research is now going on, especially in this COVID time, which is very, very important. And a big nursing time poll conducted among 3,500 nurses found out that nurses are in fact having increased stress and anxiety now. And you can find that 87% of nurses are in fact stressed rather than normal period currently. So what does it tell you? It is having this stress is going to have a negative impact on the mental health of the nurses and the care workers, and this can in fact affect the nurses as such. So now we have to identify certain strategies in order to help the mental health, keep them better, mentally healthy, in order to make them mentally healthy during this pandemic. Now, there are also lots of other studies going on where we try to collect the knowledge, attitude, and the practice of the nurses over there, the students over there, and big research work is always going on, the impact of e-learning, because all of us are now connected with our students through this e-learning management systems. So we have to identify what is the impact. Many of them are trying to do research on this, and slowly we will get data and say in the next 2 or 3 months when this data get disseminated very through the publications that come up. So there are 3 T's in order to transform healthcare. What are all the 3 T's? The 3 T's starts from the basic science. The translation, T means translation. So basic science, you start with basic science. What you start in a laboratory, in an animal model, that gets translated inside the clinical area or the research unit, clinical research unit. That becomes, you try to identify the efficacy. So that is what you call it as clinical efficacy. Now from the lab, the clinical research lab, it enters to the next arena of clinical effectiveness, where you test the same intervention or drug or whatever procedure, and you try to use it on the patients in order to find out the clinical effectiveness. This is the translation too. When you find the clinical effectiveness is very, very good by means of your outcome research or comparative research, this medicine is better than this care is better than that. When I use care bundle, it is more effective in bringing the outcomes. When you feel this is being done, then you go to the third level of translation, where it becomes a protocol, and you put that as one important healthcare measure which can be utilized in the community sector, and the reliability of the intervention, the high quality intervention is being disseminated to everyone over there, and you maintain systems, policies and protocols, which is going to be very, very useful. So this is what you call it as 3 T's, which is going to transform healthcare, and nurses are there in almost all the T's. Nurses are essential. So your research work is going to be useful in all this translation arenas that is going to take place. Now, this is just an example I'm trying to give you how you can identify in the preclinical animal model. Then you go to the clinical trial level, test it in the research laboratory or with fewer amount of patients or fewer amount of nurses. And then you go on to a larger level where it is accepted as the practice because you're testing in the laboratory or in a small group of patients has told you that it is effective. Then you disseminate, communicate and implement. And when it is being accepted, then you go to the next level where it becomes population outcome studies, and it is going to definitely become the future of tomorrow. So this is what translation research spectrum speaks about. Now, transformation to occur, it is not at individual level alone. So it's not just I do research and I am going to bring transformation to healthcare. It is not possible. transformation has to occur both at individual level and organizational level. And both of them, if you combine together, it is going to bring success. And this will, what you call it, is bring about interprofessional collaboration also. So next thing, what I thought I should touch is, because many of us are academicians here, we have to think how research can be linked with academics. Now we feel that we are different pillars from the cervix sector, and we have to embrace nursing, academic nursing with the clinical nursing. And how is it possible? How are we going to strengthen this is based again on a report which was prepared by the American Council for Nurses, and they have brought in lots of strategies. And I think it is possible for us to even use this in our country, where we have to create mechanisms to coordinate the research projects and activities along with the healthcare units. So we can try to link ourselves with the medical schools and the healthcare units, try to collaborate with all the data over there, go for joint institutional research board, try to develop protocols, try to develop joint research programs between the hospital and the nursing college as such, and jointly submit grants. So probably if you have grants application processed like this, there are lots of chances that you can click onto the grants rather than just going as an individual from the College of Nursing alone. And try to integrate nurse researchers into developing informatics program. We always feel that as nurses, we have less of knowledge in statistics and data analytics. So that has to change on. So we need to have nurse informaticians who are able to tackle in a lot of manipulations, not manipulations in the sense, a lot of information can be brought about so that meaningful results are being generated. And this big data is going to give lots of information how we can process further our development with the quality care. The other thing what you can do is you can conduct capacity building program where you train your clinical nurses, coordinators and clinical nurses over there, and the nurses who are there working in the academic sector, train them, build their capacity so that they can translate and transform through each one from T2, T1 to T4, so that better research is available. And you can also do lots of patient assessment, coordination, patient engagement. All these translation modalities can be done. And in fact, we have to accept that clinical nursing research is less developed till now, and we have to go long steps ahead in order to really define our roles. And this is possible only by means of collaboration, when we try to collaborate with other departments, with our own clinical nurses. And the most important thing, as I told you, have to establish linkages. So that linkages can be with your medicine people, pharmacy, dentistry. You can create linkages for them. And this is going to bring a lot of transdisciplinary research projects, which are going to be helpful for the community as such. So these are some strategies which you can use. And you can also develop on the nursing development. And lots of PhDs, I find that they are coming up now. Full-time PhD scholars are there. Now gone are the days when nurses, they used to be working as a nurse in the hospital and then in the college, and then they will consider going in for PhD at the age of 40 and above. And ultimately, when they are ultimately reaching a period of 50, they will take up research, and you cannot find much of output coming from their end. So it is now time to think of young nurse research scientists who are there, able to contribute better. They will take up research in their hands and try to build on the nursing research programs as such. So we have a lot of shortage in the clinically trained investigators. We have to focus on that. And one way to focus is by means of the PhD full-time scholars. Slowly, I can find many of the students are now showing interest in becoming full-time PhD scholars. And these programs are going to be very, very effective in order to bring research for the future, good quality research for the future. An example of the Rush University, what they have done is actually they have got teacher practitioners, and they have mentored the clinical staff nurses, and they've gone in for collaborative proposals, and pilot funding has been given by the institute. And the teams had clinical staff, faculty mentors, as well as graduate students. And they are trying to develop at least 50 clinical projects as being facilitated. And this helped in quality improvement, education projects, and pilot study initiatives. Now, what is more important, the nurses have become part of the projects, and the academicians have now become part of the clinical grant rounds, where invited researchers are now coming in to obtain funding and mentorship. And what they also do is, whatever journals comes up in the college, the faculty donate it to the clinical area side, so that the dissemination of the evidence-based practice is always there. They take some development programs for the clinical nurses, so that the evidence-based practices are immediately disseminated and it is being established in the hospital. So this sort of relationship, or what you call it as integration between the clinical nurses and the academic nurses, is very, very useful. And Rush University has showed us a path to go forward, so that we can also establish such systems in our university or colleges or institutions. Again, lot of talk is going on in this. For the past 3 days, it is on nursing education and how important is technology. And even the last speaker spoke about it, and Dr. Sushila, who has come up next, is also going to speak about this, about education and technology. Lots of technology is coming up, and are we training our students in this technology? We help them utilize this technology is a big question. So what is more important is, we should try to link this education, technology, and research. Now you try to concentrate or focus yourself on research on the emerging technologies, identify whether these technologies has been effective in order to hasten the nursing practice or help in giving better quality care as such. So these are something that we should really work on. Look on the quality of care that is being provided, the working condition, has it improved when we use technology? Has it reduced the cost as such? Now these are questions that is there for in all our minds, and it is more important we take up these questions and try to identify relevant solutions or existing solutions that is there, and we need to disseminate the solutions by means of our publications and conference presentations, so that a large number of sectors, nursing sector, are able to remarkably understand what is the effect of the technology on us as well as for the patients. So how to move forward? Nurses can no longer take a backseat. The time has come for nursing to be at the heart of patient care, to take a lead in the revolution of making healthcare more patient-centered and quality-driven. So this is the current scenario, and we nurses have to prepare ourselves to move forward. And just I'm asking you a question, are you all ready? Now, how do you find out that you're ready or not? Is by just doing this little bit of exercise. For leading this change, what is required is actually I2 and E2. I stands for, one is inspiration, one is infrastructure, and E stands for education, and the other is for evidence. So if you have this I2 and E2, definitely you can become a better researcher. And this is something that all the youngsters over there has to concentrate in order to develop your research potentials. So what are the guiding principles of this I2 and E2? Make an inquiry. Anything, try to ask a question. Don't think your question is going to be stupid. Don't worry about that. Whether it is stupid or very useful, make an attempt to make an inquiry. Ask questions. How, what, when. All these are what you call it as appreciative inquiry questions. Ask them. Remember, we have responsibility. We have the authority to conduct lots of research work, and we are accountable for the patient care. And always be creative. Pull yourself out, become more creative, show your creativeness to the world, sell your ideas. That is the need of the hour, and support creative others. If in case you're bring to your teachers and go to people who are really helping you to develop that creativity. And if in case you find nurses in your wards who are more creative, try to encourage them. Bring those creative ideas outside and believe in yourself. Everyone has something to offer. Believe in them and be clear. Be clear for purpose, what you're doing, the goal you're doing has to be clear, and try to be the change what you see in the world. That is what Mahatma Gandhi has said, is it not? You should be the change first. Unless you be the change, you cannot expect others to change. So you be the change into bringing about changes in research culture in nursing. And when we pay attention, that is what we also get. So clearly be focused on what you want, and almost think about the patients and families. They come first. They matter a lot to us. Without that, nursing field cannot exist. So patients and families are very, very important. And for us students, nursing students are also very, very important. So again, you may be asking these questions. How do I become innovative? How do I become more creative? How do I explore ideas or technology and come up with new ways to use them? So nothing is impossible. All these questions will arise. Answer them. Try to find out answers for these questions. So do you have any creative ideas? Do you have any improvement ideas that you can do it or establish it in your profession or workplace? Don't worry. Put it across. Now, certain common patterns that has been expressed by creative people is they are always curious. They just want to handle or meddle with something or the other. They are curious and they try to learn from mistakes. So if you have committed some mistake, don't bother. Next time it will be successful. Don't bother about that. Just keep on trying. No, sometimes it happens that we have to knock the funding agency's door again and again in order to get a proposal. Don't bother about that. 20 times a year you have written a proposal, it has got rejected. Don't worry about that. 21st time there is possibility that you can click it. So don't worry about that. Try to make mistakes, learn from your mistakes and move on. And then try to go in for observational skills. A researcher should have noticing or observational skills, which is very, very essential. And try to, embrace the ambiguity. If there is something doubt over there, try to chip inside, go inside, identify what is the doubt or what is the unknown and what is the reason behind it, identify that. And cultivate whole brain. You have to think intellectually, intuitively, instinctively, rationalize your thinking skills. So this whole brain thinking is very, very essential. And today there are lots of exercises that promote this whole brain thinking. And you should be flexible. Try to balance your life, both the academic as well as the research life and your service life has to get balanced. And you need to have lots of system or analytical thinking skills, which are essential so that your creativity gets converted into useful research work for the society. Now, there are different ways which you can approach the creative thinking. You can be an explorer. Now, when you try to be an explorer, look at the world. Look what is happening. Lots of ideas will come out. See what is different. So how you think differently is what makes a difference in you. So how your ideas is going to be helpful in order to make a difference has to be taken into consideration. Try to be an artist. Try to merge patterns together. Remove the patterns. Make new interesting things that comes up. Always look at things at different angles. If everybody sees it in the same view, it will not look different. So always think in a different view and you identify how else you can think and use things in a different way. And then be a judge. Try what is the idea, what you're trying to do. You can be actually making assumptions, trying to identify what is the rate of success, the time that you spend on that. So all this will make you as a judge. And then be as a warrior, because every warrior has to reach the goal. And there should be some innate motivation within you that goes on, pushes you further and further, whatever obstacles may come within you. You have to make a lot of sacrifices. There will be failures. Don't get worried about that. But you have to move on. That is the quality of warrior. So if you have all this warrior judge, and if you're able to actually be an explorer, an artist, then definitely your creativity is getting utilized properly. And how to unlock your creativity is try to define what a problem is, generate ideas, select the idea and refine it, put the idea into play, implement it, and identify what is the outcome of that idea. Now, I started with a story of an elephant. I'm going to end again with a story of how to apply your theory into practice. I'm just bringing one more example where a nurse by name Judy is working in a dialysis unit. Now, she identifies that there is a lot of patient inflow on some days, and the dialysis unit is in fact congested. Now, she wonders of a way in order to move the patients through the unit, trying to preserve the safety and quality. Now, Judy has a work in hand, is it not? Now, how is she going to transform this question into better research and then put it on for quality care of the patients? So what she can do, what she will do is data gathering. She has to ask more questions, talk to other staff members, investigate how other dialysis units are working, what is the structure in such dialysis units, what is the patient flow and the assignment. So that is what she does. Now she sets a vision or goal. She says that improve patient flow while maintaining safety and quality is the vision or the goal that has been set by Judy as such. And then if in case Judy goes and identifies I2 even and I2 and E2, she identifies what are the defining roles, practices, standards, mission and vision. And she also tries to engage the stakeholders. Stakeholders are the other nurses who are working in the unit, the patients who come there, the family members, all of them are being taken into consideration. An action plan is derived. Now, when she puts in all these things, she also considers various domains, because when you try to identify a solution, it is just not one stopover. You have to think about continuation of that intervention for a longer period of time so that you have a change in behavior. That is what is more important. So you have to think about clinical, technical, interpersonal relationship, and creative and critical thinking. So two important nursing thinking skill that is very, very essential today is clinical judgment and critical thinking. So these two C's are very, very important as a nurse, and we have to utilize all these things so that we can bring solutions for the problem. So again, you have to identify the success, the operationally defined success with the vision has to be considered, the vision of the institution, and the outcomes, what you measure, it should be more measurable format. So this has to be considered also. Now, Judy is trying to apply the PDSA model by Deming, again a quality model where P stands for plan, D for do, and S for study, and A for act. Now, what she does is she just identifies what will be done, what can be done in order to ease the situation in the dialysis unit, who will do it. She gathers lots of data. She does what you call it as force field assessment. What are the forces against? What are going to be the barriers? And then she tries to develop a plan. And once she develops a plan, she implements the plan with the support of their administrators, and the education that is necessary is being implemented to other nurses also. Then she studies whether the flow has improved or not, or has it become worse also. She tries to study that, also taking into consideration the patient safety and the quality. So maintenance of all these things, she studies the outcomes, and then she analyzes and checks whether there are positive results, unexpected benefits, no improvement at all. So based on that, or some obstacles have come up. So based on these, she's going to act. If it is positive results, well, it is with the support, they are continuing again. If it is some unexpected things that has come up, again, go explore, again, recycle. Once again, the cycle has to go repeated again. So this is how Judy is working in order to bring solution in our unit so that patients do have a comfortable time in the dialysis unit, and their quality of life is also getting better. So I just want to say that exceptional patient care has its roots in research. We cannot forget that. And again, you have to trust yourself. Each one of us has to trust ourselves and explore. Always, I just go with the words of William James, who said that belief at the beginning of any successful undertaking is the one ingredient that will ensure success. And the Gallup the poll has always identified successfully for 16 straight years in their country, nurses have become the most honest and ethical profession again and again, and they have did it 16th time. So if they are able to do it, it's possible even amongst our own Indian nurses. And it is more important, we keep the trust of our patients by giving them care, which is more ethical, which is more quality oriented, which is more evidence based. So it all depends on we as nurses if we do research. Thank you for the opportunity. I really thank Dr. Kanyamal and her team for being so supportive in order to organize such a beautiful webinar. And thank you for inviting me over here for sharing my thoughts. Thank you.
So thank you, Nalini. So it's a very brainstorming for all our nursing fraternity, from student to top level administrator. So to have a high vision in the nursing scenario, particularly in research. So everyone, research means we will take back. So it is a very hard hurdle they used to feel. A lot many hindrance when conducting research also. So in terms only what I believe, so that nursing is care oriented profession, and caring, and we are a technologically peered profession. We are not now only, we are emerging and we are touching with technology. Very rightly you have explained about the collaborative researches in the field of public health, and then the biotechnology and pharmacy and other field. Along with that, we can do marvels, because simply doing caring means only that is descriptive or some quality aspect of study, evidence based. We are not a little bit away from the technological evidences, or outcome based research is more valued in funding and other agencies. So that's what that hindrance it might be. That is my belief. So, but we have to outbreak this. So that is the one we couldn't able to project more much in this area. But anyhow, the collaborative way of doing things, it will bridge the gap, I think so. And a lot many ideas you have given. So from the beginning, the population from urban rural differences and what all health differences between the urban rural scenarios, and again the certificate courses of upgradation of the nurses at the bedside, so that it is a thought-provoking thing for all of us. So that there we are in weakness. That's why Indian Nursing Council also it is emphasizing the nurse practice, the integration of the nurse education and practice together. So a few institutions it is starting emerging, but in the COVID era some barrier again. So we have to cross the barrier and we have to bring into changes. So having a bridge between the education and practice, and with collaboratively with working nurses, and then from the education side, we can do marvels in the clinical trials and clinical studies and ideas, and the care bundle also you told it's very, very vital for our nursing. So I think all the young budding students and nurses, faculties and administrators, definitely we will put into a good form. The future is in our hand. The nurse's voice will be speaking out. So that is my belief, and we will do it for the future to improve our nursing status in India, as like in other developed nations. So definitely all the administrators also will have a good vision towards the research, and increasing the applying of the funding agencies, and we have to improve standard of nursing and image within India. So this is the main, so apt topic. It is, you have delivered apt content to this forum. So it is an eye-opening to everyone. Thank you for the very good presentation, Alini. So we are so blessed to have.
Permit me to pass on my respects to Dr. Ravi Kumar.
Sir is there. Sir is there. So, sir, good morning, sir. Sorry, sir. In between. Come.
Good morning, everybody. Nalini, welcome. Welcome.
Yes, sir. Yes, sir.
Thank you so much.
Sir, that's what, sir. I made that inaugural in between, so that the other person, so that Nalini also can able to view you and she can participate in the inaugural session. So that's what, sir. And recently only I just received a call from Registrar Tamil Nadu Nursing Council, Dr. Annie Grace Kalaimati, and she is having some important work to go on to the secretariat. In the morning also she gave message, okay, I'll come. And now in between the presentation of Nalini only I got a call. So I got this thing only, she conveyed her message and best wishes for the program, sir. And she requests you to proceed over and complete the inaugural session, and following sessions we will take care, sir. Yes.
Dr. Nalini, another familiar face.
Yes.
Sugna, hi to Sugna also. We miss
Mask,
both.
mask. Can you able to remove mask for some time? Show your face to Nalini.
Mask எடுக்க சொல்றாங்க. Mask எடுக்க சொல்றாங்க.
Hi, Sugna. Nice to see you all, both of you.
Thank you.
Yeah, we will welcome you here to see us in person. If you come this side. Very, very fond memories of our association in Ramchandra. I think
Yes,
Nalini was another backbone in the IQAC as well as in the education department, both sides.
Yes.
Where I worked very closely with her, and she was an asset, and
Yes.
she continues to be remain so. So now we are borrowing her expertise to nurture our nursing education in this institution also.
Yes, sir.
So always welcome. We can start, madam.
Yes, 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 we'll
Thank
start.
you so much. The journey which I had with you was remarkable, and you had given me plenty of abundant opportunities to prove myself. So I should be thankful for the support and guidance that you have given me all through my career, and I owe a lot for that to you, sir. Thank you.
Thank you, ma'am. Thank you, Dean, ma'am, for your comments. Dr. Nalini, ma'am, your session was highly informative, it was compelling, fascinating and
feeling. I
comprehensive.
have self-knowledge all working today. Ram for years, he was there.
We value your voice, ma'am. As you stated, nurses, we know that what we need, and we need to collaborate with the engineers or technologies to design devices, new devices for our use. It is true, ma'am. And we also, the valuable strategies for improving research through academics, valuable points you have given us. It was highly motivating. And you also gave us insight on application of research. Thank you so much, ma'am, for your presentation.
So in future, we will also get some of
ma'am.
the help. Yes, some of the
Yes, ma'am.
help for extending our education units. Sir has developed many of the committees and units over here after taking up charge over here, and for the quality cell and many other things he has introduced, and we will take help if necessary. So for the development of nursing. So I think Nalini will support for us. It is true, yeah.
Ma'am, the
And
support
Sir is giving, yeah. So Sir is giving too much of ideas, but while implementing some of the issues, and if it comes, then we can get some help if necessary. So that I believe she will extend. Yeah. Thank you.
Start, ma'am. Shall we start, ma'am?
Yeah.
Yes, ma'am. A very pleasant good morning to all. I take the pleasure in welcoming the dignitaries, Honorable Provost Chancellor Medical, who sir is here to grace the inaugural session, and all connected online for the inaugural session. Now I request respected Dean SRM College of Nursing to offer the welcome note.
Yeah. So here it is my privilege to welcome our Honorable Pro Vice Chancellor Medical and Health Sciences, SRM Institute of Science and Technology. And Sir is having his credit. He is a former director, head of the Department of Civil Services, ENT, Dean Education for 12 faculties in Sri Ramachandra Institute of Higher Education and Research, deemed University, Chennai, and member of Academic Council, University Development Council, Advisory Councils, and Board of Studies. Sir has many awards and positions. He posted that as a Center for Air Command Silver Medal for the first rank in MS in the year 1985, and National Travel Fellowship Association of Otolaryngologist, it's of India, 1991. Dr. P.N. Berry Travel Fellowship UK, 1992 to 1994, and GOC in Sea West Commendation Guard, so in the year 2002, and member National Academy of Medical Sciences in the year 2009, and fellow National Academy of Medical Sciences in the year 2015, and the fellow of Royal College of Physician and Surgeon of Glasgow in the year 2017, and assessor for NAC, a National Board of Examination member, Bureau of Indian Standards, nominated member, Planning and Development Board, Sri Balaji Vidyabit, deemed University. Yes, and Sir, in the area of research, he has more than 85 publications in national and international accredited and indexed journals, and 132 conferences presentation, and more guest lectures. PhD guide of many scholars he has completed, and co-guide for 4 scholars also, and research project completed 3, and ongoing projects 2, it is there. Yes, research ambassador, mentor for the University of since 2017, and current focus he is having is the unit of cochlear implementation, the director of cochlear implant program in Sri Ramachandra Institute of Higher Education since 2006, and has that laryngotracheal stenosis nose protection devices in medical education, and hearing awareness camp in the districts of Tamil Nadu for children with a hearing impairment. Out of which, for within last 6 months of his tenure in SRMIST, Sir has improvised all the medical and health sciences together, and we have like home feeling with the medical department. So we, Sir always give equal respect for the medical or the health sciences, all the discipline deans, giving more essential importance for each and everyone. And he has created alumni separate chief coordinator from health sciences. That is that it shows his generosity and giving equal respect to people. And again, for the deans, all the units, we have developed our own education units, and then the quality cells. And now also he has sent some mail to having another committee, a placement cell. So like new avenues, he is giving importance for all, and including various cadre of people to promote leadership within among the healthcare profession. That is maybe each discipline, nursing, pharmacy, and dental, physiotherapy, occupation therapy, and medical education unit. Now it is vibrant. All the units are vibrant under his control. And I salute Sir for his extended service in the SRM hospital specifically. Every day he is extending his good service in COVID scenario. That is innumerable thing I can. So a very right person. He has taken over charge, and he is very committing to the hospital for the improvement and the education side of the medical. So improving that medical college side also, the enhancement of medical programs, and as well the quality standards, NABH and all other, it has to be established in the hospital. So that is his vision. So a lot of work. So Brian, even that yesterday night also I saw that mail. Very late night also he is very meticulously he is responding to mail. So equal respect to all individual. So that I salute on behalf of all our nursing fraternity. I salute for that, sir. And I really am happy to welcome you, sir, for this faculty webinar sessions. And this is also because of sir. So all the medical and health science units, we have enjoyed all. We are conducting the webinar session 3 days, 4 days, like each discipline. So got the license, and immediately whatever we ask for anything, immediately he never say no, but he always look through, make it possible. So that is his vision. So that I learned from sir. So from this short time experience, I learned a lot, and from his good vision. So really, this is really everyone we need. We are in position to salute, sir. On behalf of everyone, I am saluting to you, sir, for a good health and extended help for SRM. As like Ramachandra, what all the contribution you might have done, might be Nali might be knowing more. So because during my tenure, I was not having that much of awareness to do. After that, you have established a lot many things in SRMC, I heard. So now the SRM is having that fortunate, and we will also develop along with your vision and guidance. I am welcoming you for the inaugural address, sir. Thank you.
Good morning, everybody, once again. And really a very warm welcome to all of you again. Thank you, Madam Kanyamal, for such an elaborate introduction.
It's very brief only, sir. It is brief. It is not elaborate. It's very brief.
I am one of those people who like to be quoted less and quoted more for actions. Anyway,
yes, sir.
Thanks a lot. You expressed your admiration.
This is my happiness. So sorry to interrupt, sir. All of our nursing fraternity should know about the contribution. That's why I would like to say brief only, sir. This is not extended thing. It's very brief of yours CV, sir. Micro CV.
Thank
yes.
you.
Yes.
First of all, I thank the dean and the faculty and all organizers for having invited me for this inaugural function.
Yes.
This is not your first webinar, but you're innovating every time. And this has got relevance in the present scenario.
Yes.
The theme is very good. Nursing Reformation in Technological Era. Education, nursing education, practice, research, and administration. So you're encompassing all the aspects. And then you're going on to teaching and learning in nursing, traditional versus learning management systems. So you are trying to not reform, you're trying to
Yes, sir.
evolve to a different level, which is very welcome. So as of date, today is the 14th of July. I've completed, I think, about 5 months in this institution. I joined on 14th of February. And what I have noticed here is there is tremendous potential among the faculty, staff, and students to evolve to a different level. And my role has been only to tap that talent, try to stimulate interest in this potential leaders, potential researchers, potential teachers, and bring them to a level where they should be. Opportunity does not knock twice. So when you get the opportunity, grab it. This has been my motto in life. So here we are right now at the crossroads of a technological breakthroughs, technological improvement which is happening across the world, which was anyway going to happen. It was evolving slowly, but thanks to the COVID pandemic, everything has been fast tracked. A saying which I often quote is from the former CEO of General Electric Company, the largest company in the world, the one who started with light bulbs by no less a person than Thomas Alva Edison. That company executive, his name was Jack Welch. He said that one-liner, change before you are forced to change. Change before you are forced to change. That means as a professional, as a practicing nurse or doctor or whatever, if the environment in which you're working, if the ecosystem in which you are actually living has to force you to change, that is not a good thing. You have to change before you're forced to change. For a simple example, during this COVID episode, pandemic, they are advising you to wash hands. Was it not taught to us when we were children? Were we not educated by our parents and teachers that you have to have clean hands, keep your nails trimmed, and keep the hands clean before you eat and after you finish brushing your teeth, you have to wash your hands. These are all things which are taught in childhood. Unfortunately, over a period of time, for whatever reason, time factor, laziness factor, non-availability of suitable area, toilets, whatever, we forgot all these things. We tend to ignore. So the virus has brought it back into the forefront. Now they are telling you to wash hands, so we are installing wash machine. So you are forced to change. Had you been already prepared, these things would not happen. Why is it that this pandemic is occurring mostly in crowded places? Because the spread is much faster as you get closer and it spreads by aerosol. So maintain distance. These are all basic things. We were told that be careful before you shake hands. I don't know how many of you have seen this practice in the Western countries. In those days when the Western royalty or the people in high positions came to visit, especially the ladies. They used to have a glove in hand before they shook hands with anybody. Today, shaking hands has been replaced by namaste, which is our traditional method. So avoid close contact. So these sort of things which have been reinforced are bringing you back to the point that you have to change before you're forced to change. So basically, if the technology is letting you perform the tasks that is expected of you as a professional, as an individual, as a teacher or a doctor or whatever, can it be done better without intervening close to each other? So the technology is bringing us closer. Today I'm sitting in my office and giving a lecture, which somebody is, like yesterday, somebody was hearing it almost about 10,000 kilometers away. We conducted a exam yesterday, the national board exams. The entire exam was from a command center in Delhi, across 7 centers, and it was done through technology. So technology is slowly overtaking many of the functions which we were performing mechanically. Most of things are happening digitally now. In 1970s, a famous writer called Alvin Toffler wrote a book called Future Shock, one of the top sellers, best sellers of that time, which I also happened to read it. Very rarely I read those books, but anyway, it was a very interesting book in which he had predicted that this will happen. What will happen? Technology will overtake everything. He had predicted about digital technology. He had predicted about digital divide, why certain population would be actually the people with knowledge of all these electronic things, and one will be left out. So in that also he said we have to adapt. He predicted nuclear families. He predicted families living separate in different continents, only meeting up electronically and then once in a way physically. So these are the things which were predicted, and he had advised that we should be prepared for it. So technology is going to play a huge part in our lives. 2 years back, I think Nalini knows, I actually was asked to attend a conclave of vice chancellors in IIM Trichy, in which there was a brainstorming session about how technology is going to impact the world. They called it Industrial Revolution 4.0. You know about the Industrial Revolution 3.0, that was all about communications, internet, all those things. 4.0 is going to take you to a different level. Everything is going to go digital. What will control your life is a smartphone. Now we are making all your transactions, emailing, paying bills, transacting e-commerce, information, you name it, everything is there. Including this conference can be taken on a smartphone. So when we have web meetings, when we have this teleconversations, it's all possible now because video, etc., everything is possible with a small phone. Now, can I hide myself away from it? Say, no, 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 I will not do it. I will do it the traditional way. Which means you are stuck on the old philosophy that you have to meet face to face. I don't know how many of you have served in government. One of the commonest things they used to ask people to do is, if you give them a problem, they'll say, come and meet me personally at this time. Discuss with me in person. So one had to go and wait there for half an hour, 45 minutes, 1 hour. Then when the audience was granted, that other person, the senior official, was busy with something else. And it'll give you barely 1 minute hearing. And then you say, come and meet me after 15 days. So everything took time, everything took a lot of effort to get things done. I remember how many times I had to type statement of case in the armed forces in order to get one equipment, one microscope, one suction. I will type and there will be some mistake, retype. The typist will make mistake, then I'll sit with him and do it. So much of time was wasted. Now we are able to use our time more effectively because of technology. So there is no hiding the fact that technology is going to be there and technology has to be adapted. So the apt theme number one is nursing reformation in technological era, both in the education field, practice, research, and administration. The last example I'll give you is what happened in this hospital where I'm sitting now. Within a fortnight or maybe about 3 weeks after I took over, we got the orders that we have to be ready for COVID, prepare the hospital. And from a hospital which was, I mean, I'm sorry to say, it was not in the right state of readiness for it. So it took a lot of effort to transform it. One of the things I introduced is when I came to know that this is a highly infectious disease, I said we must make sure that infection control policies are adequately followed. First of all, there was no policy, so I had to create the policy. Then explain to everybody and then try to implement it. Since you're all nursing professionals, you all know that in any medical institution, especially a hospital, infection is mostly carried by fomites, clothes, objects which you carry, pens, paper, case sheets. So one of my tasks was to ensure that nothing in the ward, in a COVID ward, should be capable of retaining the virus. And everything which is kept in the ward should have facility for cleaning on a daily basis, at least 3 times a day. Which means it cannot be wooden material, it cannot be paper based. It had to be plastic coated or metal or something which is laminated. So it was a huge effort to convince the nursing fraternity here to remove everything. Then we thought about the case sheets which will be written and which at the end of the day will be brought out, put in the medical record section so that the virus can grow there also. So the innovation which I made, which I introduced here was a voice to text software. Because many people don't like typing the computer. They were not very conversant with typing. So we got a software installed where you speak into the mic or the speakerphone and it converts to text on the computer inside the ward. And the same is relayed through LAN to a computer outside the ward, where you don't have to follow the precautions like wearing a suit, etc., where it is non-infective zone. And at that place, they said we'll take a printer, print out the material, keep everything ready on the hospital information system or the case sheet. And as the doctor and nurse exit after their duty, they'll sign off. So this technology, it took me 2 months for people to get adapted to it. And still there were glitches. Several times the IT person and the nurses and the doctors, they were groomed, they were trained, but still the glitches were there. But we removed all of them. So basic point I'm making is that was a forced change. And the result of that change was the first 3 months of our COVID ward existence, we did not have a single infection in our medical and nursing staff. It's only in the last 3 weeks that we had a spurt of infections. Can you tell me the reason? The cell phone. Because in spite of instructions, in spite of orders, some of the patients who had influence smuggle their cell phones. And that was being passed in and out of the ward. The instruction is very, very simple that everything which goes inside should be either destroyed by biomedical waste disposal or must be cleaned with hypochlorite solution. The only ones who go in and come out are the human beings who are treating the patients, who will wear protective which suit also will be sent off. But the cell phone went in, came out, and the virus started spreading. So once again, we banned it now. I'm giving you these examples, it may be like a story, but this is actual real fact. Because these are the reasons why things don't work. Because you require an attitudinal change in the mindset. Now, after suffering, the people have realized the fault. And now they have again put the ban, enforcing it strictly. And who is enforcing it? The nursing staff. Because they are the ones in contact with the patient and they are the ones who are actually able to control things there. So for fear or favor, whatever it may be, we have to adapt. So this is the message I want to give. So how does technology impact your education? You already got it. You are able to use many of the things which you are doing now. You're on webinars, you're using the internet. But the penetration of this technology is not as much as it should be. I'm not one who says that you can replace everything traditional with this, but you have to blend both. Blend of the old and the new. Don't shy away from the new technology. At the same time, do not forget the old technology, old systems. They have got a lot of meaning. If somebody is listening to Dr. Nalini today, she could have recorded the message and sent it off. But they're listening to her in person because the way she expresses it and the way she delivers the lecture, there's some personal touch. At the same time, there is also a certain interaction which a human being likes face to face. So there is a place for face to face interaction. And that will never get replaced. Practical training will never get replaced. You can have mannequins, you can have everything, but human being interaction is different because the emotional part is still not covered. But with very soon, you'll get artificial intelligence and augmented reality coming into the medical field. When that happens, you will find the level of technology which is infiltrating into our field is going to be higher and higher. But I will again request you not to let it infiltrate into our traditional methods. Till today, the human being, the patient, still wants a human being to treat him, not a robot. So the nursing care should get better by using technology because you spend less time on the same task. Carrying an Indian book and going and standing in front of the nursing matron's office will be replaced by indenting online. You save time and energy. That time should be spent with the patient. So that is the way it should transform. So the finite time which you have should be spent usefully for the purpose for which you are trained, which is nursing, rather than on other things, the administrative things which can be condensed and made a smaller percentage of the professional life of a nurse. So this is my message to you in short. So I wish you deliberate on these things and I wish that you put into practice what to deliberate because there's no substitute to experiential learning, which means you experience and then learn. That is best. Like I gave you the cell phone example. I gave you the example of the voice to text. It was experiential. Now the nurses are well versed in that system and we are able to achieve better patient quality care. So these are the few words I want to say. I'm very happy to be with you today and I wish the program a grand success as it has always been. And you have the good faculty from All India Institute of Medical Sciences, Mr. Raj Kumar, and then Dr. Sushila, Dr. Safrina. So I think they'll make it quite interesting. And as far as SRM is concerned, the medical health sciences, which I'm responsible for, it's in one umbrella, and I have taken this responsibility to raise it to a better elevated position than what it is today. Not that it is bad now. It is just you always try to be better than what you are today.
Yes.
As another saying goes, run your own race. Try to do something better tomorrow than what you have done today. So we'll take it forward that way. And thank you very much for the opportunity, and wish everybody the very best in the seminar ahead. Thank you.
Yes, sir. So thank you so much, sir, for out of your busy schedule, and you have given time to come and share your experiences throughout your career, and as well at present at SRM hospital, and under the field of all medical and health sciences. Really, we are grateful for your encouragement as being an administrator, and we can able to bring challenges and bring changes with your guidance and with your support with practical aspect. So that is the thing. So we are also very much interested in the last day. Yesterday, the participants were 1,600 to 1,700 near the participants, and the panel discussions and everything, all the eminents, they have done their good job yesterday. Also, the session went on until up to 4 o'clock. It's a very good responses from the audience also. So we are very much thankful for that, sir. And for the alumni, we are strengthening the alumni also, so that we are also having it by tomorrow. And day after also, we have a continuation of this session will be there till up to 17th. And I have happiness to include all the principals in and around Chennai. And almost many of the students have enrolled. Due to some reason, some students couldn't able to attend some of the tests, and other thing it is going on. And as per INC, some colleges, they are conducting online tests and other thing. They have some other plans. Probably the students may not able to give full strength and attendance. I think so. So I have to verify that. So yesterday also our teachers have called to all the colleges, and then they told, but maybe due to some insights, today's participants is little less. I am disappointed with this. And yesterday I had 1,700 near the participants. We were very much delighted. So anyhow, so this is not a very less number. Now at present around 900 in the morning I saw, some little one few it is reduced now. Whoever maybe they can able to disseminate the ideas from the speakers and the sessions which you shared also, it is most beneficial for all our nursing fraternity. We will abide to that, and the human care. So we have to take care with that human that response is in our hand. Definitely we will extend our good help towards the improvement of our nursing service also, sir. So that is our wish in future, sir. Thank you, sir, for delivering.
Thank you very much. I'll just take a few minutes off, and especially thanks to Nalini and all the external participants.
I would like to share some points from Sushila. So also she is my colleague, and Ramachandra. You just unmute yourself, Sushila. Say something, few words.
Yeah, good morning. Very good morning to everyone. 1 minute, I'll show my video also so that they can show me. Yeah. Actually, good morning, sir. Dr. Ravi Kumar, sir. I know you also. I'm very happy to see all the eminent persons in the screen in the morning. From morning, I'm listening all the Nalini. It was a very wonderful session. What I have seen you, it is good, very good. And thank you so much, ma'am, Kanimal, ma'am. It was a wonderful effort from SRM College. Always set an example for many things that you are proving in every time. I think this is maybe The lockdown, I think third or fourth webinar, I think the last international webinar also was very, very good. And now also yesterday also I had a lot of feedback from my own students and faculty. They said it was a wonderful session. You people have organized in such a way that everything was actually, Ravi, whatever he said is the one I'm going to tell in my thing, that it's technology in education. Sir, you told everything what I supposed to say, like that it should be blended, it cannot be replaced, and augmented reality. That is all. It's one I'm going to discuss actually in my technology. So sir has already put an introduction for my session. So thank you so much, sir. And thanks to everyone here. And I'll be presenting in the next. Almost I think everyone has shared whatever I am going to speak, because yesterday's sessions I have seen they have spoken something, and Nalini has talked about research and evidence base. That was a great base too. And technology which we are using also, it's going to come, because future technology nursing education, but almost 50% of the technology we are already using. Google Meet, Google Classroom, everything we are using. So I think this COVID, thanks to COVID, as doctor said, the same thing I wanted to say, because it made us to learn a lot of things from technology, how to incorporate the technology in education. I think we set as the example as a nursing faculty. We all have been well through many apps. We have learned a lot. So yet to see, learn many things, and all the best, ma'am, for your program. And thanks for inviting me to say a few words here. And thanks a lot. I'll wait for my session. Thank you so much, ma'am. Thanks, Nalini and Vijay. And I can SRM faculty, they are very much enthusiastic. Every time they are and keep in touch. Every time they'll be in line. Ma'am, please send PPT. Yes. Ma'am, please register. Even now I said, I think I have not registered. So they told me, please register, madam. So they are all very good. You have trained them very well. I think under your leadership, it's going on very good. Thank you, ma'am. And thanks, Ravi Kumar sir and Nalini and all the people here. Thank you.
Thank you, Susila ma'am, for your appreciation. I thank Nalini ma'am for the wonderful presentation, highly informative presentation. And I'm here to propose a vote of thanks. I'm privileged to offer the vote of thanks. We express our sincere gratitude to Honorable Pro Vice Chancellor Medical and Health Sciences for his gracious presence and illustrious address. Sir, we got the message for the day: change before you are forced to change. Yes, it is a message for us. Highly motivational and inspirational words, and very interesting to know about the book Future Shock. The predictions made by the author. It was really informative for us. And on a nutshell, you put a clear picture of the theme and how it applies to our professional life. It was really informative and highly motivational address, sir. Thank you so much. We express our gratitude for your presence here, sir. And I thank respected Dean ma'am for madam's directions and delegations for the organization of this state level webinar. I thank all the expert members for their wonderful deliberations, all the principals, faculty members, student participants, institutions, and from SRM for their presence and then their contribution. Thank you so much. And we'll start the next session, ma'am.
Yes, sir. Sir, thank you so much, sir. In your busy schedule, we will meet again, sir. Thank you, sir. Thank you, sir.
My pleasure.
Yes, sir. Thank you, sir. Yes. Okay, thank you.
Have the expert. Yes, ma'am.
Actually, we are disappointed. Madam couldn't able to come. So because of some official reason, she told in the morning also sent a message. She will come. Okay. And after that, she felt very guilty, couldn't able to come. While traveling, she made a call to me. Just during the presentation of Nalini, only got a call. So she couldn't able to come, and she conveyed the wishes anyhow. We thank Madam all the time. She is so she used to extend help, and actually she wants to come. She couldn't able to come. So that is the thing she told. But on anyhow, you will do it very nicely, and let convey my regards to sir to proceed for that. Like that only she informed. It is for your information. Thank you. Yeah.
Thank you.
Now we are having a very good person as in nursing, and very practical and highly motivated. She never says no, whatever I ask at any time. So that is her nature. So that is none other than Sushila. She is going to talk about the title on what title you are going to talk now.
Future technology in nursing education.
Future technology. From yesterday, all technology. So that's why future technology.
I will not say future technology, technology which we are using. Actually, we
Yeah. Yeah.
I
As
think
a
all the
practical.
technology
So
we are
that's
using now. That's why.
all we are using. Some new innovations, addition
A
to.
few things I can mention here that we can use it later for the betterment. That's it.
Yes, yes. Yeah, we are
I'll try my
welcoming.
level to bring the new things, whichever I have got as an information through technology again. So I'll just
Yes.
share my
All the.
screen now.
So we want to have the knowledge on technology only. Everyone is giving different ideas. Or maybe the speakers, they are giving very good ideas and different ideas only. It is the need of the hour only. Oh, I am welcoming you. Yeah. Yes.
Yeah. Can you able to see my screen? I'm
Yes.
sharing.
Yeah.
Yeah. It's okay now?
Yeah. Okay.
Yeah. Warm good morning to everyone again. So very happy to be here in this webinar. Actually, I miss, the conference presentation in SRM because I like the environment. Always, whenever they call me for conference, I go and present, where meet a lot of friends and fun, all that. But still, it is a new experience where I am meeting you all through this webinar. Still, I am enjoying and seeing all your faces is a motivation for me always. So, and it's a different scenario for me again, sitting and present, taking class. I never do it because always I've been walking, action. Action. And even in the class, I never sit and take. So taking this webinar, I think third or fourth webinar I'm doing now. So sitting and taking classes, it's a different for me actually. It is very difficult, but I will try to make myself to be presentable to everyone. So here the first start with Alvin Toffler. He said the illiterate of the 21st century will not be those who cannot read and write, but those who cannot learn and relearn. This is what Dr. Ravi Kumar just now said. When somebody said do it, for that we must do it.
Susila,
Yes? Yes?
we're not able to see the slide, ma'am. Can you make the slide show, ma'am?
Also, it
My
is.
slide, I am sharing the screen actually. Why
We
you
are
are
able
not
to
able?
see the first slide only, ma'am, not the second slide.
No, I am
You are in.
moving now.
No, it's
Second
not
slide
moving.
already. I am
Ma'am, slide
here.
show,
I am seeing the second slide. So anyway, you have my slides. Can you share it also? No problem.
now we are able
If you
to see,
want,
ma'am. Now we are able to see.
you are able to see now. Yeah,
Yes,
because
yes,
I
ma'am.
actually did. Okay, now you can see the illiterate of the 21st century will not be those who cannot read and write, but those who cannot learn, unlearn, and relearn. That means whatever we have learned, it is there. We have to unlearn and learn because the new practices when comes, that is what we say. Whatever we learn, you have to unlearn and learn it and relearn it. So this is how we should go. So that is what I said. Sir was telling no, Dr. Ravi Kumar, before somebody is forcing you to do it, you start practice. The same way, before something comes and tell us to do it, we have to unlearn and relearn. This is what is Alvin Toffler said. This applicability is for mostly whatever new things or innovative things comes, we have to be ready in adopting, or before coming, we should know something and we must prepare ourselves to adopt. Are you able to see the next slide? Yeah. So, and David Warlick said, we need technology in every classroom and in every student and teachers, because it is not the pen and paper of our time. It is the lens through which we experience much of our world. That means what he is trying to say is, pen and paper world is already gone. Now we need to, technology is the lens to see the whole world. So why we are not able to pick up the things which we wanted and give it to the students? So that is what is which we are going to discuss, how we are going to incorporate the technology to give the knowledge to the students. So advances in technology have had a profound effect. Even today, we are just doing a webinar, means it's due to the technology. We have connected with more than 800 to 1,000 people. The way we learn, the way we teach, as I told you, sitting and presenting. So everything is different because of that technology. We have to go with that. We cannot say no to that. We have to go with that. We have to see the positive things, adopt ourselves and implement the best to the students. See, earlier days, this is what is our day. Many adult learners spend traveling to the library, taking auto or taxi, even that time it was not much, but still we used to travel to the library a long way, and we have to have a card catalog and spending countless hours looking through paper-based books and journals. That was our period. Now, if you want, if you are taking a class also, if students are allowed to have a cell phone, immediately they search through Google and they will get all the informations. Now the technology has been widespread for the people to use the technology. Now the days has been changed. So I think we are having a lot of books in library, and the storage itself is difficult. Infrastructure is difficult. Now I think we all can go with e-books, e-journals. That itself we can modify our way of preparing the students. The students can have access to the e-books, e-journal that they are already having. Additionally, this is available. Earlier days, this was the only thing for us. We were not having the technology to do the other things. So here, evolution of learning, just for you, use of technology for teaching and learning. The first starting was blackboard and chalk, then whiteboard maker, it becomes whiteboard. Then it becomes a transparency slides and overhead projector. Later it becomes PowerPoint. See, till this COVID comes, and many of the institutions were stopped with the PowerPoint presentations using a computer, LCD projector. But now a lot of things have come newly, like computer assisted instructions, where all the computer is going to help the teacher to instruct the lesson whichever the students wanted. And web-based learning, lot of things web-based learning is there. I will tell you lot. I mean, whatever the web-based learning and teaching tools are available in my coming slides, and video conference, e-classroom, wireless technology and innovation technology. A lot of things have come as evaluation of learning, but we are going to see from computer assisted instructions, web-based learning, teaching tool, video conference, e-classroom, wireless technology, and what are all the other innovative technology that we have. I think half of the slide is going, no? Why it is like that? Because of this photos are coming, slides are just hiding, no? I don't know how to make it to the center. Okay, the current methods of teaching in nursing, that what we have is, now we do lecture, we give clinical scenarios, we make the students to do the case studies, problem solving, team-based learning, group activity discussion, and even quiz we conduct, assignments, panel discussion, health education through OHP, LCD, charts, models, like that. We are using a lot of methods to teach the students. But now this all is not possible right now. The lecture also we have to use the technology, clinical scenarios through technology, case studies we can give through technology. Like everything can be given through web, or using a technology you can make the students to do from their own place. All these are still continued. The only thing is, all you can put the one word before is e. All e-lecture, e-clinical scenarios, e-case studies, electronically you can do everything. Team-based learning, everything is through technology. You can incorporate with this current methods also. We are not omitting these methods. Even now what I'm doing is a lecture or explaining things, but it is through different scenario, like it is through web. So technology is incorporated in all these methods of teaching. It's not going to be omitted. As I said, blended. You cannot omit any of the teaching methods here. You have to incorporate technology in each method and let them learn it. So what is the problems in the current educational system? Why we need technology? See, poor infrastructure doesn't mean that we don't have a classroom board or whatever. See, even 100 students will be there sitting in a class, and you can see the students, some students will be able
Your voice is breaking.
Jillian?
Ma'am, the net problem is stuck right. Susila ma'am, network issues, ma'am. Susila ma'am.
Yes, what happened?
Ma'am, network issues, ma'am. Madam, I'm disconnected. Hello, ma'am. Yes, ma'am, you got disconnected. Ma'am, connect பண்றாங்க ma'am இப்போ. Ma'am, connect பண்றேன்னு சொன்னாங்க ma'am. ma'am connect பண்ற வரைக்கும் வீடியோ போட்டுருக்கோம்.
She left and she has to join back again.
Yes, ma'am. Yes, ma'am.
Due to network issues, ma'am is not able to join. She is trying. Anyway, in between, would like to share few information to the delegates. Tomorrow, SRM alumni is organized webinar from morning 8 a.m. to 3 p.m. Registration need to be done separately by everyone. Those who want to participate in this webinar, registration link is shared in the chat box. Attendees of alumni webinar will receive feedback link to your mailbox. An e-certificate will be mailed to your inbox after submitting the feedback form. Today, attendees will receive the received feedback link for today's webinar, and also the webinar link for 17th will be shared in that mailbox. Okay, you kindly keep in touch with your mailbox. Everyday feedback link will be opened at the end of this final presentation. So it will be closed at 6:30 p.m. Please take 5 minutes to submit your feedback.
The fact of being a nurse is something of very much pride, since between the responsibilities that we have, the import more they are to preserve the life, to relieve the suffering, and to promote the health. Being a nurse is not an easy job. A profession focused on the health of people requires a lot of preparation and human quality, and that's why studying becomes essential to accomplish our career goals, and at the same time, it provides us with the tools needed to grow and become
created using Powtoon.
Sorry for the interruption. Actually, some problem is going on with the net here. Actually, I connected even my hotspot. Still, it is.
Now we are able to hear, ma'am.
You are not able to hear me?
No, ma'am. We are able to hear you.
Okay,
Yes,
okay.
Yes,
But I want to share my screen.
Yes, ma'am.
Shall I share, ma'am?
Yeah, YouTube live is on.
Yeah, you can also share, but I want to share my screen. 1 minute. I am just trying. Hello.
Network issues நான் ஷேர் பண்றேன் மேம்.
என்னோடது பார்க்க முடியுதாடா?
இல்ல மேம் ஷேர் ஆகல மேம்.
இல்ல, you are able to hear my voice, but
yes ma'am, your video is also there, ma'am. Video.
1 minute. I am just trying to open my.
No problem.
I'll share ma'am.
I share, but I am not able to see the screen. என்னோட இதுல வரலையேடா. உங்களோட இதுல எனக்கு வரலையே.
ma'am, we not started, ma'am. We'll start, ma'am.
இல்ல, I am not able to see them also, no. பாரு, எனக்கு எதுமே வரலையே. I'm not able to see them. Then
just log out and then come once again inside. Shushila ma'am.
I'll just go out.
Just leave and log in once again.
Yeah, I did also. I re-log in actually, but still again it is something is wrong.
You can refresh and you can start, ma'am.
So far it has not happened to me even once, and now this is the technological issues. I'm so sorry for that.
Lot of patience is required to handle
Illa ma'am, I don't know, really this is too bad. Yeah, just close it anyway. No, close it and we'll go back again to new one. This also you close. Mail also. Let it be down. Yeah. Now I can share. Where is the screen? More. Share my screen actually. Okay.
Can I share, ma'am?
Share screen. Yeah. I will share. Okay. It is coming now.
Okay.
PowerPoint. My screen is not sharing, huh? No.
Yes, ma'am. It is not shared, ma'am.
I am sharing actually, but 1 minute. I don't know. It is okay. Share 1 minute. I am sharing. Okay. Yeah, now you are able to see.
Ma'am, it's still loading.
Coming. Yeah, it will come now. I am really sorry for that. Something happened terribly. Still reloading, என்னடா இது? Too bad. Technology பத்தி பேசும்போதே technology problem.
அதானே, அத பத்தியே தான் பேசிட்டே இருக்க வேண்டியதுதான்.
அது என்ன ma'am? What is this ma'am? It is too bad. I am so sorry for all the audience.
No problem. It will come.
Sorry, ma'am. Sushila, ma'am.
Don't get panic. Yeah,
actually, since you have network issues now, ma'am, again, if you are going to share, it may get disconnect, ma'am. So we will share, ma'am. Which is your voice. Your voice is very clear.
Then you can share also, no problem. I can see my slide and speak. There is no issue.
Yes, ma'am. That's what, ma'am.
I'll share.
You please share.
Yes, ma'am. We will share it from our side, ma'am.
Yes, ma'am.
Mine is coming already there, da?
Yes, ma'am. It's coming, ma'am. You can see, ma'am.
So shall I continue then?
Yeah. Okay, ma'am.
Na thirumba late aayida.
Okay, ma'am. Slideshow, ma'am.
Other session.
Yes, ma'am. Slideshow, ma'am. Because a slideshow.
I will make it slideshow. Yes. Yeah. Okay. So the problems faced by current educational system in nursing is like poor infrastructure, as we said, and low accessibility. Like once you taken a class, actually it's like a rat race, we say, because a teacher entered into the class, the 1 hour is given, and she wanted to finish her topic, and she will just take and go. The student who is able to take notes, maybe she will be able to take, but the student who is not able to take the notes will be missing something. But here it is not like that. Now you are doing a YouTube live recording, and this any teaching can be recorded and students can view on their own pace. It will create a personalized learning for them. That is what we are saying. This technology will help them. Not that rat race is not going to happen here. Whatever I am taking in 1 hour, they can view at their own pace. So less content we will be trying to give within the 1 hour. But here you can give more content. If not, also they can access later also, and they get more content with the whatever we are taking. And with that only system, low pass rate was evident. With many researchers have told, without technology, classroom teaching, the traditional classroom teaching is bringing only low pass rate compared to the technology teaching, and no continuity will be there, because you are taking a class and you will be just after maybe next day only that particular period is going to come after 1 hour, and you will be just moving. But E is not like that. Even if you are taking like a series, it can be created as a continuity learning, and it can be given to the students. Like chapter 1, chapter 2 will be edited and put it in a one pace of learning. So this technology helps the students so much than the traditional learning. Yeah. See here, the knowledge is actually knowing that is declarative. That is a cognition. Everyone knows it's a knowledge. And wisdom is knowing how. It's a procedural, it's an application. And transformation is knowing why. It is critical, where we have to do the analysis and evaluation. So nursing needs all these. We have to be declarative, we have to be procedural, we have to be critical. We need to have the cognition, we need to have the application, and analytic and evaluation. All the skills we need. The nursing needs all. And when we are having all these, they are telling the transformation through technology is always better to achieve all these aspects. And this person has said, Albert Einstein, you all know he is a great philosopher and educator. He said, I never teach my students, I only provide the conditions in which they can learn. So instead of just going into the class and taking everything and coming back, you provide the conditions, you give the content through whatever the mode they are able to learn through some of the technology, where the students can go into that on their any time, any place, from any place they'll be able to access. Means he's telling that the learning will be the better. He is told long back. He's just meant about the technology. If you see this picture, technology we are talking, but we are far away in education. Technology is somewhere, education is somewhere. The blending of this old and traditional and technology yet to take, because it's long way to go that particular technology and educate the students. And this what it does. Already I have told many things in this. It's a one-stop access to every information, because in one place, if you just stand and get all the informations. Earlier we have to search for the teachers. As I told you, we have to go to the library and get the books, all that. But now it is not like that. You can sit, just open a mobile and you can do everything wherever. Where is the restaurant? Where is the railway station? All that is coming through Google app. Everything is coming. Same way, whatever the material in education, you can just get through whatever the app you are just going to open. You are going to get it sitting at one place. And regulate information, immediate feedback. See, whatever the information you are getting or sharing, you can just get the feedback. Ratings. Everywhere the ratings are there, like this material is good or bad, or this can be taken, or how many people have viewed that particular information. So that tells us that this information is correct. I mean, we can take, this is a logical, rational, all that we can take for particular information. And this helps also the technologies monitoring the progress, instant grading. If you just, even now pre-test, post-test, everything is through online, they can do it immediately. They know what is the progress. They can repeat the test. The option is to learn completely till they are achieve the perfect score. That is how we just feed materials into the apps. And artificial intelligence is the one smart things. There are many projects in Google. You can ask to the Google, you can ask some Alexa projects are coming through Amazon. There are a lot of projects coming as artificial intelligence, where you can just put your questions and you can learn, and you can disseminate your knowledge also into that. You can interact actually. one concept if you want to search, and what you know about that you can say, and what you do not know will be told by the artificial intelligence apps. That is a great interesting learning. It's not that whatever you know will be repeated. So whatever you know you can just tell, then whatever you do not know will be given by the apps. That is a particular artificial intelligence apps are there. The softwares will be giving you all that. And you know that video lectures, visual examples, virtual field trip, gamification of educational concepts. Gamification and all we have already started, like puzzles, mnemonics, and quiz competition. Like that, we have started some gamification where the students shows a lot of interest in learning. And mnemonics, we create mnemonics, we create puzzles, we told them to put the missing words, like some sort of gamification we have already started. And if you are giving that gamification into the mobile or something, they'll be better in doing that. Okay, so that is what is very interesting one for the students to learn. And things technology can improve in education is already, you know, open education, limitless supply of knowledge, which I have told you, better progress monitoring and larger audience like here, and better retention. If they do not know, they can go back and see again and again, and they can store it somewhere. They can learn whenever they wanted. And better interaction and collaboration, it is possible, because when you are learning, there will be an option like, if you do not know, if you are not able to perform, what is your difficulty, you please tell. Then it is just tell us what we can do further. And learning at own pace, as I told you, and better engagement. Students will try to complete it, because unless you complete one, you cannot go to two. So that is how the apps has been created. So what they have to do, they have to complete the one. Unless you finish the pre-test and score 80, 1% pre-test, if you complete, then only you can go to the content. Once you finish the content, then you can go to the post-test. Unless you complete certain score, the prescribed score is maybe 80% or 70. Mostly technological learning goes above 80%. So above 80%, if you get only, you can go to the chapter 2. So this will tell the students to have a better engagement. They will come again and again till they focus it. You can see the picture, the center achievement. So, and you can see shooting, no? They wanted to shoot at the center. Unless otherwise they go to the center, it is not complete practice. The same way, the better engagement will be given by the technology. The technology will never replace great teachers, as I said, but technology in the hands of great teachers is transformational. So as a teachers, we supposed to learn the technology, and we have to transform the whatever the knowledge we have through technology. This is will be catched more easily by the students. See, if you know that, what was the first attempt on distance learning? We are talking about distance learning started now through many, now because of COVID, we are all teaching distance learning. Earlier, we were just talking in front, face to face. So distance learning started, if anybody can imagine which year it might have started, I will tell you it is 1968, before we born. It started, Stanford's Instructional TV Network was giving this as a distance education, where students all started listening this. It's a university, even the medical university, it was giving all the instructions to the students, how to, even simple procedures like hand washing, simple procedures like how to take the vitals, all these were given through Instructional TV Network. There was evidence there, it is there. So 1968 only it has been started. Later on, 1970, the video cameras, so the video classes, like now we are talking about YouTube, the same way the videos were recorded and it was given to the students in 1970 only. And 1976, you can see they all were having a disc-like form, and their materials, each chapter will be recorded and given to them, and they will try to learn. These people actually in the war area, I mean, like they were in the some war, the Korean War, I think. In that war period, what happened, their teachers were not able to meet the students. These are all nursing students. So they were actually giving a recorded materials to them, folded in as a disc, number one chapter. So they were learning in that area, sitting in that area. That time they were having only this type of materials, like you can see side, like even now we are having this, how to play the video, CD tracks, all that. So that time they were having this like small cassettes, With that, they were sitting and learning whenever they are able to learn. So it started in 1976. Then later, now it becomes all, you have to come to the class and go. This learning pace we have not given in between, but it started in 1976. When you look at the history of technology, it was very interesting. We are very late actually. 68 and 76 it came. In 72, this person is actually discovered a web. He was telling this is for everyone. Sir Tim Berners, he inventor of the World Wide Web. That time itself, he created a web and he said this will be useful for everyone, because that time every school or every organization was creating small videos, cassettes, all that, and it was distributed to their own people. But this person was thinking why it has to given to only the institutions who are able to make such instructional materials. Why not for everyone? How this material will reach to everyone? So he started creating a World Wide Web. That is what he has done. That is in long back he did. And 72, this person was telling the current search for new educational funnels must be reversed into the search for the institutional invest. Any institution want to take up, they have to go to the educational webs. There should be an educational webs where it will be heightened the opportunity for each one to transform each movement of his living into one of whatever I know, it should be told to everyone. And everyone, every information, every knowledge I gain should be shared towards caring. This was he predicted in 1972 itself. Then actually that time the web and all was not much familiar to every people. Even nowadays, you all know in 2000 era only we all started having mobiles and we started learning. That time we were not having much. But 1972 only these people are predicted to share and learners to learn, and even learners can share and teachers can exchange, and teachers also can learn through. That is what he said, inverse. So this is how it should go. So he predicted long back and it came later. You see this picture, the first mobile phone. Can you guess what is it actually? We learn by doing. But we make our students to listen to us and take the notes and make them write. But actually, learn by doing is applicable only for practical, we say. So we make the students to do it, and learning was possible. But now what they are saying, you having the technology, you give the people the learning material, they will try to create in a way they can learn, in a way it can be improvised, in a way it can be done easily by them. So every person will have their understanding of that material in different way. For that, he has said people can easily do learning by doing. So give it to them, they will practice by themselves. Even the practical things will be uploaded in many apps. It is there, which I will be telling you. So that was predicted long back. And we learned by making was 1960. So students agreed, yeah, we learn much better by, if we are doing by ourselves, we are doing. But learning by making, learning 2.0 user generated. You all know there is a 1.0, 2.0. 2.0 is the next generated version of learning. Learning by making is a learning 2.0. Now we are actually in the 2.0. Even we have gone up to 3.0, where we students, it's not user generated. It's actually everyone's able to use. It's a friendly user. We can say friendly user. Learning 3.0 is actually, it's come a acceptability. Every person has to accept that and learn. That is how it has come. So learning 2.0 is a generation which we are going now, and where we wanted to make everyone as a user generated one. You all know traditional classroom. I'm not going to explain flipped classrooms, which you know that where like this. The teacher can teach from outside and students will be sitting in a class and they'll be taking in notes and guidance will be given to them. Flipped class also long back it has come, where we don't get expert teachers into the classes. It will be given through video, podcast, book and website. It will be given and students all will sit in a class and they will be working towards, and the applications, I mean, they will be connected to one video or like video conference. There they will be writing all the notes and everything, and students will have a supporter in the class where the supporting will be given by the people who are present in the class. The flipped class also become very famous in the 2000 era, where many organizations, many distant education institutions have started using this. And like this, the students were taking notes in the flipped class where they don't write or do. They can just take a notes through their mobile. But nowadays we are even not allowing the mobiles into the class and whatever. But actually flipped class started in 1980s, where the people were taking just like that notes from the classes. I think we all have to allow, all the principals should think that the mobile should be allowed for the students. So the retention of the content is good. That's what they are telling. If you allow the technology, because the rat race, as I told you, when we just set the content, they'll not be able to take the notes. But this one, they can record and use it. See, there are so many things in technology which I'll be telling. The people thinks it's a huge, as I told you, the technology gives huge opportunity to learn. But there is other side, you know, now there is a lot of cases are going on, like people are using in the online, going into different ways. So many videos are coming, misusing the apps, misusing the videos, misusing the mobile, all that is coming. We people thinks it's a huge opportunity, and we thinks that it's a threat to touch. Actually, what is that? Is an opportunity or threat? It's one nothing, but we have to balance it, which I will be telling at the end for you. See, in Turkey, they have like FETI, one project they have started for the students. They have loaded all the materials because of this like pandemic situations. They wanted to give all the material for each student in their own tab, or one tab is given, like tab and small MacBooks and all given to them, where it is all the content is loaded individually for the students till they read. The other content will not be given to them. So this was very helpful to them, that they said that instead of instructional classes, this was very useful, and many students have scored much, maybe many of them, like more than 80% of the people have scored 80% of the marks in the classes. So they said this type of teaching is very good. It's not a threat, it's just an opportunity they have proved. So you can see now in the houses are going on like this. Everyone is using a mobile. Even if you just go to the beach or park or railway station also, you can see the student, all the people are using mobile and laptop in the houses, everywhere, because the technology has merged into our life, and we see that they are using in a proper way. See, now we have come to even to the is what is that convocation, e-convocation. Just now Vinaha mission is conducted virtual convocation, where the students been convocated through virtually like this. So this all is possible. Then why not that teaching practical and theoretical knowledge to the technology, through technology to our students. So we have just going to see some technologies which are very useful for our students to merge. Even now we are using, and future also some technology we can incorporate. What is that? Video conferencing. Now also we are using video conferencing, where video teleconferencing, we can use audio video equipments, which we are doing now. So I'm not going to explain much. So here audio and video communications, like students all will have their material, like laptop, everything will be given to them. And there will be a screen where the instructor will be talking. Now, you know, every student, whoever is listening, will be sitting in front of the computer or video and the mobile, they will be having it. So through that only. So it's similar only. Through that you can teach, where many students from many distance, Sir was telling, no, even 800 kilometers away. So we don't know how many kilometers away people are listening to our classes also. So it is possible by this type of webinar and video conferences, two-way talking. You can talk to them and ask the questions, like surgery will be, any surgery or any procedure will be taught to them lively, whichever is going in the theater, with the consent of the patient, it will be taught to the students, where the students can visualize, and one instructor will be standing there and explaining what is going on inside, because the procedure will be shown, but instructor is needed there to explain to the students. So where the students all will be listening, and they can record, and the sessions can be archived also for the future playback. This is what I said, the retention of the content is very good when you are using a technology, where the students, even the poor students or shy students who don't want to ask the doubt in the classes, will go back and replay the sessions, and they will be able to see what is being not understood by them. And this is all another technology which we are using always. It's not only helping presenting lessons, but also with the management. This is used for preparing lesson plan, completing grade book, checking email, preparing letters. See, earlier days, even now we are using cumulative record, internal assessment register, everything. But now they are saying everything can be put only in online. Like universities created a teaching and faculty management system, and our institute management system, learner management system. There are many management system has come, where you can put all the details into the computer and you can reserve. So this is already going on in a, I said 1968 it started. The destination have a synchronous and asynchronous approach. Synchronous is nothing but live lectures like this will be delivered. Now what we are doing, like I ignored lectures are delivered through TV channels like Jian Darshan, and INC is conducting contact classes for PhD nursing via video conferencing at 6 centers in India. So distance education through synchronous approach is possible like us, and asynchronous approach is recorded videos or printed materials will be given. This is actually they will be given to this material, recorded videos and printed materials will be given to the students, or it can be through sent through email, or it can be sent through videos where the students will be just have to see and learn. Live lectures will be synchronous. Asynchronous is already recorded YouTube recordings or whatever the materials will be given to the students where they have to read on their own whenever they wanted. And this all is we are using actually computer assisted instruction, where the teacher will be using all the applications in the computer, and it will help the instructor to do the education in a proper way. This we are all using actually. So actually doing in the teaching, we are doing actually. And this person has told internet is two equalizers in life, that is internet and education. Without internet, our education is not going to happen. So whatever, even now the net problem has happened to me and I am not able to connect to you. So the internet is actually two equalizers. Without that, there is no education. That's what John Champers said. And he is telling even email is the proper education tool, he said. He said emailing back and forth with another classroom or with teacher and student, that also gives excellent opportunities for students, even with practice writing skills for a real life purpose. Even in nursing, we can actually ask the students to email us. What is email? Is questions related to the particular questions. It can be emailed and we can answer also. So emailing back and forth, we can make the students to write even the leave letters through email instead of writing this applications or whatever. So email is a great learning for students, where they will be able to log in, they log out, they'll create their own mail, and they will be trying to communicate through it. See, if they are not knowing the English also, they will access the Google and they will try to learn and they will start typing. And there are a lot of grammar editing apps are there. So when they are writing any letters or any assignments through email, they will try to edit, they will try to learn. When they are trying to edit, it's a learning. When they are trying to correct the mistakes, it's a learning. When they are writing only, it will say that you have a lot of errors, 80% of the error, 50% of the error. So immediately they go back and correct it. So we can tell the students, nowadays we are using a Google app actually. Google assignments are submitted in the Google Classrooms, all that. But still, email is the one way of mailing the students the content and making the students to send the content back, or make the students to write it. We can ask them to type the real communication messages. Madam, I am submitting my assignments 1 or 2. We have to request them to write it. This will create a writing skills for them. Not just scanning and sending. They have to ask them to write it. This helps them in communicating, because in healthcare industry also, when they are going for a work, they have to send a request to the pharmacy, request to lab, all that. So the communication skills through internet will be developing when we are asking them to use the email also as a communication. And World Wide Web, as I told you, it's an open source information space where documents all and other all web resources will be having a links, or a links will be given, and it all interlinked by hypertext. We all know links, HTTP and www, all that we are. So every World Wide Web has different links where we can use any material we wanted. We can just go and use any type of hypertext links where we get all materials which we want. The use of this as an instructional tool is gaining momentum, because they are saying the webinar users have grown, with unexpectedly grown. That's what they are saying, because last year, compared to last year, this time they are selling 100,000 millions of people have started using this webinar. And now this COVID, I don't know what is the imagination of people using webinar. The webinar, WebEx all created, even this is like a webinar. So the information can be shared through the links. Even now for joining this meeting, you people are giving link. For registration, you are giving a link. So this feedback link you will be giving. So links are created through this. The informations can be shared. E-learning is one of electronic learning. It's the important, even this is electronic learning. E is actually everywhere you can learn and learn by everyone, and every time you can learn. It's effective learning, and it is an efficient learning and economical, and it is an engaging, exciting and easy access. The electronic type of education is again using a computer technology that we are doing already. And the smart class is another technology we can actually incorporate in our education, where every student will be given their iPad or mobile or laptop will be on the table, and in the smart class will be using a complete computer technology will be used in the over the board, where you can just draw. Interactive boards will be there, and internet connectivity will be there, and projectors will be there, and you have to merge and you have to teach them through interactive boards. You can see here the smart class is like this, where every student is given a separate computer, and there will be a big screen where I think now many of the colleges have started having a smart class where all of us are having. So everyone is aware of that, but just tell you that this is also we can use. It's a multimedia device, home theater, anything can be incorporated into that, as long as it's going to be an interactive, where students can go to the interactive boards and they can try to draw, try to get the images which they want to draw. Example, you can see if they want to draw a heart, they can just do it. But when they are doing, it will show that you are doing in the right way, you are doing in the wrong way, you mark it like that. So the interactive will be telling you that you have to do the right side, you have to do the left side, this is not correct, this is not wrong. So anatomically, if they want to draw, or physiological functions they want to test, they can go to the interactive board and they can just try to try to play means try to draw, and it will tell you are right or wrong. And they will, if you want to test your knowledge, you can ask some questions in that way you can answer the question and it will say it is right or wrong. So this is an interactive board is there. Some type of apps been created now smartly, where you can just go, if the class is over, if you want to get the content back and you want to test yourself, you can go for a test myself, I want to test my knowledge. If you just click it, it will show you which part you wanted to test or which part you wanted to relearn. That all will show. Accordingly, you can select and you can go for it. That's a great one. Nowadays it has come. And this interactive whiteboards have various facilities to draw, show video, images, illustrations, maps, graphs, games, manipulate in one way. As I told you, you can manipulate according to you, which content you want, which diagram you want, whichever you want, you can take it and you can test yourself until you complete your learning. It will help you to flexible itself. How much you want, you can manipulate. There is no problem. And mobiles, tablets, iPads, this I'm not going to example. Like nowadays, lot of information has been given in this mobiles, even for the patients. Even healthcare societies have created a lot of material for the public to understand. So even the COVID nowadays, immediately when you call, it says that lockdown has started, unlock is been started, how you have to be, which number you have to call. Same way, every society, even not only cancer society, many societies have created a materials for the public to understand. The same way, we can create messages for our students in each topic, and it can be given to the students whenever they can. It can be given, and apps can be given for them. They can just take the app and do it. See now that Akash Institute now for teaching a NEET, and you can see the spectrum, and one more is there, like what is that app one is coming. So many people have created like this apps, and they have given us a chapters, and you can do, if you want to see the videos, you can go for it. If you want the just the material, you can see, or if you want the instructor to explain to you, you can put a query and you can fix an appointment saying that I wanted to have a discussion at 9 o'clock with my teacher. I want X teacher, Y teacher, because teachers list will be given. You have to select which teacher you wanted to interact. You can select and the teacher will be answering you. So that mobiles have been completely loaded with the educational materials. From the hospital nowadays, they are using for the public messages. So businessmen are using like for counseling therapy. So you can just get through counseling, you can, e-counseling can be possible. Same way you can meet the students, same way, and you can give counseling to the students. You know the mobile usage, I don't want to explain much, but for education, it is being used as complete package can be given through mobile for the students to use it, and chapter wise the students can be completed. But for, I think we need to create, our teachers needs to create lot of work towards teaching materials has to be created in the e-version and give to the students. We have not started much, but many materials are available already in the apps that can be used. That I will show you later. So even now our council has given a learning modules. That modules also you can see that is like a e-learning. There you can go for a pre-test, then you will read the content and post-test. If you got a score, then it is your passed. Otherwise, you have to repeat it. The same way, many centers have started giving information to the public. If you want, you can use it, and what are the hotlines available. And all these have been come into the mobile app. As a teacher, we supposed to know how to create a materials loaded in the mobile for our students learning, because website is having a lot of informations, but what is needed for our first year, what is needed for our second year, that we have to refine it and give it to the students. This is a satellite one, you know, EduSat. The first satellite was developed only for educational purpose in India. This was giving connectivity to school, college, and higher level of education. This is developed in the tribal area of Madhya Pradesh. It has been covered in the Indira Gandhi National Open University. You see, so that like net connectivity, those problems will not be there. Very much clarity and lot of materials will be there. But here the problem is it's just a one-way instruction and it is a higher cost. And it requires minimal technical assistance. Sorry. So see, this EduSat is costly, but once you created, one university has created one EduSat and a lot of the materials been loaded, means even rural people, they don't need to go with this mobile and all this. It will be very, clarity of content. Internet is not needed. I think internet you need, but EduSat is, they are telling the content pouring will be very good and clarity of instructions will be very good and minimal technical assistance is needed. So video will be just real time and it is the students can learn it as if the teacher is very near to them. So they are telling instead of this mobile learning, all that, the EduSat is very good where you can give the materials to the students or instructions to the students. Yet to, we all have to have it yet because it has been just done by the Indira Gandhi University just for the in Madhya Pradesh, it is given for the rural people to be covered because they always have a problem with the rural people where they were not able to connect it. So the EduSat is created only for the rural people where this satellite can have connectivity more than the mobiles like Airtel or Vodafone or whatever. The internet connectivity problem will not be there where EduSat will give some sort of connectivity to the students to come for the classes. And educational tools and teaching tools. Next one is like, we all know that this Facebook, cancer instruction is given and health.com, everyday health, like lot of materials, educational tools being available in Facebook and YouTube. We are using Facebook for somehow, but actually Facebook is having a lot of educational materials like every disease have a different page, cancer page, cardiac page, and exercise page, yoga page, like that different health tips are available in Facebook where the students can go to the Facebook also and access, but you have to tell which type of .com, that which page they have to open. You can put refer Facebook INC inclusive of what is that, you can give the link to the students. And YouTube also you can say which YouTube links you can give because lot of educational videos are there in the YouTube, that which video they have to see, because now a lot of complaints from the parents is students are seeing the videos, unnecessary videos. You have to give the links and there should be restrictions in the mobiles that the apps that they cannot go away from that, only this much they can see. So that we have to control it. See, LinkedIn is there where a lot of educational topics are there. Students are not oriented much with this. See, SlideShare gives a lot of PPT regarding educational topics and ebooks provides various health and other education related matters and a lot of like dictionaries, Wikipedia, care plan, Shell, PDF, all these are available for e-reading. So you have to tell the students exactly for your topic, what is there. You don't need to, I told you, you have to prepare and everything. You have to streamline everything and give it to the students in a form of where they have to learn anything for LinkedIn, SlideShare, everything. You have to give them a keywords for them to search and you have to give them the links to search, or you can search and you can put only that material exactly into their folder, because each student you can create a folder where you can just put these materials for them to learn. See, this is a wonderful one I was just seeing. The many apps used in nursing education, as you can see, the Facebook has almost 1.15 billion of materials related to nursing also, or medical and nursing is available, and Twitter have more than 500 million, Google has more than 500 million, Tumblr have more than 139 million. So this all related to everyone, doctor or nurse, experiencing with the patients, different patients and their articles, everything has been posted there. So you have to have that type of invitations. You have to have the invitations for each post into your mobile or into your mail, and you have to help the students to learn such experiences that will definitely help them to grow. So the Flickr, all these messages, we have to identify and give the link to the students. So it's not, we should not restrict the students to use the mobile or what. We should teach them how to use. We have to engage them correctly from morning to evening through this mobile. 8 o'clock, you have to finish 9, 10, 11, like that, give a break. So the students cannot go away, no diversity. They have to finish certain things. So this, any type of apps you can use and help the students to learn. See, by using that, the students will go for a personal learning environment. The personal learning environment is every student will have a folder. So it will tell them, this is what you have completed, this is what you have not completed. So they will create their own blog. My plea, my e-portfolio they will create. In that, they will be telling them you have attended only 80%, you have attended only 60%, you have attended only 40%. So this will help them to improve. Oh, I have finished only 40, and they can view others also. Oh, somebody has finished 80, I finished only 70. So the own block, individual block to be created for each student. They all know to create a blocks, and teachers also can create, or institution also can create a block and give it to them. So every student will be able to estimate themselves, where I am, where others, and what I should know, what I should not do it. So this will help them to go for a personal learning environment. They will be able to create their own learning environment and they will learn. So here Google can be used, and other tools like Pinterest and Pearl Tree. There are a lot of apps are there where you can create your blogs and give the students to learn it. So the personal learning networks are very powerful than the other networks. So whatever the information from one brain can go to many brains in many directions, in many speed variations, many things it will go. So you have to create a personal learning networks for the students, like blogs can be created, materials can be given to them where they will try to learn by themselves. Personalized learning is focusing on each learner because everyone knows where I am, and learners work at their own pace. Learners are exposed to 21st century technology, and the learners will co-design their own learning facilities because maybe something is not good for them. They will try to learn, okay, this is not true. I'm not comfortable with that. Let me go through this where my teacher is instructing. My teacher is instructing where I'm not able to understand. Let me go to the printed material given. So they will try to understand through which mode they will be able to learn. So the personalized learning, so each individual block can be created and given to the teacher, given to the students, where the students will go for their own portfolio they will make, and they will try to improve themselves. And when we are giving this material and asking the students to use the apps and internet pages, this person is telling, Thomas Edison has told 60% of all internet pages are containing misleading information. Even we know Google informations are not good. We always tell the students to refer the textbook, for which he is advising, if you want to use the technology, you have to go for the digital literacies. Digital literacies means nothing but where any content come to the internet, they are putting that we are not responsible for the content which is being displayed here. But the digital literacy means we have to create a digital literacy by the experts validation of content. So this is telling, if the digital literacy is created by the validation of experts, like we are going for content validity and all that, through the expert analytical output, like once they analyzed and say it is okay, then only it has come under the digital literacy. This will be embedded into the pedagogical practices. The pedagogical practice is nothing but the teaching ways, how to teach each one. This material can be taught only through video. This material can be taught only by demonstration. This has to be done only, printed materials will be enough, or this needs live instructions. So like that, you have to bring the materials and mode of teaching, and it has to be loaded under the digital literacy, where the students will be able to effectively, critically navigate and evaluate and they will be able to get a lot of information. The teacher has to do the same thing to create information. The student has to do the same thing to learn the information. So digital literacy is nothing but the literacies which is given into that form is by the experts who validated only will be under the digital literacy. That only the students has to use. So every digital literacy who has been validated, what is the ranking, what is the star, then who has done it, whether we can take from that particular source, because we know there are different websites or different links are given for different sources. So which is being highly ranked, that authorized information has been forecasted, like that you have to say. And this is like learning analytics. This is another concept of technology where it is used by the teachers. We will get it, and we can get a performance based trends and patterns. So trends and patterns means what they have done, how they are going, everything we can, how he is going to be in after within the 30 days, the timeline which we have given, whether he'll be able to finish it, whether he is going to stuck with that or what, we have to see. And if the student is not doing particular part, then we have to make the instructions according to the needs. Then we can create a different type of, we have to bridge the gap. Whatever he is not able to do it, example, now he is stuck up with the anatomy of the heart or anatomy of the stomach. So he is not thorough of that. He is not coming out of that. So what we have to do is, okay, we can make a simple made instructions, tailor made instructions we have to make. And particularly you can help those group of students to again come back to this. You go through this video or you follow my instructions and you complete it. So whatever they are not able to do it, you can help them. So that is what is customized learning experiences. So learning analytics is accordingly, you can create one app. Software is created for everything. So learning analytics you can create and you can customize the learning experiences for the students. And digital badge, it is another one. It's an alternative means of assessment. We can give a digital badge to the students. It is nothing but performance scoring will be given in a digital base to the students. Whatever they have learned, it will capture all the learning analytics is there. Now using a learning analytics, you can give a digital badges to the students. This will motivate the students to learn more, and whichever student have achieved 100%, they will know that, okay, my performance is okay, where I have taken a long time, where I have taken a quicker time. So they can analyze themselves. Digital batches means the rank card, how we are giving progress chart or papers here in the classes. The digital batches will be given to the people who are doing best. That achievements will help the teachers or any organization to do a honoring for them or making them to be employed in a better place or anything, for anything, campus interview or anything you wanted to. The assessments will be graded as a digital batches. That is, you can do it. M-learning, I don't need to tell. This is what was going on. 50% students of even from grade 6 to 12, they said the mobile devices is an essential component to the ultimate school, because we know mobile is, all the materials has been given. Now it is different. Online class completely. Even before the M-learning was completely helpful for the students, because any material, any assignments, they were using the mobile. We were not able to restrict. We can only say that if they are using it properly, we have to allow them. This M-learning encourages innovation, collaboration, and communication through all the use of digital devices. It is a technology-rich instruction and activities sustain engagement of more than activities that have less technology use. The M-learning actually helps the students to learn in a better way than any other way, because easy, simple, handheld, and they'll be able to learn it better. And now everyone is having an Android phone. Without that, no one, even the LKG students are in need of this M-learning. It has been started and we are also doing that. This is another one, very interesting one I wanted to, like quick response codes. This is like a barcode. Wherever we go, in the shopping mall, everything, they scan barcode and everything's the price and detail of the particular material is been already loaded in the computer. The same way, the quick response codes are two-dimensional barcode, where the time-saving one, people, you can share the links and information through this barcode. So if the students just scan it, means you know how many of them are scanned, and all the informations, whatever they have scanned, will be accurately reach them. And you can see at the same way, if they want to submit any assignments or anything, they can use this QR code, and you can scan the QR code. All the materials will be, you will be able to see what they have done. This will be specifically given to each student, so nobody can misuse it, nobody can copy it No, because once the same material has been loaded into that by the same student, it will not allow again at only one time. So this QR code will help them to promote the overseas skills by allowing the learners to share even audio recordings. The student, every student has to answer. So once the one student voice is recorded through that code, again he cannot change. So the even Viva can be conducted through this. So the quick response codes, you have to, design it, and you have to prepare, and you can use it for a teaching and Viva, and you can ask them to submit the assignments through barcodes, and you can share your links through this. You can share all the information. It will be very confidential, because you will not be seen anything unless, because if you, whatever the material, if you put into the computer, it will be seen by everybody. But if you give through these barcodes, only your student, or only the particular student whom you wanted to give, or only your batch students only will be able to see. So this is a very good. If they are scanning the barcode, you will know that they have read the materials, because now we don't know who has read it, who has not read it. Maybe we can see in the Google Classroom how many of them have attended, how many of them have seen all that. But still, this barcode will tell you exactly whether the student has got the information, whether he has fed the assignments, at what time. Everything will be seen accurately through this barcode. And knowledge mapping. This is an nowadays they are using this knowledge mapping through technology, where the information is given to the students. So what they have learned in part of knowledge and competencies and proficiencies. So whether they are in basic knowledge, or they have come to the competency level, or they have come to the proficiency level, and it was when they are competent, when they are proficient, is it by an individual or by the groups, everything will be analyzed. And you can do the knowledge mapping, like who is best or which group is best, like that you can make. And you can individually you can select the students whoever is able to get. So knowledge mapping is also one of them. If you put it, every student, how they are getting the information, when they got the information, when they have read it, when they have performed it, what is their level of performance, whether they have achieved the competency or proficiency. Is it they have done by the group or individual assignment, they are good, or group assignment, they are good. So the knowledge mapping also can be done by the computer system, and that will help you which group of students are better, which group of students need a backup. The students need to be motivated as a group or motivated as an individual. All that will tell you how you have to improvise your teaching. So this is also a very good concept to be incorporated in the technology. And already we are using all these apps. Google Classroom, we know Tamil Nadu Nursing Council, we are using everyday materials. We are giving through that. Google Meet, we all know there is app. Through Gmail also, we can go to the Google Meet. Zoom, which we are using now. And web links are available. Pre-conference call, LinkedIn, SlideShare, WebEx, Microsoft Team, peer-to-peer training, Telegram app. All these apps, whatever the material you wanted to give it to the students, you can give. And as I told you, the knowledge mapping and other things like whatever I have told you, this knowledge mapping and quick response code, and other things like digital batches and learning analytics and digital literacy, all these you can definitely include into any of these apps, and it will be given to the students, as long as these concepts are incorporated into any of this, and you can disseminate the information to the students. And apart from all that, artificial intelligence is the technology through automation, and it is most disruptive source. Like immediately it will be responding to the students. Smart content for everyone. It is tutor and guidance outside the classroom, and automate admin tasks. You can whatever you want, you can ask. You are the admin for it. And the customized learning plan will be prepared according to your, as I told you earlier itself, the artificial intelligence will ask you what you know and what you do not know. You know your strength and weakness. Then it will help you. It will give you a plan. This is what you have to go. So accordingly, you can go and learn. This automation, this artificial intelligence in education is a very smart decision, where every teacher, every institution can use it, and it immediate attention of the students and immediate attention feedback to the teachers will be there by using a artificial intelligence. This artificial intelligence, I think, separate session by somebody. So I'm not going into the much, but this is also technology. We can use it as a teacher, will help the learner to assess themselves and make a plan for themselves. The future of education technology is mainly for virtual reality and virtual assistance. These two are the very major new concepts which I am going to explain to you later, because all the things which we have already, which we are using only, we were discussing so far. This virtual reality and virtual assistance nowadays for this pandemic situation, for our students to learn practical things, I think virtual reality and virtual assistance will definitely help for learning to everyone and better research and lifelong learning. These two are the major one. How we are going to do, I will tell you. And making the right choice is very important, because when you wanted to do this virtual reality or any technology for them, you have to see whether students will be actively engaged, whether it is going to be a supplement for school education or college education, whether it's going to self-regulate them, whether it's going to be enjoyable one, student will be able to make the personalized solutions or not, whether they are going to focus the inquiry or just not memorization. They have to do the analytic one. As I told you, the first one, the nursing needs analytical also. Whether all these are available for such technology which we are going to use. In that way only we have to disseminate the teaching materials to the students. These are all the top edtech companies around the globe. The students, if you go through that, any of the edtech companies, you can see whatever I have told you about digital assessment, digital batches, learning analytics, all these they have incorporated into that, and all materials has been given, and artificial intelligence has been used in this, and they have assessed individual students, and knowledge mapping has been done for each student, and everything will be there. Many of the edtech companies you can see, Duolingo, that is Coursera, Udemy, and then TutorFair, Kaltura Knowledge, Blink Learning, Voxy, Help Hub, and Next Education. Next Education is, if you go through that, I can see a lot of nursing tutorials are mainly there, and open classrooms, Brainly, Bambis, these are all the edtech trends you can use for your bit degree. So all these will help you. Any of the things, if you open and see, that academy will guide us how we can make our apps to help our nursing students also. Speed lab is one of the one I wanted to tell you all. It is a very important speed lab, like how we procedures. In the speed lab, you can just put a procedure for the students, and you can put a time limit for them to learn, and you can put a evaluation within that. Nasogastric tube insertion means they cannot make it too long for the student patients. So they have to finish that procedure with a high level of proficiency within that 2 minutes, within that 3 minutes. The injection, IM injection, how long they can give for the, including the preparation and administration, how long they can take it. So everything, each procedure will be given through speed lab, where they have to take that procedure and they have to finish within that time. So this lab will tell you technology assisted practice. So you can just go to that, open it, and you can choose a procedure, and you will start doing IM injection. Okay, I wanted to practice this. So you first learn. It will give you a learning mode first. You can learn it. Later, you can just go through each step. Each step after learning, when you start performing, so you have to perform within that timeline what is given. That is a speed lab methodology. Every procedure will have a definite timeline, and it will tell you the feedback immediately. There will be definitely technology assisting, and expert guidance will be at the back for you. And personally, you can feel, I am right, I am wrong, I am wrong. First step is wrong, right? So you can repeat it how many times you want, but the final completion should be within the time frame, whatever they have done it. So this is speed lab methodology. We can use it for all our nursing procedures actually. And next education, as I told you, the next education is for very much this academy. Next education offering is next education is one academy where they have a next curriculum, teach next, learn next, next learning platform, next lab. So if you want to curriculum syllabus, if you want to frame, you can just go to the next curriculum. How to teach, you can go to the teach next. If you have to learn as a student, you can go to learn next. Learning platform, next learning platform, that is how I can learn this particular procedure under what platform, that will tell you, and which procedure or which lab you want to choose. So like this, the next academy has different types of apps inside, and you can choose whichever you wanted and you can do it. And we can also create, it's very simple. If you go to that academy and see what are all the steps, how they have created, and we can also create as a teachers and give it to the students for learning apart from our class teachings. I'm telling you all, this is not going to replace the technology that will change our classroom education is all virtual reality. I will tell you, it is actually a real life training for future careers. Real demonstration of complex concepts and remote learning is possible, and cloud computing is very much helpful for us. And it's no more expensive textbooks. Updated learning materials will be there, online assignments and easy to track, and hologram, remote access and attendance. Hologram also can be done through the virtual one. I will show you one example at the back. 3D printing and biometrics. Biometrics is, see, nowadays every student is just putting a, what is that? Just putting a photo and going. Video will be just on and they will not listen completely. But to track real, there somebody also will log in instead of them through their mail, and they will log in and they will go. But biometrics track attendance not only in the coming to the college and do the biometrics, even when they are sitting in their home, they have to do the biometric to present the attendance, so that we know the student is individually present for the class. So if you see this, this is only for nursing. Our elsewhere has done this. Our elsewhere group has done. See, our nursing people are using videos for skills 80 or 84%. Online distance learning is 75. Virtual simulation is 65. Adaptive quizzing and testing is 64. Electronic health record application is 60%. Integrated digital curriculum is 49. Mobile apps 41. Mobile apps we are not using much. And social media 37. That is also good, but there are a lot of things which is good things are there, we can take it. FaceTime video conferencing 35. E-portfolio of students' work is only 31. So in the personalized learning, we can put e-portfolio, and this can be increased to 80% also, because this is very helpful. And data analytic tool, like I told you, the learning analytic concept. This is predictive analytics, how the student is going, how we can customize the learning for them. That is only 14%. We are not familiar with that. We are not using, but still we have to go for it. So virtual reality is a new concept. It is only 10% where we have to improve that. And 8% of makerspace and wearables also, and artificial intelligence only 2%, because artificial is just coming in. We have not, none of us have incorporated that. So we have to do this. As I told you, artificial intelligence is very smart app where it helps the students as well as the teachers. So these are all the apps already the nursing people are using. This was especially nurses, how much they are using in the education has been already analyzed. The survey has been done and it is being put here. And you can see the Web 2.0 generally refers to second generation of service. If you want to see some pictures or share the pictures, you can go to the Flickr. Videos, you all know YouTube. And shared news is Dick. Shared bookmarks, you can go to Dell, ICIO US, or even INC has come already. And shared knowledge, Wikipedia. Shared everything is MySpace. So like this, so many has come. Information how you want to share is, you can select these apps and you can share your information. Even I told you, when you want to become a nurse entrepreneur, when you want to share something, you have to go such apps and share your knowledge. Shared everything is MySpace. Here you will share all your expertism, where the Digi experience we say, where the students can go for the nurses experience, ortho nurse experience, ophthalmic nurse experience, cardiac theater nurse experience, like that. Each different categories has been given where you can share your experiences, and you can tell the students to access that. Through experience of many people, they can also learn many things. So these things can be given to the students to go through for learning. And watermill, actually Web 2.0 is a watermill process. What is watermill process? Something will be collected and shared and build and knowledge discovery. See, technology is reaching the people is the what, how the technology will be looked into different angle, and how you can share, how you can develop, how you can find it. That is what is a watermill. All are informations. So this information is all available in the Web 2.0, how the students can get the information, how they can share, how they can develop, how they can discover. So this 4 steps will be there in the Web 2.0 through any of the apps which we have discussed. So students will be just go into the Web 2.0, any of the apps they will be select. They will be knowing that how I have to learn, how I have to share, how I have to change myself, how I have to discover the new things. Everything will be available in Web 2.0. Any of the app all apps will be giving the same type of purpose. So this is the very important one for the clinical. I wanted to tell you augmented reality. Sir was telling other all apps we have come into that 50 to 60% we have come already. But here for this augmented reality, Body Explorer, the augmented reality means what is that is virtual reality with physical reality. That is combining digital and physical media. Both is called augmented reality. The one is Body Explorer. It's a simulator. So where it is virtual and physical is being combined. For example, you can give intravenous cardiac drug and you can see the heartbeat is coming down. How it means it will be connected to the computer. So where you will be just seeing that and the body part will be exposed. If you want to administer the cardiac drug and see the effect of heartbeat, you can see virtually. You can give a intravenous cardiac drug and you can see, you have to select it first and you can see the heart is slowly getting down. You can see a lot of waves, the ECG waves will be, ECG you have to connect it and you can see how the EKG is changing. The augmented realities we can see and you can do it and you can see the effect also. That is what is augmented reality. This we are not having right now. In the websites it is available actually. You can if you purchase the pack of that reality, augmented reality packs are available, then students can practice it. It's very costly. It's still not, we are not having it, but still we have to have it. That is a very useful for clinical practice because we know that we are not able to bring the students right now to the pandemic situation, to the clinical wards where parents are afraid, teachers are afraid, students are afraid. So this type of augmented reality simulations will be helping them. So this will help both cognitive and psychomotor. We want actually cognitive, psychomotor and all the skills. So both will be helped by the augmented reality to the students. So this is an integral to mastery of clinical practice. This will be helping mostly for intravenous medication administration, how to do the teamwork. Example like cardiac arrest has happened. So how you are coordinating with the team like doctor, nurse, anesthetist and other people, how you have to give instructions, how you have to coordinate, what you have to do. So that teamwork also will be demonstrated and you can be mastery of that. And you can visualize the whole part of anatomy and physiology. If you want to see whichever the system, I want to visualize the air, I want to visualize the eyes, I want to visualize the spleen, anything, you can just go to the anatomy, click with this is what you want. You can completely go through and thorough of it. Physiology, pharmacology, and clinical procedures, all that is can be taught by this augmented reality. The one term is Body Explorer. The other simulator is Flight Simulator. See, this is they have created it during the, this was created in the Francis Bain Bolton School of Nursing at Case Western Reserve University. It is a fully articulating high fidelity flight simulator. That is during the hurricane happened in Katrina, this helicopter was actually serving the people. This weight of full scale, that is S76 the name. It is medically configured where the simulator allows acute care nurse practitioner students. They will be able to use the real fight equipment, like how you have to use the save the people during the aircraft, in the aircraft, because the people from the during the tsunami and hurricane, they were brought from the like remote villages or floor or from the sea. They were all brought in through the helicopter to the saving place. That time how this equipment helps them to save the lives. That was actually as a prepared as a simulator. This was helping all nurses to practice it. Then they were put into the acute care nurse practice. This simulator and all we are not having, but we have some simulators for life-saving procedures that we can use it. This is one of the simulator. Actually, they were saying that this is not very costly simulator where we can just bring it and we can do it and we can help our nurses to practice this life-saving simulation practices, and that will help the student confidence level to manage the critically ill patients. And Microsoft HoloLens. This is another one mixed reality device. This will be worn into your head. You can put it in a head and you can see the computer will tell you, you can go for this own learning phase. You can visualize this human body, inner parts. You can see anatomy and physiology, and you can see like cadavers instead of cadavers, because cadavers we are not getting sometimes and it becomes illegal practice. So instead of cadavers, you can just go to the hologram and see completely the anatomy and physiology. We are also bringing the students to the anatomy lab, universities where they are having cadavers. Instead, you can use this Microsoft HoloLens, where you can see completely the human body into a 3-dimensional form. So it is like it is surpassing the traditional teaching method. If you have this Microsoft HoloLens, you don't need a exact lab to be visited to see the parts of everything, because this will give you the each human part body through 3-dimensional. This can be taken by us. This can be used by us also. It is not very costly. And virtual simulation technologies we are using for clinical procedure is one is CliniSpace. That is an artificial reality where we are using a body explorer. Body explorer is one of the simulator, and flight simulator. It's no need to be flight under the flight. It was created in the flight simulator, but you can create a simulators for life saving, and which many people have already started. This will help us to learn a critically ill patient management. And Microsoft HoloLens, definitely we can take it. And this is all a virtual simulation technologies. One is a CliniSpace. CliniSpace is nothing but it's a 3-dimensional representation of healthcare setting over a computer screen. That is the whole hospital. The world is it can be acute care unit or office or clinic or patient's home. It can be anything. If you want to learn a patient who's had a cardiac arrest in the road, you can select the public arrest. So they will be showing a patient lying down in the road. So you can take one of the avatar, like you can be a doctor, you can be a nurse, or you can be a physician, administrator, or anyone. So exactly you are there and how you are going to manage. It will give you all the instructions how to go for it and how to save the patients. So even for the intravenous fluids, how the blood volume is replenishing and blood pressure is how responding. So all that you can see. If you want to just enter as a nurse into one unit and you want to see how the IV fluid is to be started or how the medication has to be given, or you can just do any procedure, ice tube insertion or Foley's catheter insertion, any procedure you want to choose, go there and the laptop will show you this is the ward, the patient is there. You can just talk interactively and you can just, that will tell you, if you press, that will say, okay, measure the BP. And after that, if it is okay, you can go for it. I can insert. So many instructions will be given. You can completely learn the procedures through this CliniSpace. Then the CliniSpace learners click on that. That is what, if you want to see the vital signs of the patients, you can click the vital signs and get the heart rate and breath sounds and physical assessment completely. You can learn through this, and you can go to the electronic medical record. That is what the patient has, that particular patient, what orders the doctors has given, you can start giving that medication. So like it is like completely you are managing a patient from the beginning to the end. So this all actions will be tracked, and every time you will get a feedback immediately. At the end, it will show that you are not good in this. You are not. You have done this great. You have given oxygen within a minute. It is very good. Pulse oximeter, you have used it. It is very good. ECG, you have connected. Okay, it is good. You have not connected the ECG. You are not good. So like that, you will get a marks at the end. So you know that if a patient comes, what I should do immediately. If you have not checked the respiratory rate and you have just gone through, it will tell you you have not checked the respiratory rate, you have not checked the airway, you have not positioned the patient, your temperature is 39, the vital signs, you have not done any management. Like that, it will give you a lot of instructions where you have to just do it again and again. So this is exact, this all we can definitely take it and learn. This is all not a costly one. This is a technology very useful for teaching assessments of the physical assessment, how to document and how to use the electronic health record, how to use drug actions we can learn, and what decisions we have to make. Okay, the patient breathing is like that, patient is tachypneic, what position I have to give. Okay, the patient heart rate is going down, what drug I suppose. Like that, it will help you to make a decisions and which is prioritizing. Example, patient is breathing is not good, and if you are checking the BP, it will tell you, no, you are wrong. You're supposed to check the airway and give oxygen, then come and check the vital signs. So it will tell you all how you have to do help the patient, how to prioritize the needs. It will tell you. The CliniSpace is all teachers of us we can definitely use for our students. And digital clinical experience, as I told you earlier also, every faculty or every nurse has been already stored asynchronous. I already told asynchronous, the virtual patient simulation designed for practice. where all the things like nursing process with modules, it will be given what is the subjective assessment, what is the objective assessment, what is your goal, how you have to take the action, how you have to evaluate, everything will be, it is already shared. So you have to just, the faculty will be integrating that. Faculty will tell that this is what is the patient. So this patient needs which type of bed you have to choose. So from the bed making it starts. So from the nursing foundation to advanced clinical procedures, you can teachers will make a simulations into that particular DCE, that is digital clinical experience. Students will take whichever procedure you will tell 10 procedures you have to complete. They will go and they will do it. Unless they are finishing that procedure, you are not going to give the assessment, and you will not tell, unless they complete and thorough of the procedure, there is no entry into the laboratory or there is no entry into the hospital. This is how the formative and summative assessments through this clinical experience also you can, as we have the log books, this many procedures have to complete. We are telling them to complete, then come. Instead, if you give this DCE, they will be able to complete one procedures, and you are having feedback every time in your computer. How many students have finished this, and you will be giving a feedback. And the student have completed a set of criteria, and they will be coming back to the other. You will be allowing them to the other next step of procedures or next step of entry into the clinicals or laboratory. All. So this is actually helping a lot of useful, particularly useful for physical assessment, communication, clinical reasoning skills. As I told you, clinical, why you are not given the oxygen, why the position is very important. The people will be able to understand, okay, tachypnea means which position I supposed to give. I have not given this, I have changed this, I have not helped the patient to, patient will be talking something and you will not be listening. That will tell you, you have to listen to the patient. You have to ask this particular history to the patient. So this all will, like small guidance you will be getting, that will help you a lot for learning without missing any steps. And this will tell you as per the steps you have to go. If you miss one step, also it will not allow you to go to complete it. And VSIM, this is another important one. The collaboration between Lateral and Vultus Cluvier, all the people, National League Nursing, created a VSIM for nursing. This is very simple. All of us can get it. Web-based single-user product where the students to practice cognitive nursing skills in a virtual environment. So this will actually lot of medical surgical simulations, pediatric, gerontology, maternity, fundamentals, all simulations are loaded into that. Get the VSIM package and you load it into the computer and students can easily practice. I think it is all, they have to get a, you have to purchase the package, then you have to give it to the students to practice all the procedures. They'll be thorough. This you can use it for the technology. Here objective pre-test will be there, post-test will be there, and your performance score feedback will be given. As I told you, speed lab, I told you, timeline, that is also mentioned here. So this technology will be mostly for case study assignment, augment the clinical practice, everything. It will be very helpful. So you can definitely use a VSIM. So we have finished. Actually, I wanted to tell you the VSIM, virtual reality, augmented reality, all that will help us for the future technology. The other things, whatever I have mentioned, is for the present technology. In that present technology, we can use actually a digital assessment, digital batches, and digital literacy, all that, how much we can create and create our own apps for our students' learning will be a better, instead of you give an open space for them to access everything. You create, you validate, and give it to the students to learn using any of the apps. So here the VSIM virtual reality, instead of buying the lateral, you can also prepare and you can also do it. So earlier I told you this technology is a threat or it is a friend. It is an opportunity. Actually, it is not an either or word. It is an and world. That is, you have to use the technology and traditional. It has to be blended, as Dr. Ravi Kumar was telling correctly. You cannot omit it. You have to use both. Hand in hand, it has to be there with you. Human, actually, we all are task on top of big data, that smart machines are available. Just take it and just use it. That is how to take it, how to use it, how to disseminate is only a technology where we need to use. In 60 seconds, this much of information can be accessed. So email, everything. So any of the things can be taken and we can use it for our students according to their interest and the need. And lot of informations, we are drowning in lot of informations, but we starve for knowledge. Actually, we don't know where to get it, how to get it, how to use it. So as a teachers, We have to help the students, though a lot of technology, a lot of apps are available. We have to select it for which procedure and which cognitive knowledge, which information or which technology is needed. Accordingly, you have to prepare, collect the data and information, and help the students to develop the knowledge and the wisdom. See, if you look at that, every time they'll be sitting in a corner and having a laptop and mobile. Is this learning we need? Or just having a classroom? Actually, blended learning, as I told you, both has to be used, and learners actually need new literacies. Though we need traditional and all, we have to see social networking is very important, privacy maintenance is very important, identity management, creating content, organizing content, reusing and repurposing, filtering and selecting, self-presentation, transliteracy. These are all the very important things that teacher has to incorporate onto the students' habit. You have to have the social networking, how to maintain the privacy, how the content's identity will be managed, creating the content is how you will organize. All these are the teacher's responsibility, and how to use is the learner's responsibility. Formal authority is always plus, that is traditional teaching is always best when we are compared to the peer network and self-made earned authority, but still both that cannot be omitted, that has to be added in our teaching. But as long as when you are giving to the student responsibility, the lifelong learning habits has to be inculcated, otherwise they will not learn. Begin with the end in mind, accept responsibility for own learning. They have to start, I have finished today. Unless they have that thought in the mind, they will not be able to learn through technology. Begin with the end and accept responsibility. I have to finish this, so please finish it. View problems as challenges. I am not getting more than 50% is a problem, but it is a challenge for me to get a 80%. Have a confidence in yourself as a competent, effective learner when you are using a technology, because it's all gives feedback. If you write a test, it will go to the teacher and come back, and you will only get the paper, you will know. But this is completely shown in the website, and you will be you take that as a challenge to competent. Create your own learning toolbox, use technology as an advantage, and teach and mentor others. And you can learn by playing, or you can always set a goal. When you set a goal to reach is a play. When you set a goal that I have to reach this, it's like a play, like you will just start doing activities to reach that. You can put it in a term of play or learning or whatever, but always technology will reach the goal in terms of play. It is very easy to reach. So nurse educators can provide online classes, educate the student documentation of records in computers, and shy students to adopt use of technology in learning. They'll be easily coming up with this, and nursing teachers can teach students effectively by use of technology to enhance the learning. You have to tell them first how to use it, and clinical nurse can make use of technology and learn various health topics via internet and implement those on patients. This is the model I wanted to tell you. As a teacher, you have to use. That's a track model. At a TPAC model, we can say, see, there are three big circles, that is technological knowledge, pedagogical knowledge, content knowledge. These three are very important for the teacher. Technological is, you have to know the laptop, PC, a MacBook, iPod, mobile, Google, social network, internet, tools like PPT, PDF, ebook, everything the teacher must have it. As a teacher, if you want to use it, you have to have three types of knowledge. That is, one is technological, you have to be thorough. Second one is pedagogical. These are different approaches. You how to instruct classes, how to use laptop, PC, iPod, internet for teaching and learning, and instruct the teachers regarding use of technology. You have to tell the teachers how to use the technology. It's a pedagogical. The third one is content knowledge. Content is, you have to be thorough of the content also. Technological is needed, how to teach is needed, and what is the content you are going to teach is the three circle. If you go to the inner circle, that is interlinking of the circles. If you see, with the technological and pedagogical, you will develop technological pedagogical knowledge. When you know the technical and pedagogical knowledge, you are going into technological pedagogical knowledge, where use of websites, use of technology tools, use of teleconferencing. So you are thorough of that, how to give the education through that. And you can see the other one, technological content knowledge, how to use a video conferencing, e-learning, m-learning, and smart classes. This also you have to learn. And you can see the other interlinking, this side is the pedagogical content knowledge, where you will be having how to Example like instructions, how to identify the plagiarism, how to go for a content validity, how to trace the content, how to make the digital literacy in a better way. Like that, you will be giving some instructions. This is what is pedagogical content. How to make the content interesting, content in a validity way, that valid one, that is a reliable one, how to make. So you are using a pedagogical and content knowledge in that. And technological pedagogical content knowledge is the middle one. See, all that pedagogical, technological content all together will give a effective teaching learning using a variety of media to enhance the teaching learning. So what as a teacher need is technological, pedagogical content knowledge. If that is there, even in a small amount, you will be able to give an effective teaching learning using a variety of media to enhance the teaching and learning. That is what is a nursing education. They are telling you have to use this track model. So research has been, one of the research has been proved that evidence-based, Nalini was telling, proved that 4,400 students were involved and they see effect of teaching learning with technology. And it says that the students all says that compared to traditional instruction, the significant student outcomes were found with the technology use. They were telling that the study characteristics, quantity of study indicators, technology characteristics, all that were having significant weight effect. That means outcomes were better in all aspects. So it's proved that evidently that technology will definitely increase the student outcome. The conclusion is teaching is an essential part of educational special function to impart knowledge, so to develop understanding and skills. In today's world, technology is a major part of our life. While the generation of our grandparents had to learn to use computer, notebooks, iPad and iPods as adults. So we know that they all have to, even grandparents are learning all this. So supposed to be our students has to be familiar with everything. The only teacher is, as I told you, teachers have to have the technological, pedagogical, content knowledge. Is these three having the TPAC model I told you, this, if these three are there only, you can become an effective teacher in implementing the technology. But again, I want to tell you, technology will never replace the great teachers, but technology in the hands of a great teacher can be transformation. The great teacher means the great teacher should have a pedagogical, content and technological knowledge. Okay. So exposing the, so as a organization, the staff to new tools and encouraging the staff and student to play, empower the individuals, expanding the knowledge toolbox and eliminate the fear towards this technology will help us to grow in a better way. So earlier days, all too often we are giving young people to cut flowers when we should be teaching them to grow their own plants. So the section we always teach, so let them grow it and to learn. Let them grow, then cut it. That is how the technology tells us. Let them go into there, let them make mistakes, let them learn. That is what is a technology says. Let them create a own personalized learning environment with the help of teacher. So the teacher has to create an app, customize the learning needs, and you have to help the students. So this is what is my references, and I must thank all the people for patient listening for a long time. And I must thank Dr. Kannimal and the team who asked me to present this topic. Actually, the virtual and VSIM, that is what we are going to use in the future, because that will help us in creating, I mean, bringing a lot of students into the nursing to become very interesting, and we will not disturb the patients to learn certain procedures. Once we are thorough, I think we can send the patients to the clinical. That will really help us, I think. Thanks for the opportunity to share. Because of this, I too went and learned some few new things which are available, like digital batch and digital assessment, digital literacy, how to create, learning analytics, how to create, knowledge mapping, how to go for it, and virtual reality and VSIM, artificial reality. These are all new learning things even for me. And thanks for the opportunity, madam. Thank you so much. Yeah. Thanks for all the audience too.
Thank you so much. It's a very elaborate technology in front of that too. Mainly, I like to thank because all relevant to nursing. So that is the thing. We are learning in general. We learned a lot for the yesterday sessions and today some in the morning. All it is focused to the title. But really, I am happy to have touch with nursing. All what are the existing and what are the cheapest one we can able to go because of the COVID. we all have to follow the same scenario of online learning. So the practical is struggling. So that is the main difficulty. All the administrators' problem now, and even including ENC also, it is making us to send a circular. Everyone will be aware of that, I think. So to even to conduct a practical exam in online. So like that they are suggesting. So how far the practical experience or internship, so this and all, how we can able to give this all the many questions in front of us as being an administrators in various colleges. And for the students also, they are very, even parents, they used to tell madam, they are learning theory through online, madam. How they are going to enhance for this practical aspect, madam? We are father about that. Like that, they are giving feedback. From the student, from the parent side also, they are very much annoyed. Since nursing is a practical oriented profession, they are become very getting scared without learning, and they cannot able to compete with future generation, or either within India or in other country also. That is very difficult. The hands-on skill is missing. So, but to what extent, as being educators, we can able to help for the future nursing students to become, especially for fourth year, to some extent, they learn, and they have to complete in time. So that and all, it's practical difficulties we have. And for the other students also, there is a lacunae, and how we are going to fill the gap. So this is our worry. And you have answered many questions for that with regard to practical. Special congratulations for that, Sushila. So really it is thought-provoking, and need of the hour for all the administrator also to keep eye-opening, and where it is available, or you can self development of the app. So a lot many whoever knows the technology, they can also contribute. And as being a nursing professional, we too also can develop some new technology and get a name. So yesterday also the robot name is Civili. So it was mentioned as like there is a new forum. It is open now because of the COVID, or in front
Yes,
of
yes, madam. Correct.
that way we have to make use of that opportunities, and you would design something new in your contribution to the nursing. So a lot of opportunities in front of us who are technically digitally literate people, or there is already certified and knowledgeable persons, make use of the chances. So that is in front of you. And the practical, all these kind of thing. And now I received some of the comment from the chat box in front during your session also. So it is a very sturdy session. So, and we need the slides for the future reference. So like that, some of the comments from, and I am very happy. Even the government colleges, it shows the interest of the individual. From Stanley Medical College, from Salem Government Hospital, some of the students they are placing from all with the college name, they are just mentioning they are entering into. I am seeing very happy to their thirst of learning things. No, so yeah, that's why we are specifically just calling for within in and around colleges, and the contributors are giving too much of a input for all the nursing students throughout. I am telling, throughout the state, the people are attending. So even from Kashmir, our students are there. From North also, they might have disseminated to someone. So that is the need of the hour. So that is the thirst they are having. And they are utilizing this, effectively utilizing the forum and taking the good things and for the learning betterment in the nursing. So it shows I am very happy to at least that they are very much
I'm also reading, sir. Few things are coming like that. Excellent presentation and content like that. I'm also reading that in your chat box.
Really, you might have put a lot of effort to bring all this general technology and coming to.
Because if there is a time, we can actually demonstrate of each can be better, but that another longer time again. I have to just tell what is available only. We'll have time now.
No,
If I
this is
demonstrate, I think it will take another time. Actually, I went through each and everything and I have explored myself. Then I have explained here. But
otherwise, it is not possible to explain for. No, so
yes, that is difficult. That is why I didn't do it
really,
actually.
whatever we see in the net, it is not an easy job to learn and understand immediately. It took a lot of time to spend, learn, and then only you can disseminate your experiences. So
Yes.
really, hats up to you. Very good presentation. So I think everyone will agree
Madam,
about
somebody has written
Yeah.
this. See, do you remember me? It has been 30 years since we met. Your lecture was so good and informative. I don't know who's that actually. Vijay Nirmala. I don't know. They have written like that. Actually, you have given the opportunity to meet like these people, madam. Thank you so much.
So we are
30
also very
years, I don't know who's that.
So I means that our management through our pro vice chancellor, he made this possible to buy this license for this
Yes, ma'am.
webinar.
Really great.
So that it is, and almost we all have utilized it more effectively all the days. For 1 month, they got a license for this webinar software.
Oh,
So
good,
we
good.
have all have utilized pharmacy and medicine, dental, all the people we have utilized of the more maximum till up to 18th or some 18th or 20th only the date. So we blocked for all the 4 days, 5 days, and immediately that IT came. I have to thank for him. So he only gave immediately called in the night. So madam, make use of it, madam, like that. And so
really
all on a sudden we started planning. Very short we planned. And
yeah, that's what. Very shortly, you have planned international webinar, and this great. Your people are really good. Hats off to your all
they are also
faculty
doing
and
good
team.
work. Then
I was also wondering last week. I think 10, not even 10 days. No, you finished your international webinar. Then this again came. So really, you people are working hard, and thank you so much.
I am very happy, even though we prepared, so we put into struggle in one way, but the people, the presenters, the resource persons from all the colleges, they have done, even yesterday's also, they have done all their good work, and then the support, and then the presentations, it's no overlapping. So they themselves, they expressed at the end, after the panel discussion, they told, madam, no overlapping, each and everything is having its unique in nature, and they have given a lot of content. So like that feeling only. And yesterday's, the participant, you cannot even imagine, the participants were 1,600 and something, around 1,700.
Every time, ma'am, every time it is like the first day, everyone will come to see what. Then next day it will reduce. Then last end, you can see everyone will come.
Maybe that I don't know about the last day. So today, but it's okay. The participant who got supported today, so let them get benefit out of that. And they're asking for the slide sharing also.
It's with you, ma'am, already.
They're asking, we will communicate to the people. No, I will check through the chat, and then we will do that. And really, I'm very happy, Sushi.
Thank you for giving me opportunity, ma'am. I am always feel I am one of the SRM person. Always be there for everything. Thanks for giving that honor to me.
Plus, not your friend I am calling. That is no. I want to have justice for the topic. Whichever
really, this topic was little difficult for me to get new things because if it is before COVID, it could have been easy for me to say this Google Classroom, video conferencing, all that, but Zoom and all. But now everybody is familiar with all these. So what only I will bring as a new for you, I don't know. Then I went and search. Like then I could able to get this digital batch. Then about the learning analytic apps, then I got this vSIM, I got that augmented reality. So like that few things I wanted to say at least new for you, because otherwise, whatever you know, only if I'm saying there is no use. No, so really it was a tough time for me to search and get it.
Actually, for our applications, you have given a lot of eye-opening, I think. So it is a justice for nursing. So we are thankful for all your effort with all of your difficulties. You prepared everything. I know that, but I know that God is there to bless for everything. Everyone is two sides of the coin. So we have to take up like that only, negative and positive together. We have
Thank
to
you.
so proceed with the betterment for the future for everyone.
Thank you, ma'am. Thank you so
Thank you,
much.
Susi. Once again, on behalf of our team, I am thanking you
Thank
wholeheartedly.
you, ma'am. Thanks to all your people.
presentation.
Definitely, they are all very good.
Thank you, ma'am. Thank you.
Thank you. Thank you.
Thank you, ma'am. It was an
Thank you, Vijay.
extensive, elaborate presentation, ma'am. Highly resourceful. Lot of information you have shared.
Yeah.
Lot of information, ma'am. All practical applications. How,
Yes.
like, practically we can use it in nursing
Yes.
education. Very
Yes,
useful to all of us, ma'am. Thank you so much.
Thank you. Thank you, Vijay. Thank you, Vijay.
And it has created an eye-opening how we can move with
But
this.
to implement, few things are very easy actually, which we were thinking difficult. Few things we can definitely use it, ma'am. We can
Okay.
practice same. We can do a lot of links. We can get it, and both educational trust already they have given some video demonstration for each procedure. Like few things are available. We can take it and use it for our practical purpose for the students
Yeah.
actually.
Okay, then
That
that
we
will
will
be
do
good.
it. Yeah, hope we will do it. At least for let it this pandemic gets over, then but still we can get ready for few things. And
Yeah.
instead we can no need to bring the students, all the students, 100 students means they will everyone will not get the opportunity to do the IV injections. Everyone will not have this. So this and all we can train them virtually.
Yeah.
That's what.
Yes, yes, yes. So that is very, very good. So
Yes,
we
ma'am.
all will follow that and we will make use of this thing to the students' benefit. Yeah.
Yes.
By and
Thank you
large,
so much.
the audience will get more benefit out of that.
Yes,
Definitely.
ma'am. Thank you so much.
Thank you so much.
Thank you, ma'am. We welcome Ms. Rajkumar,
Now,
nursing officer from
oh,
AIMS, highly energetic, enthusiastic, and a highly motivating person. We are really inspired and motivated by your lectures, lively lectures, sharing a practical experience. We welcome you, sir.
Yes, ma'am. Good afternoon, respected Dean, ma'am, Dr. Kanyamal, and SRM management. Once again, inviting me as a speaker is like proud to be a part of your the great leader panelists who are all from various part of Chennai. Really thankful, ma'am, for giving me this opportunity once again. It's going to be just for 15 to 20 minutes. I know it's almost 1:30. I just finish within.
Beyond to that.
Yes, I know that. So I'll take maximum 10 to 15 minutes. Just this session is going to be totally different, like what the other panelists were discussing, and this is going to be useful for the only student, BSc students, freshers, and GNM from various part of Tamil Nadu, and some faculties who are interested. By this, I'm going to my session. Should we start, or ma'am? Shall I start? Yeah, I'll start. Yes.
Yes, ma'am. Yes, sir. You can start.
Yes.
He would like to add some of openings in the government sectors and other things, job openings, and he would like to share some.
Yeah.
For Sushila, I am telling you.
Yeah, ma'am. Dr. Sushila, ma'am, it's very nice presentation. See, we know that the software which you are which you explained clearly. When the student go inside that, we will get a clear picture, images, and everything. Some software we are using for our slides and for teaching
Yes.
as a part of. Yeah. It was very useful for the students actually. If they are doing this, if they are doing voluntary self-interested, they can see they can have the clear image, and they don't want to refer any faculties or anything because they can learn by themselves. It is
Sure. That is what that I was mentioning about the personalized learning many times. That is because only for them to create own responsibility. So thank you. I don't know you. Nice to meet.
Thank you so much for your valuable session.
Nice to meet you, Rajkumar. Yeah, thank you.
Yeah, he used
Dr. Madam.
Regularly to SRM to
like me always.
Yes.
As like you, he used to come many times.
Okay. Good. Very good. Nice meeting you, Rajkumar. Nice.
Yes, ma'am. Thank you, ma'am. Great people have the great thought. Like Dr. Kannimal, ma'am said, she is one of the motivator and so you can so here with I'm just going for my session.
Please this continue. Session, I'll just unmute.
Yeah. No, just session. I'm going to discuss with the opportunity of nurses in Indian government. As Madam Dr. Sushila was discussing about learning, and after learning, how we are going to implement. So that is about this session. So we can start. Why it's Indian government? Why it's not European and not like Gulf countries? Why it's Indian government specially? You see here, many people, as our concern, last 5 to 6 years, there is no awareness of the people around them, around in countries. What are the opportunity we are having? You see, are you aware of career opportunity in India? And are you aware of opportunity for BS nursing fresh graduates and as well as GNM? And are you aware of opportunity for 3 years experience as a clinical nurse? And are you aware of opportunity for 6 years experience as a clinical nurse? Are you aware of tutor, assistant professor post in various central government institutions? This is what about this topic. It may take maximum 15 minutes, just like for your refreshing knowledge about the various vacancies and how to approach and how to utilize. As you all know that AIMS is functioning all over India. It's going to be yeah, 8 or 9 AIMS which is functioning, and you can see the various part of the AIMS located, and still we have the zones, orange zone. Already it started, and since you all know Madurai yet to be started after maybe 4 years. You see here, Bhopal, Nagpur they have started, and Kalyani they have started, and Bilaspur they started. You see the huge vacancy of the nurses here. This is what which ends Delhi, and I just give you the overall picture. Yes.
PPT is not visualized, sir.
Slide.
Oh, okay, fine.
You have to share.
Yeah. Yes, I have shared. Yeah, once again, just a minute. I just have to go back and come, I think. It's just a minute.
Jilin, can you able to share?
Yes, ma'am. Sir, shall I share, sir?
Yeah, you can share, ma'am. No issue. I'll tell yes, you can share. You can proceed.
Okay, sir.
Yeah.
Yeah, now it's visible. Yeah, it's good.
So, ma'am, I don't want to do anything. You will be sharing, right?
Yeah.
Okay, fine. This is a career opportunity for the nurses in Indian government. As we discussed, why it's not European or like Gulf countries. I started with the objectives. Why the people are not aware of fresh graduates after you are completing your BS nursing program. People are doing MD. You compare with the MD MBBS doctors who, once they completed their internship, they forced to do MD, right? They will be keep on studying for 6 months and they'll come for the MD. But still, we have the opportunity for the nurses, fresh graduates for the BSc nursing, who can be placed in any part of the AIMS across India. Still, people are not aware of this. So this is what about the session. You can see here, I have given the objectives about 3 years experience clinical nurse and 6 years experience of clinical nurse. And I started with the images so that people will come to know about what is happening in other state, right? So it's AIMS Delhi. I've given the image, and then you come for the AIMS Bhubaneswar, which is already started BS nursing program. I think 3rd year is running, and then you come for AIMS Rishikesh, and then you have yes, yes. Next slide, ma'am. Yes, just images. Just I want to show AIMS Raipur, which is running, and then yes. Bhopal, yes, AIMS Bhopal is there.
Mangalagiri.
Yes, ma'am. Actually, if I would be pressing that, let me see. Actually, yes. Oh my God.
This is Mangalagiri.
So you're not able to see the
yes,
screen,
I will see, ma'am. I will share my screen. Just a minute.
Yeah.
I got.
Okay.
You just. Yes, this is AIMS Rishikesh, which is established with the 4 years BS nursing. Everything is going. Raipur is established and vacancy is there, and AIMS Bhopal is there. AIMS Jodhpur is there. AIMS Patna also they have started. AIMS Raibali also they have started. AIMS Mangalagiri also they have started. AIMS Nagpur recently they have started, and the vacancy was there in 2020 February. They have started and it's running. And apart from this, you have Madurai, Tamil Nadu, Kalyani, and Gorakhpur, Chandigarh. This all construction is going and yet to be started. So you see imagine the vacancy, and moreover, apart from this AIMS, you see here JIPMER, as you all know that PGMER, Chandigarh, and Army Hospitals, Delhi, and RCC Kerala, and Saptajing Hospital, New Delhi, and Dr. RML Hospital, New Delhi, and Nimans, Bangalore, and other opportunity, ESI hospitals, and Railway Hospital, CGHS, Ayush, Delhi Government Hospital. These all the hospitals where the nurses are eligible to apply. We are sitting there and we are focusing only MRB, but still after your BS nursing, you have the plenty of vacancies and you are not aware of this. You may think that if it is Delhi, only Delhi people make apply. It's not like that. You can apply, anyone can apply for the central government job. It is open for all. Only thing, you have to clear the competitive exam, right? So this is all about the various hospital which is located in other states. Yes, you see here, 2018 to 2020, I'm giving the rank. Just you see the recruitment, Nimans and Jipmar. Total we have 8,000 vacancies, which usually will tell. You see, total 8,000 vacancies. If you calculate, it is sad to say for all the panelists and principals and faculties, we are the best, and many of the PhD, MSc holders are from South Indian, Tamil Nadu, and still our students are not clearing the exam. Why we don't know, because see, out of 8,000, not even 1% we didn't clear the exam. Not even 50 students or 100 students. I think now people are coming. Previously, if you see, last 4 or 5 years, not even 200 or 500, we have the list actually. So what is the drawback and what is the lack here? And we are all educated and we are going advanced compared to other state in nursing, but still people are not clearing the exam. What is the reason behind this? And so we have to analyze ourselves and as a faculty members, and we have to ensure what they are learning. As ma'am was telling clearly about learning, and students have more opportunity. Our faculties are good and they are PhD and faculties and MSc faculties. Why the students are not utilizing? The question is why the students are not utilizing. Yeah, you come for here. First of all, you should know the cadre of the government, which is they are given the cadre from beginning nursing officer, which is not like sister grade 2, and staff nurse, which we know before 2 years. So now the cadre is nursing officer, which the entry level will be the nursing officer. Yes, when you enter, this is eligible criteria as BS nursing fresh candidate, and you can see here senior nursing officer, and then ANS, and then deputy nursing superintendent, and then nursing superintendent, and then chief nursing officer. So what we are going to focus, I'm going to focus clinical, as well as I'm going to focus some tutor and faculty posts also. You can see here nursing officer. What is nursing officer? Who all eligible for this? Yeah. Example, have a look on 2020 recruitment of AIIMS Nagpur. Yes, eligible criteria for various posts. You can see here, this is the pattern of the advertisement which will come. It is open for all Indian government candidates. It is not only for the Nagpur candidate. Yes, you can see they have given the advertisement, and it will be in each and every advertisement in their own website. You can see here, aimsnagpur.edu.in. Yes, so they have given the vacancy, number of vacancies, staff nurse grade 2. It is modified as a nursing officer and principal lecturer post, right? So you see who all can apply and how it is possible. You can see here eligible qualification. This is proof. Yeah, you can see here BSc nursing, honors BSc nursing from Indian Nursing Council recognized by university, or BSc post certificate, or BSc nursing from Indian Nursing Council, registered nurse. There is no experience. You can see for the BSc freshers, it is a great opportunity to just observe these vacancies and utilize maximum during your 4th year period and during internship, and you can easily able to clear the exam, because we have the good faculties, and all faculties are mostly PhD and MSc holders, and make them utilize and try to seek awareness. It is not like only one side they will be pushing you to study. You have to take steps where the vacancy is coming. You just learn yourself. As madam said, you have plenty of online applications. You can go and see the website and everything, and you see diploma candidate, those who are studying from government hospital, for them it is 2 years of experience. They have to work for 50 better, at least 2 years. You can see at least 2 years. For freshers, BSc, it is directly you can apply, and for diploma candidate, they have to work for 2 years at least, right? Yeah, you come for this. There will be online based tests. You can see online examination will be there, conducted across India. You don't want, previously it was like OMR sheet, which we have written exam when we are writing 2012. Yeah, it was OMR sheet. Nowadays, you don't want to come to Delhi or other state. You can sit in Chennai and you can write the exam. The centers are distributed across India, right? If you are applying for any AIIMS, these centers are distributed across India, right? In Chennai, Madurai, Trichy, the centers will be there. Coimbatore also centers will be there, 4 or 5 centers. So you can prefer your center and you can write the exam, right? Yeah, you come for the senior nursing post. Yes. What is senior nursing officer post? You see, people are working for private hospital, getting 14,000 salary for freshers. You imagine yourself, if you work for 3 years in any hospital like Apollo, to SRM, 200 bedded hospital, you are eligible for applying the senior nursing post, which is applicable for any aims. Because if you see, vacancy is coming every year. Senior nursing post is there and nursing officer post is there, but you should know aware of this. You see, 200 bed hospital, at least they need a 3 years experience. You can see here. Yes. Yes. So this is all about senior nursing post. You can see that it is given clearly here. 3 years experience needed. Only 3 years. Yeah. So what is ANS? You know, ANS post, when you have retirement at the age of 58, we will be getting in. If you work in JIPMER, if you work in AIMS, New Delhi, we'll be getting ANS post at the age end of 58 or 60. But still, new AIMS, they come with the 6 years experience in clinical. At the age of 30 or 32, you may be entering an ANS post. The pay scale will be different. Yes, I will be discussing the pay scale also, so that people will know what is happening, right? You see, 6 years of experience after BS nursing or post BSc, yes, and work as a ward in charge or anything, they're asking 6 years maximum. So how many nurses are there working in private hospital more than 10 years without aware of this after BS nursing? So every AIMS, they are recruiting every year, every 6 months, every 3 months, there is a NS post, senior nursing officer post, and we are not aware of this, right? And what is the pay scale? I will come. What is the pay scale? You can see from the basic. And the principal post, okay, yes, principal post, those who are having PhD and MSc, 10 years of experience. Yeah, I'm very happy to see, tell many of the AIMS vice principal and nurse, regarding teaching, and our nurses are there, our faculties are there, because MSc PhD holders only from South, we have more. So they are utilizing the opportunity, and still people are not aware of this. You can utilize. And lecturer in nursing, you can see master degree in nursing from recognized university, 5 years of experience with minimum 2 years of teaching experience. So this is lecturer. Your pay scale will be totally changed and everything. This is for teaching. Yes. And the freshers, MSc nursing graduate, they can apply for clinical instructor, tutor post in any aims. MSc nursing graduate. Yeah. Come for the pay scale. You know what is pay scale? Yes. You see, 7th pay commission, this is level 7. Many people are not aware of the pay scale, which is given by the government of India for the nurses. And we are going and working private for 14,000. And you see, what is the 44,900 to 1,42,000? And you see, when you enter, what is the entry level pay you will get? Once you got the job at 22, at the age of 22, yes, what is your pay scale if you work in government? If you work in private for 6 months, you will get 14,000 into 6, 65,000 you will get. Then what is the entry level pay in government nursing officer? You can see, I have calculated here with the proof I am having, because people may not aware of this. You can see the proof. The entry level pay of the fresh graduate at the age of 22 years is 76,521. You have lot of opportunity here for the BS nursing graduate freshers. With the proof I have, you can see with proof. Yes, the entry level is 76,500. Why we people are not utilizing? Still we have plenty of opportunity. Our practical skills are good and everything, and still we are going to Gulf countries. What is the use of going to Gulf countries? Yes, there is no use, because they are paying 1 lakh. If you go to European countries, that is good. Yes, so Indian government are paying good salary, and why we are not applying for this exams? You imagine yourself and you ask your question yourself, right? Yeah, you come for here. The pay scale, I want to be clearly with the proof. This is my ward med colleagues. You can see here proof. Made 220. Yes, last month pay scale. He joined in February. Newly joined in AIMS. You see the pay, basic pay. Yes, and total 65,000 in and. But you can see the HRA. HRA still he didn't get. HRA is 12,000. It varies, depends on the cities. So you add 12,065 plus 11,500, it will come 76,000. This is the fresh graduate at the age of 22 years. He joined in our department 4 months before, and he is getting the salary of 70,000. Then why we are not applying? That is my question. Why we are not applying? Yeah, you come for here, senior nursing officer. You can see this is senior nursing officer post in AIMS Mangalagiri. Our friend Dhanasagar was working there. Yes, after 3 years of clinical experience, you are getting salary of almost 1 lakh. You see, with 1 lakh, with proof I am showing. Why we are not applying for this senior nursing officer post? Yes, maybe 10,000 will be decreased. Yes, instead of getting 15,000 in private or 20,000, you have a great opportunity to establish yourself in clinical side. Yes, Yeah. So this is all about pay scale. If you go for ANS, if you go for, you see, for senior nursing officer post is 1 lakh. Then you think about ANS post. After your 6 years of experience in clinical, what is your pay scale? You can see here. 15,600, 39,100. Pay scale is 5,400. They'll be getting almost 1,30,000 per month. It may be after your 30 years or 35 years. So apart from this, every AIMS has their own quarters, and every facilities are good. Yes, we have plenty of facilities, new, especially new AIMS. Not I'm not telling about Delhi AIMS. I'm just telling about new AIMS. We have plenty of facilities, quarters, and family. Everything is available. Yes, yeah. You come for here. Then we have, yes. Either you prepare yourself. We should thank SRM. I would like to thank SRM management, Madam Dr. Kanyamal, especially because many of the students, those who studied in SRM crash course, which we conducted for competitive exam last 2 years, they have placed in various part of the hospital, railway, ESI, and Delhi AIMS. We really, many people had appreciated the thanks to Dr. Kanyamal ma'am, because she is the only person who given us permission to conduct the competitive exam awareness, and that awareness make at least 100 students last year to clear the exam, and they came out of the Tamil Nadu and they have settled across the India. So your preparation from your hand, and only thing we can give your idea what to study and how to study, make utilize of the faculties very well, because they are highly qualified. Our nursing faculties are highly qualified. Please utilize maximum them and just get an awareness of this. Yes, you see here, SRM Institute, the last 2 years, they have been conducting the competitive exam crash courses along with the Meteor, New Delhi coaching centers, and the coaching centers are important. Why I'm giving this is important, because you know that, as Madam was telling Akash, nowadays nursing coaching centers are important. We are here for last 10 years in Delhi. So I'm the teaching faculty for Meteor for last 4 or 5 years, and people are, just to create awareness, we came to South only through SRM. If SRM is not there and there is no awareness of the competitive exams, the Madam has given 2 or thrice, three times we have did crash courses very well. Many people have got achieved. You can see the photos. We are very happy that many people are achieved. Those who attended the SRM crash course, and Madam accepted their invitation. She given 5 days permission to establish the competitive exam training, especially. So to create awareness, you can see the people, these all people who placed in Delhi AIMS and the various hospitals, they're very happy about because you see, once the age crosses, at the age of 30, maximum at the age 30 only you can apply. After that, you are not eligible for apply for the any post. Yes, before 30, you have to enter into the government sector. So these people are, some people are at the age of 30, and some people are freshers at the age of 24. So at the age of 24, they are very happy now, and they are getting 80,000 salary. And really, we are proud to them from the Tamil Nadu. Recently, they have joined last month. Yes. So apart from this, how to crack exams and everything, we have the free desk. You can call at any time and approach us how to if you have any doubt on how to clear exams, what to study. And you can see the first crash course the Madam was initiated is really appreciable, and we should thank Dr. Kanyamal ma'am once again that the initiative part today it is reaches more than 5,000 nurses. Still we have 5 lakhs nurses, but we reached up to 5,000 nurses, because people are thinking, yes, we can finish the nursing and we go to Gulf countries. Yes, you go to European countries is well and good, but why you are going to Gulf countries, that we don't know. Because some people are calling us and asking, sir, what to do after BS nursing? During the 4th year, you be mentally prepared what to do, because our life, we have to survive with the nursing. Yes, 4th year, at the end of 6 months, you start preparing for the competitive exams. Yes, this is mandatory. Next coming 10 years, you have to be competitive in your world. Yes, so you have to be very challengeable, and how to you are going to compete with the other state. Yes, we are having good practical knowledge. You see, I'm very happy to see the candidate who are sitting in the SRM audience, SRM conference hall. It's very we are very proud to say that once again, Madam initiated this, and those people, see, I can point out, she is working in AIMS Saptajan, and many people I can point out here. These are the SRM students. Many people are working there in Delhi. Yes, you can see. Do you know the competition across India? Yes, you see, these are the competition. I just creating awareness. These people, these are the people, they are sitting and studying in coaching centers at the end of 4th year. After 4th year, they are not going to job. They are studying for at least 6 months. Their calculation is 6 into 14, 70,000 approximately. You study for 6 months and get the job, and life is settled. And we people are not aware of this, and we are fighting for MRB. And the only state which we have contract basis for 5 years is Tamil Nadu. Even all the nurses, all states, they are giving good salary initially for the nurses. Because I also graduated from MMC, and I worked for contract basis, and I escaped from there, and I settled my life. So it depends on individual how you are going to develop your career. Only like madam can initiate you, and you can create, madam can create awareness. But how we are going to establish yourself and come across the country or across the world, right? Yeah. Though almost we have come with the session end, because I don't want to continue with this. I just this is more than enough for 10 to 15 minutes. If you want to come, if you have the number and you can see the numbers, and we have Meteor is coming with the especially for South Indians, and you can see the branch office, and Pondicherry also is there. You can have the number. If you have any free nursing career opportunity, free guidance and support. Yes, we have the senior nursing officer from Mangalagiri. Yes, and Mr. Dhanasegar, you can take the contact number, or you can contact me as a nursing officer AIMS Delhi for the last 10 years. You can contact me. So it is about my session. So there is no substitute for hard work. All the very best. Once again, I thank to Madam Dr. Kanyamal for giving me this once again in front of great leader panelists. I have seen the panelists, all are PhD doctor from various college of nursing. I'm really proud. So part of this, and once again, thank to SRM faculties. They are doing the great job. Whenever we come there, also whenever through the online, also they are doing the great job. Really, it's an appreciable one. Thank you, ma'am. Thank you so much for this 10 to 15 minute speech. Thank you so much.
Thank you so much. And the audience are asking, sir, presentation little slow, because they are asking.
I thought that it's time. I don't want to waste the time. So.
Anyhow, the message might have displayed, and then we used to even display during the time of other webinars also. Following days also, we will disseminate the PowerPoint will be displayed. No
yes,
problem.
Yes,
and I think so. Yeah, I really thank Rajkumar. He is having a lot of interest in helping our South Indian people to take up that opportunities in North. So initially they may have the fear the North side, maybe the Hindi speaking, and going and staying in North, they feel very difficult. But now the move is in different area in Southern side also aims. I believe. So the candidates will definitely take up challenges in future. I think it will be eye-opening for all of us, for all the students from various parts of the college. So I would like to disseminate the message immediately. When you asked, immediately I just reported, and then I get a separate ID for you from ITKM to enter into a lot many. All our management is far too. For everything, for helping people to come up, and for the students' sake, throughout the nursing in all the colleges, they are going to get benefit out of it. Not only for SRM, so for all the nursing students in and around Chennai, and they may have the friends from various other colleges also. They are attending government college, and the people are coming in the line. So yes, they also will definitely disseminate the message. I think it will be good for the students and for you. And one thing which I would like to say here. So nowadays, the competitive exam, many of the students are not clearing. The problem is the pattern of examination. Now, the Indian Nursing Council long ago, for the syllabus, it is not focusing on that everything is MCQ type. It is vanished off. So again, the new syllabus is going to be existence, I think. In that, the credit based and like time of, then if the MCQ is there, automatically they have to study Newton Corner. So that may be a one lackness I felt. So as being a teacher, as being an administrator, but out of that, the students' interest only they can able to develop.
Yes.
And they need to have a focus. So we are creating awareness through various means, as like Meteor Group, and they are individually, if the Kerala, for example, Kerala, the students are very focused. And they used to go for NCLEX exams and all other IELTS, and then they are moving to. So that is, there are a lot of opportunities in front of us for the youngsters throughout the globe, not only for here, throughout the globe, even for day after tomorrow and day after also some Australian immersion program they are asking for. So I told, okay, let all the candidates get benefit out of that. I am getting the link ID for that person also for tomorrow and day after. During the same time, they will disseminate the message to all, because let all the students, all the administrators, let them understand about that, and we can help the students also. The opportunities and openings where it is available within. So for example, for the boys, Rajkumar may be a very big motivator, because boys can go anywhere. Within 30 years, the life settlement will be there. So during that time, so at least they will definitely take up. The girls may be still some wavering because they want to. That is also another reason. Problem is the girls, the families, they may not leave them to immediately to north side, and they want to settle in life. So that is their request, parents. And after that, I had one girl, Vanilla, her name. You may be knowing her, I think. No, she has joined in AIMS. Which AIMS, I don't know. From Meenakshi. She was a faculty. MSc is a very good candidate. And along with her husband, he tried, both of them were settled in AIMS. So that in that manner, they may move along with the family. So that may be 1 lakh.
We have that opportunity. If you got settled also, we have the opportunity. After sometimes the family can shift. They should know the awareness of 3 years or 6 years of experience. Then how to move. That is the important thing.
That now clear cut, because they may not be knowing earlier, but now you are breaking the ice, and you are just putting informations very clearly about availability, and then the many branches of AIMS. Definitely they will take up into account, and they will clear the exams, and many of them will be getting benefit out of this through this webinar. I think so.
I think so. Hope so.
I hope so. And definitely for the following days also we will display it, and no problem.
Yes,
and the other opportunities also, we are just making an awareness only. Rest of the thing, only the candidate have to take up that thing. So the reason began, so in the new syllabus, at least all MCQs and very objective focused questions, if it is now they are emerging with ASCII type, so they may have a different learning in the situations. It will be a challenging for them also. Definitely they will come through with awareness. They will definitely take up these challenges, I assure.
Thank you, ma'am. Thank you so much.
And a special thanks. He is having a night duty. With that night duty, he break that, and then he wants to talk. So it's okay, madam. I will come, madam. No problem. So, okay. Anyhow, thank you for your sacrifice and your interest in motivating people. Definitely, that is no replacement for that. Rajkumar is Rajkumar.
Once again, the opportunity once given by SRM only, we can establish ourselves.
Our SRM for nursing or any students with favor, definitely they will extend the help. So that they are very very open and frank to help for students.
Yes,
so
yes,
even for the medical college,
that we know very well. Last 2 years, how the faculties are everything. They are so helpful.
And, one more thing, our faculty also, all the 5 days they
are really great work.
They used to work along with, and then they are very good in supporting that. Definitely, that help we are able to extend at any time.
Okay, ma'am. Okay, ma'am. Thank you so much, ma'am.
Thank you so much, and I'm going to have your nap for your meeting.
Thank you so much.
Okay, thank you all. Special thanks for Sushila also. Still, she is there.
Yes, ma'am. Yes, I think so.
Okay, so I think it's lunchtime, but even more than 600, around 640 audience are there still. But we will display it for the following days also.
Yes, ma'am. Yes, ma'am. Sure.
Okay, later on, after the COVID, we will decide on any other thing, whether it can be possible.
Yes, ma'am. Yes.
Okay, thank you. Thank you.
Thank you, ma'am. Thank you so much for all. Thank you, ma'am.
Thank you. Thank you all. We will break for lunch.
We will break for the lunch, ma'am. Thank you, Rajkumar sir, for your resourceful presentation.
Yeah.
Ma'am, shall we break for lunch, ma'am?
We can break.
Then next session, ma'am, by 3 o'clock, ma'am.
Okay. Now
it is 2:15, ma'am.
Now it is 2:15, huh?
Yes, yes, ma'am. around 2:50.
By time we can start, no?
Pardon, ma'am?
2 o'clock is okay, no? I have to start.
Yes, ma'am. It is 2:15 now, ma'am.
Okay, it depends on one more speaker is there, no? After that,
No, ma'am. Your presentation is in the afternoon, ma'am.
no,
That is after lunch.
I know
Post
that.
lunch.
Following to me only, I am asking.
No, ma'am.
Only one session.
Only one session is there, ma'am.
Okay, then it depends on the any time. 3 or 3:30 also okay, no problem.
Okay, ma'am.
It
Then
depends.
we'll come back by 3:30, ma'am. We'll join back by
Or
3:30.
otherwise 3 o'clock also for me, no problem. Whether the audience will come, that is my question. I can come. Even now also I can continue, but that the problem is not with me. So you have to give time for the audience, no, to rejoin.
Yes, ma'am.
So 3 o'clock, it's okay, means okay, or otherwise to the 3:30 also okay. No problem for me. The audience has to come. So that's the question.
Then we'll give time, ma'am. 3:30 we'll start, ma'am.
Yeah. 3 o'clock, if they are coming also, for no problem for me. Either the teachers have to be there. That is the issue, no? Or otherwise, we will disclose, no? They can move for 4 o'clock. You decide, or otherwise.
No problem. No problem, ma'am. I will end the session, ma'am.
No,
We'll start. I'll end the session, ma'am.
No. You do one thing.
Yes, ma'am.
3 o'clock.
Okay, ma'am.
We will start the session.
Okay,
Whoever comes, let them join. Only.
Okay. Okay, ma'am.
Speak, yeah.
Okay, ma'am.
Do
Okay,
that.
ma'am. Thank you, ma'am. So we'll break for
Ma'am,
lunch
I'm
now.
here only. Thank you. Sorry, I couldn't respond because my net was not able to unmute. You were asking. I'm here only. Thanks to Rajkumar, he presented also well, very useful information. Thanks, ma'am. I am completely here only. Only thing I was not able to unmute because of the
That's what I called. Your microphone.
Yeah,
is
you
on.
called me. That's why I was not. That's why I'm coming now. I was not. Okay, thank you, ma'am. Thank you so much.
Thank you so much. And it will be just a message for all the students. That's why I called him also to disseminate.
Okay, good. That is a very good. Very good. Very good. No problem.
Yeah. And for tomorrow also, tomorrow and day after also, they are going to have some Australian concerns. They used to come and talk about.
Yes. Okay. Bye, ma'am. So have a great lunch. Then I will rejoin definitely for 3 o'clock. Okay.
Thank you.
Bye. Bye.
Thank you, ma'am. Thank you, Susila, ma'am. We'll break for lunch now. 3 o'clock. I request all the participants to join back by 3 o'clock for the afternoon session. Thank you.
No, I can leave the meeting now.
Yes, ma'am. No, ma'am. The meeting will not be closed, ma'am.
Okay. No.
Meeting will not be closed.
Okay. It is not only something you are going to play.
Yes, ma'am.
Yeah.
The fact of being a nurse is something of very much pride, since between the responsibilities that we have, the import more they are to preserve the life, to relieve the suffering, and to promote the health. Being a nurse is not an easy job. A profession focused on the health of people requires a lot of preparation and human quality, and that's why studying becomes essential to accomplish our career goals, and at the same time, it provides us with the tools needed to grow and become
Created using Powtoon.
I found that nothing in life is worthwhile unless you take risks. Nothing. Nelson Mandela said, "There is no passion to be found playing small and settling for a life that's less than the one you're capable of living." Now, I'm sure in your experiences in school and applying to college and picking your major and deciding what you want to do with life, I'm sure people have told you to make sure you have something to fall back on. Make sure you got something to fall back on, honey. But I never understood that concept, having something to fall back on. If I'm going to fall, I don't want to fall back on anything. I want to fall forward. I figure at least this way I'll see what I'm going to hit. Without consistency, you'll never finish. So do what you feel passionate about. Take chances. Don't be afraid to fail. There's an old IQ test was 9 dots. And you had to draw 5 lines with a pencil within these 9 dots. without lifting the pencil. The only way to do it was to go outside the box. Don't be afraid to think outside the box. Don't be afraid to fail big, to dream big. But remember, dreams without goals are just dreams. Reggie Jackson struck out 2,600 times in his career, the most in the history of baseball. But you don't hear about the strikeouts. People remember the home runs. Fall forward. Thomas Edison conducted 1,000 failed experiments. Did you know that? I didn't know that. Because the 1,001st was the light bulb. Fall forward. Every failed experiment is one step closer to success. You've got to take risks, and I'm sure you've probably heard that before, but I want to talk to you about why that's so important. You will fail at some point in your life. Accept it. You will lose. You will embarrass yourself. You will suck at something. There's no doubt about it. And I know that's probably not a traditional message for a graduation ceremony, but hey, I'm telling you, embrace it, because it's inevitable. In the acting business, you fail all the time. Early on in my career, I auditioned for a part in a Broadway musical. Perfect role for me, I thought, except for the fact that I can't sing. I didn't get the job. But here's the thing. I didn't quit. I didn't fall back. I walked out of there to prepare for the next audition, and the next audition, and the next audition. I prayed. I prayed. And I prayed. But I continued to fail, and fail, and fail. But it didn't matter, because you know what? There's an old saying. You hang around the barbershop long enough, sooner or later you're going to get a haircut. So you will catch a break, and I did catch a break. Last year, I did a play called Fences on Broadway. But here's the kicker. It was at the Court Theater. It was at the same theater that I failed that first audition 30 years prior. The point is, every graduate here today has the training and the talent to succeed. But do you have the guts to fail? If you don't fail, you're not even trying. I'll say it again. If you don't fail, you're not even trying. To get something you never had, you have to do something you never did. Imagine you're on your deathbed, and standing around your deathbed are the ghosts representing your unfulfilled potential. The ghost of the ideas you never acted on. The ghost of the talents you didn't use. And they're standing around your bed, angry, disappointed, and upset. They say, we came to you because you could have brought us to life, they say. And now we have to go to the grave together. So I ask you today, how many ghosts are going to be around your bed when your time comes? I just got back from South Africa. It's a beautiful country, but there are places there with terrible poverty that need help. And Africa is just the tip of the iceberg. The Middle East needs your help. Japan needs your help. Alabama needs your help. Tennessee needs your help. Louisiana needs your help. Philadelphia needs your help. The world needs a lot, and we need it from you. We really do. We need it from you young people. I mean, I'm not speaking for the rest of us up here, but I know I'm getting a little grayer. We need it from you, the young people, because remember this. You got to get out there. You got to give it everything you got, whether it's your time, your talent, your prayers, or your treasures. What are you going to do with what you have? I'm not talking about how much you have. Some of you are business majors, some of you are theologians, nurses, sociologists, some of you have money, some of you have patience, some of you have kindness, some of you have love, some of you have the gift of long suffering, whatever it is, whatever your gift is. What are you going to do with what you have? All right, now here's my last point about failure. Sometimes it's the best way to figure out where you're going. Your life will never be a straight path. I began at Fordham University as a pre-med student. I took a course called cardiac morphogenesis. I couldn't read it, I couldn't say it, I sure couldn't pass it. So then I decided to go into pre-law, then journalism. And with no academic focus, my grades took off in their own direction. I was a 1.8 GPA. And the university very politely suggested that it might be better to take some time off. I was 20 years old. I was at my lowest point. And then one day, and I remember the exact day, March 27th, 1975, I was helping my mother in her beauty shop. My mother owned a beauty shop up in Mount Vernon. And there was this older woman who was considered one of the elders in the town. And I didn't know her personally, but I was looking in the mirror, and every time I looked at the mirror, I could see her behind me, and she was staring at me. She just kept looking at me. Every time I looked at her, she kept giving me these strange looks. So she finally took the dryer off her head and she said something I'll never forget. She said, "Young boy, I have a prophecy, a spiritual prophecy." She said, "You are going to travel the world and speak to millions of people." And in the years that followed, just as that woman prophesied, I have traveled the world and I have spoken to millions of people through my movies. Millions who up till this day couldn't see me, who up till this day I couldn't see while I was talking to them, and they couldn't see me, they could only see the movie. They couldn't see the real me. But I see you today, and I'm encouraged by what I see, and I'm strengthened by what I see. Because taking risk is not just about going for a job. It's also about knowing what you know and what you don't know. It's about being open to people and to ideas. The chances you take, the people you meet, the people you love, the faith that you have, that's what's going to define you. Never be discouraged. Never hold back. Give everything you got. And when you fall throughout life, remember this: fall forward. I found that nothing in life is worthwhile unless you take risks. Nothing. Nelson Mandela said, "There is no passion to be found playing small and settling for a life that's less than the one you're capable of living." Now, I'm sure in your experiences in school and applying to college and picking your major and deciding what you want to do with life, I'm sure people have told you to make sure you have something to fall back on. Make sure you got something to fall back on, honey. But I never understood that concept, having something to fall back on. If I'm going to fall, I don't want to fall back on anything. I want to fall forward. I figure at least this way I'll see what I'm going to hit. Without consistency, you'll never finish. So do what you feel passionate about. Take chances. Don't be afraid to fail. There's an old IQ test, was 9 dots. And you had to draw 5 lines with a pencil within these 9 dots without lifting the pencil. The only way to do it was to go outside the box. Don't be afraid to think outside the box. Don't be afraid to fail big, to dream big. But remember, dreams without goals are just dreams. Reggie Jackson struck out 2,600 times in his career, the most in the history of baseball. But you don't hear about the strikeouts. People remember the home runs. Fall forward. Thomas Edison conducted 1,000 failed experiments. Did you know that? I didn't know that. Because the 1,001st was the light bulb. Fall forward. Every failed experiment is one step closer to success. You've got to take risks, and I'm sure you've probably heard that before, but I want to talk to you about why that's so important. You will fail at some point in your life. Accept it. You will lose. You will embarrass yourself. You will suck at something. There's no doubt about it. And I know that's probably not a traditional message for a graduation ceremony, but hey, I'm telling you, embrace it, because it's inevitable. In the acting business, you fail all the time. Early on in my career, I auditioned for a part in a Broadway musical. Perfect role for me, I thought, except for the fact that I can't sing. I didn't get the job. But here's the thing. I didn't quit. I didn't fall back. I walked out of there to prepare for the next audition, and the next audition, and the next audition. I prayed. I prayed. And I prayed. But I continued to fail, and fail, and fail. But it didn't matter, because you know what? There's an old saying. You hang around the barbershop long enough, sooner or later you're going to get a haircut. So you will catch a break, and I did catch a break. Last year, I did a play called Fences on Broadway. But here's the kicker. It was at the Court Theater. It was at the same theater that I failed that first audition 30 years prior. The point is, every graduate here today has the training and the talent to succeed. But do you have the guts to fail? If you don't fail, you're not even trying. I'll say it again. If you don't fail, you're not even trying. To get something you never had, you have to do something you never did. So imagine you're on your deathbed, and standing around your deathbed are the ghosts representing your unfulfilled potential. The ghost of the ideas you never acted on. The ghost of the talents you didn't use. And they're standing around your bed, angry, disappointed and upset. They say we came to you because you could have brought us to life, they say. And now we have to go to the grave together. So I ask you today, how many ghosts are going to be around your bed when your time comes? I just got back from South Africa. It's a beautiful country, but there are places there with terrible poverty that need help. And Africa is just the tip of the iceberg. The Middle East needs your help. Japan needs your help. Alabama needs your help. Tennessee needs your help. Louisiana needs your help. Philadelphia needs your help. The world needs a lot, and we need it from you. We really do. We need. I'm not speaking for the rest of us up here, but I know I'm getting a little grayer. We need it from you, the young people, because remember this. You got to get out there. You got to give it everything you got, whether it's your time, your talent, your prayers, or your treasures. What are you going to do with what you have? I'm not talking about how much you have. Some of you are business majors, some of you are theologians, nurses, sociologists, some of you have money, some of you have patience, some of you have kindness, some of you have love, some of you have the gift of long suffering, whatever it is, whatever your gift is. What are you going to do with what you have? All right, now here's my last point about failure. Sometimes it's the best way to figure out where you're going. Your life will never be a straight path. I began at Fordham University as a pre-med student. I took a course called cardiac morphogenesis. I couldn't read it, I couldn't say it, I sure couldn't pass it. So then I decided to go into pre-law, then journalism. And with no academic focus, my grades took off in their own direction. I was a 1.8 GPA. And the university very politely suggested that it might be better to take some time off. I was 20 years old. I was at my lowest point. And then one day, and I remember the exact day, March 27th, 1975, I was helping my mother in her beauty shop. My mother owned a beauty shop up in Mount Vernon. And there was this older woman who was considered one of the elders in the town. And I didn't know her personally, but I was looking in the mirror, and every time I looked at the mirror, I could see her behind me, and she was staring at me. She just kept looking at me. Every time I looked at her, she kept giving me these strange looks. So she finally took the dryer off her head and she said something I'll never forget. She said, "Young boy, I have a prophecy, a spiritual prophecy." She said, "You are going to travel the world and speak to millions of people." And in the years that followed, just as that woman prophesied, I have traveled the world and I have spoken to millions of people.
Ma'am, shall we start, ma'am?
3 o'clock, ma'am. Shall we start, ma'am?
Yeah.
Around 340 plus participants are there, ma'am.
Okay, we'll start.
Yes, ma'am. Thank you, ma'am. I welcome you all for today's afternoon session. Expert speaker for the session is our respected Dean, Dr. C. Kanyamal, ma'am. Madam's diligent, tireless efforts, perfectionism, meticulous planning, directions, and guidance had brought in many developments to SRM College of Nursing. She always tries to get the best out of us, whether it is faculty or students. She remains as a pillar of support to all of us. I hope all the participants who are watching, you would have noticed that the reflections about Dean ma'am by the eminent speakers, the panelists who had deliberated during the webinar. It is the fruit of hard work of Madam. I am privileged to welcome our most respected Dean, SRM College of Nursing, to deliberate on the roles and challenges of nurse administrators in successful technology implementation. We welcome you, ma'am.
Yes. So very warm good afternoon to one and all gathered here, all my dear faculty and dear students. So here I would take little time only. So that what is a known fact only. I'm not going to deal about a lot of technologies in this, how it is going to be applied. So that is the thing. And what is the challenges that as an administrator we have to face. So in future, so that's the thing. And what it is existing in the current scenario, and what may be a new technological changes, how we can able to elicit some of the thing in implementation phase, what are the challenges we may come across. So that is the simple one only for you to easy understanding. So nothing make you to bore. So some of the known fact only I would like to present over everyone. Almost in fourth year, in the management and administration, you might have studied. For the beginners, maybe a little new for you, and for the students and other faculty, there's a known fact. Some of the thing I can even skip also, no problem. So anyhow, whatever the things I would like to present in front of you, then we will have a discussion if necessary, any of the doubts at the end. Okay, the topic given is today topic is the role and challenges of nurse administrator in successful technology implementation. So here, as a nurse administrator, so healthcare administration carries a lot of responsibility, but it can be immensely rewarding. So that it will be rewarded in terms of quality patient care, and then in quality nursing students liberations. So that is the reward. And nurse administrators not only act as leaders, but they handle complicated matters such as policy, management, finance management, and human resource management. So this is somewhat trivial matters, so that it has to be handled effectively by the administrator. The definition of nursing leadership and management can be summarized in such a few words. So that is a role, is simply a role of management or a leadership. So it lead to only planning, organizing, facilitating care delivery at the bedside, and staffing, scheduling, training. So like simplified functions, maybe the leader and then the below level managers, they may take up at the department level. But administration is little big, it is higher than the management and then the leadership. So that only you need to know. So as nurse administrator, what are the responsibilities we have to take up in hand? So the managing, overseeing the work done by the nursing personnel, various cadres. So it has to be looked into. For example, in service side, you will be knowing from staff nurse to the supervisor, ward in charges, and then deputy nursing superintendent and assistant nursing superintendent. Various cadres will be there, and we have to oversee all the personnel. And the interdepartmental also, we have to have a link. So like a lot of responsibility in managing, overseeing the work done by the nursing personnel, specifically nursing personnel, and allied professionals also may be under the control of nursing administrator, like some other housekeeping persons and all other lab or some other related persons concerned with the patient care also it is coming under. If the doctors comes, she is only responsible for answering for everything. So the responsibilities are more. Making effort to improve the quality and efficiency of the patient care, serving as a liaison between governing boards, staff, and departmental heads. So little higher than manager. So nursing management or lower level, middle level. So we have various level. So the top level is having a lot of liaison between the governing board and staff, and then the departmental heads. And developing a budget, approving the expenses, setting rates, and managing other financial issues also for purchase of equipments. For example, maybe the wards, so maybe that ICU setup. Now also they are going to develop a lab, virology lab in our SRM. So like that and all, that nursing administrator also will be taking part in that. And here the medical professional is all taking up a hand to having the control of a hospital. For example, in CMC and all. So they have a separate administrative control. So a well-qualified person will be nursing superintendent. He is an administrator over there. So they have high authority and responsibilities in planning of budget, approving expense. It depends on the organization. It differs a little bit, the authorities and then the power, everything will be differing from each institution, not one and the same. But in other countries, a little more higher than they involved in policy level making everything. So in other setups, it's very, very highly appreciable administrator job and responsibilities. And overseeing or participating hiring of new staffs. So conducting an interview and recruiting personnel. So it depends on the needs. So that and all, it's the responsibility of the nurse administrator. And coordinating training after taking those persons. So immediately they cannot able to place everywhere. They need to be procured with proper training. So training for a period of maybe 2 months or 3 months, it depends on the policy, or continuing education. Like, for example, in my observation, even in Cherian Hospital, so that Triple M Hospital, as soon as if you are placed as charge, immediately if you are going as a nursing officer, as what we have heard, or a staff nurse, here the existing position is staff nurse. So they may not be placed immediately to the cardiac wards or another thing. They are giving orientation so for a training for 2 months or 3 months, and they need to clear the exams. Then only they will be placed as real permanent staff over there. Till then, as like in our days and all, the students will be for 3 months. They will not send to the ward. Now also we are not sending for the BSc for taking classes. And in those days, the diploma also in the 3 months is that is they will not send the students to the ward, and they will be full given of training and other thing. But the staff nurses are not like that. They'll be placed in somewhat easy responsible wards, and but they have to every day they have to attend the classes, and they have to conduct exams. They have to qualify then only they will be placing us regular staffs. So there is a system of training. Yeah, depends on the institution. So then an administrator has to arrange for and evaluating services to make improvement. So improvement and manage the risk factors. If anything, if any risk occurs also, they have to have the caliber to manage the risk, and keeping tabs on the service. Here means tab means now the technology and resources being used, available resources to being used, and draft staff work schedules. So here maybe the daily schedule, weekly, monthly, rotation plans, they have to plan for entire hospital. Yes. And here as a leader, as an administrator taking up the leadership role, need to possess some of the qualities. A natural leader with the ability to grow strong interpersonal relationship, to have link with different people in the hospital scenario. Interpersonal relationship is very vital. An active listener and strong communicator. And she needs to be an excellent problem solver and decision maker. And team builder, a strategic planner. And analytical thinker, and flexible individual with a good judgment and organizational skill. So these are some of the attributes, the qualities that any administrator, nurse administrator should have. This one next. So here the top 10 leadership skills. So we require as a leader, as an administrator, require some top 10 skills. It is foremost. First one is inspire and motivate others. Communicate clearly and listen closely. Innovate and create. Display integrity. Develop and delegate. Display confidence and self-belief. Commit completely and have a clear vision. Challenge and take risk, as already we have seen. influence and persuade. So we need somewhat the leader also should be influential person, then only bring into changes and risk taking, management and everything can be possible. Next. So type of administration, as all we very well know, as being a managerial role as administrator, they have a 3 line of managerial role she needs to play. So the first one is the bottom one is the first line managers directly coordinating nursing services, what it is extended by. So that coordinate either the nursing students, nursing staffs, and ward in charges, how they are disseminating every day to day patient care. So that is the observation, supervising that first level. So the charge nurses will be there. Everyone, overall the nursing administrator under her. So these managers have to, the 3 layer, so that the first line managers, they have to take up the, for example, the ward in charges, and they are able to communicate to the other middle level, and then the executive level is little more higher. So that is nurse administrator. Following slide, please. So here, so this triangle, so the base is the operational level, the staff nurse and or nursing attendants, whoever may be attending, they are just giving care, disseminating care at the bedside. And the head nurse or the senior nurse, the first level. This is supervising the below operational level, and middle is above little more. So the departmental supervisors will be there. So that is middle level, and top is the nursing administrator. So that responsibilities, it is everything, it is given according to the level. So that is the thing. So this is simple organogram. For any hospital, given hospital, they follow mostly the medical superintendent. We are coming under the medical. So we are directly, we couldn't able to meet everything. So even the nursing superintendent or nursing administrator is coming under the medical superintendent in a hospital, as very well in medical college as well. Now we are also having the same type of organogram over here. And below to that, deputy nursing superintendent, assistant nursing superintendent, sister in charge, sister, staff nurse, and then group D, that is all the housekeeping works and the other people will come. So this is the easy knowing. So this organogram, for a little more clarity of that extended version of that 3 level, how it has been given from bottom to top. Yes, next. So here, this organogram of the hospital, for example, so maybe in SIMS, maybe in some corporate hospital or in central government hospital. Now we had a discussion with Rajkumar also. So that organogram of the hospital nursing, we have the chief nursing officer is the topmost person. Below to that, nursing superintendent, then deputy nursing superintendent, assistant nursing superintendent, ward sister, ward clinical supervisors, and staff nurse, and below to that, student nurses. So this is little different. Next, follow. The administrator job description. So as per the record, the job description: supervise other nurses, manage the budget, ensure the medical procedures align with government regulations, mentor and motivate staff to boost retention, maintain records on services, review and evaluate staff performances, ensure operational official meetings, and the cost savings, budget. So that cost saving is the budget. Efficiency, cost effective care, operational level, at the level of operational. So for example, whether they are functioning effectively, so that manpower is utilized effectively. So that is the thing we have to ensure. Next. So here, director of nursing, another designation also. Some hospitals they have, some corporate sectors, they used to give a director of nursing title for a nursing administrator. So another way. So that is also a supervisory position, responsible for some hospital that administrator, director of nursing is below to administrator. Some hospital director is just top level. So there is some Here and there some differences will be there, depends on the organization. They used to have this positionary challenges and all. So here the supervisory position is responsible for, again, the planning, directing and evaluating the nursing services offered at the medical facility. So or a home, nursing home or rehabilitation center, small places they used to have. Even for example, even our madam here, Sundari Edwin madam also was working as a nursing director there in Sims Hospital. It is a corporate, a little lesser bed strength hospital. So it has been designated as director of nursing. She had to hold the post. After coming here, she has some other post over here because the director is here somewhere in a little higher post, and then they want to keep some new designation. That's why she got the new designation of Chief Clinical Nursing Education and Nursing Practice and Clinical and Nursing Education Administrator. Like some different nomenclature, she got into a job title. So, but it differs on the organization, and that and all not existing post. Only these kind of posts, many places they are employing like this director of nursing, nursing administrator. So this and all commonly used everywhere. Responsible for determining the staffing need, writing the job description, and implementing quality assurance program, administering disciplinary actions if so, and planning of the departmental budget, and maintaining procedure manual, and developing written policies and other tasks, and knowledgeable of medical practices and skillful communication skill, and tactfully having interaction with the staffs, patients, family, and other publics. So these are some of the role of the director. Is almost similar to that managerial roles or sub deputy nursing role. So like that, but the cadre, it is little higher. The director of nursing it will be, but they are overlooking all, as like the administrator, they are overlooking and they are finding out. The chief nursing officer, little more higher. In some places it is existing in like central government. So in many places this term is utilized, chief nursing officer. Instead of nurse administrator, they are utilizing it, chief nursing officer. It is the executive role. So with the healthcare organization, with the focus of operational infrastructure, financial strength and efficiency of the largest system, they have to manage it. And there are several titles for this type of role, including chief nursing officer or executive director and vice president of the clinical operation. It differs with the various organizations. The title may differ. The job responsibilities or descriptions may be one and the same of all, as like a managerial role, but the designation may differ place to place. Yes. So it is again continued. And again they are doing implementing administrative practices, draft of a report for operation with the company or a managing organization of wide patient or programs, and improve the profitability of the organ, the cost, and conduct quality assessment activities, and serve as a liaison with the management staff and other departmental throughout the organization. The organogram we have seen, and apart from the other organization within the hospital purview also, they are having a link between nurses in executive level. So that is the chief nursing officer. So in collaboration with the leaders of the board of directors or CEOs and human resources of the other hospital organization also, they have a link in planning. They must stay current on nursing practice, regulations and laws related to their area of practice. So they have to be aware of all these things. Next. So what is service administration? The nursing service administration is complex for defining and of elements in interaction with this organized to achieve the excellence in the nursing care services. So it is a little bit complicated, and the objective of the nursing service in a hospital. So here, as a management perspective, the nursing service and care it has to be initiated is the set of human relations at all levels. So all 3 levels of nursing personnel, and we have to maintain human IPR and establish adequate staffing and develop the staff patient ratios. So that is staff and patient ratio. So in a medical ward or surgical ward, what 1:5 or 1:3 subacute and 1:1 it should be there in intensive care units. So like that, and extra leave reserved also, 20 to 30% leave reserved we have to plan for. So these are some of the calculations that they have to adopt while planning for a staffing pattern, and develop and implement proper communication system. So everywhere the communication should be very clear and transparent, each and through the policies and regulations they have to communicate, and develop and initiate proper evaluation and periodic monitoring. Evaluation is required and periodic monitoring. So then only where is the lacunae or any adjustment or any of the modifications we have to require, means we can do then and there. Next month. So as a role, assigned position within the formal organization, carry out specific functions, duty and responsibilities, emphasizes control, decision making and decision analysis and results, manipulate the individual and the environment, money, time and other resources to achieve the organizational goal. Formal responsibility and accountability, directing the willing and unwilling subordinate. So the subordinate handling is a very hectic task for the manager. Next. Willing or unwilling. The role of the manager should be, in nutshell, so here serves as a coach. So, and the monitor. So here as a coach and provide visibility and provide the resources for the persons, and then mediate conflict. If anything conflict between any personnel, they have to mediate or resolve that and monitor the results outcome. So these are some of the important thing to keep easy remember how the role of the manager at the implementation phase. The difference between administration and management. So here the matters of a broad policy is administration. Here the execution. So management is the execution policy, and here's the broad policy development here. So, and in terms of comparison with anatomy is the administrator structural and physiology is the execution. So that is the management. And pattern of facilities and operational units forming the healthcare system. And here detailed working of the operational unit level will be monitored by the managerial function. And direction of people in association with achievement of the temporary shared goals. Here concerned with the operations leading to organization towards the success within the broad framework set by the administration. Whatever the administration set as a goal or achievement, so here it has to be implemented in terms of outcome. Act of management and something is more than management here. Administration is for a clear-cut definitions, overlapping domain, both it is administration and management, but somewhere, so some difference. So these are somewhat minute differences. So we need to see. Some place it is hidden, both it is one and the same, some place depends of the organization. So the title and their role may interchangeably, they may use for. So these are some understanding we need to know. So here, employed to represent the activities within and subordinates to administration, often the management of activities of the personnel alone. So they are the link between the top administrator and then the below operating person. So that is the conveying between. So that is the thing. Difference between. So function as such. So these are the elements already we know, all of us. So what it means. So post-GAR for easy understanding, planning, organizing, staffing, directing, coordinating and control, reporting and recording, and budgeting. So these are the basic elements of administration is followed. So here the definitions and all you know very well, so that some of the authors, what is the planning, you know. It is a process of determining the objectives in terms of devising a mean to calculate to achieve the goal. So that's the thing. Move. Next. So the essentials of good planning you need to have: yield reasonable organizational objective first, gain economical operation, then facilitate coordination and control, reduce the future uncertainty, foundations for organization, dictate those activities to which for the implementation. So these are some of the planning essential characteristics. So here, planning process in the healthcare services, when we are doing that step, analyze the health situation first, establish objectives and goals accordingly, assessment of resources, fixing priorities, write a formulated plan, programming that interventions or implementations and evaluation. So these are some of the planning process in the healthcare sector. Then the next step is organizing. So, you know, the organized way of things for anything, a human or a resource or whatever it might be, it has to be organized for a better implementation. Yes. Move on. Move. Next. So here in the process, it involves identifying of activities, classification of group of activities, assigning of duties, a delegation of authorities and creation of responsibilities, and coordinating authority and responsibility relationship. So these are the organizational process need to have clarity. In the third step, when we are the principles, we have to follow the hierarchy principle, span of control, this and all, you know, integration versus disintegration, centralization versus decentralization, and unity of command, delegation. So the principles are 14 principles. Henry Fayol have 14 principles. So here it is some of the important thing. It has been disseminated in the nursing education. You might have read everything. Henry Fayol, the management. So staffing is the third step. So here, so the definition it goes: managerial function of staffing involve managing the organization structure through proper and effective selection, appraisal, development of personnel to fill the role designed in the structure or organogram. Accordingly, they have to take a staffing as per the requirement, various level it has to be. It involved manpower planning. So recruitment, selection, placement, training and development, remuneration, performance appraisal, and then promotion and transfer if required. So that also to be taken care. Yes. Then following that, directing. Directing is influence of the people behavior through motivation, communication, group dynamic, leadership, and discipline. How to direct the people. So that is the thing. So this directing also we involve some of the activities, so that it is giving order and leading, communicating, motivating, and making supervision. So these are some of the important activities in a directing phase. As a leader or administrator, we have to look into coordinating the service, synchronizing the people activity so that the function can run smoothly in the attainment of the organizational objectives already we have framed. Coordination in the integration process is an orderly pattern of group effort in an organization towards the accomplishment of the common objective. Yes, no. Controlling is a process of checking. So, you know, everywhere the control measures need to be for the correction of performance is required. Next. Move. So the step for control, we have a step. When we are controlling, we need to have some set standard, and then measuring performance, and then comparing, correction if required. So these are the 4 steps when we are having a keep control, the steps to be followed. Next. Reporting and recording. So this it's a written evidence. Nowadays, everything is system uploaded and retrieval. So, but in that conventional method, we know various type of records. we daily report, weekly report, monthly report, midnight we used to send for a report to the nursing superintendent office from each ward. So like that and all they are maintaining. So the reporting and recording is the strenuous process in those days. Nowadays it makes it to all e-reports, so make it is very easy to handle also. Yes. So various other types of records, which it is manual records, the clinical record, nurses observation, orders carry out, treatment, everything. It is admission, discharge, and equipment list or performance, personal performance record. So likewise, some of the records utilized in the hospital. Following that, maybe the community. So the diaries or some of the some birth register, death register, and MC, maternal child care register. So like some different records will be maintained in community setup. Next. So the budget. So the budget, move. Next move. It is the forecast of the resources required to deliver the service offered by the organization. It is a financial plan. So that it includes estimated expenses as well the income for a period of a time, maybe a yearly budget. A nursing budget is a systematic plan that it informed best estimate by nurse administrator of nursing revenues and expenses. It projects how revenues will meet expenses and project a return on equity or profit. So as like a yearly budget, the nurse administrator has to plan for. And the purposes of the planning, so here to plan the objectives, first program activities and nursing services and fiscal resource plans have been established to motivate nurse managers and nursing workers through analyzing of actual expenses to evaluate the performance of the nurse administrator and managers and increase awareness of the cost. So the cost effective care and principles to be followed while budgeting should be flexible and synthesis of past, present, and future, and product of joint venture of the participation and executive at different levels. It should be clearly defined form of statistical standard laid down in the specific numerical form, represent expected revenue as compared with anticipated expense, and facilitate good goal achievement. So these are some of the principles to be followed. Yes. So here, some futures of the budget. So again, here it is a flexible one, synthesis of the past, present, future. Some of the terms it is repeated at the previous slide also. And joint venture of the cooperation of all the level and statistical standard to be maintained, support of the top level manager. With that only we can able to plan for the future. When we are planning for a budget, everything to be considered, the top level, low level. So that everywhere we have to have a link or communication to have. With that only it has to be planned. So here the real role of administrator at the bedside level, dissemination level, what are the role? So here organize, direct and supervise the nursing service both day and night. As nursing administrator is responsible for the care, till the care aspect. So that's what. Coordinate assigned staff and establish the general pattern of delegation of responsibility to each level. Formulate standing orders for the nursing care. Standing orders, that is very vital to evaluate. So ensure appropriate allocation of the duties and responsibility to all staff working under her. Formulate nursing policies to ensure quality patient care, and responsible for efficient functioning of the staff nurse and evaluate the performance appraisal of the nursing staff under her care. Maybe each level is looking after by the above level. So like that. Next. So the discipline, ensure the standard of discipline of a nursing staff is high at all time. Maintain good order and discipline in wards and the departments. Make daily rounds of the hospital wards, departments, and also seriously ill patients, and bringing immediately to the notice of the medical superintendent. So all matters concerned with the neglect of duty or insubordination, either by the nursing staff, patient, or a visitor, or any untoward events, if it happen, it has to be brought to the notice of the medical superintendent. So public relation, promote and maintain harmonious and effective relationship with the various administrative departments, as already told, of the hospital and related community agencies, and maintain cardinal relationship with the patients and their family. And office duties scrutinize the reports, returns, and submit to the accordance with the existing orders. So that is also report checking. And confidential reports, initiate the confidential reports of the nursing staff on due dates, and responsible for the nursing budget. Already we have seen education. So coming to this in-service education, this also the newcomers, they have to be trained at all category level. They need to be continuous nursing service education to be planned, and paramedical personnel, and keeping records such as everyone to be trained for the new beginners, and upgrading of informations also. For example, now the COVID wards, sir told in the morning, so everyone will be trained for. So maybe the technology, or maybe the change in structures, a lot many things to be oriented. So then and there, for infection control. So various for maintain quality, a lot many effort to be at the bedside, and all the cadre should be aware of, and it has to be set standards and to be evaluated also. And training also, it is very essential. Encourage the personnel to participate in the continuing education program. So a regular continuing nursing education program is essential to arrange for the staff nurses. And welfare. Responsible for health and welfare of the nursing staff, ensure annual and periodical health examination and maintenance of health records, and conducting conferences, also responsible for organizing and conducting a staff meeting regularly at the hospital ward side, once in at least minimum 3 months once. Hold conference in the nursing care problems. Conference means the clinical conferences, care problems, not what we are conducting. That kind of conferences cannot be possible for sometimes beyond to that is okay. Sometimes in Ramachandra and all nice. So nursing in service education, they used to conduct a conference also. So like if they grow, they can do it. But this is for improving the patient care. So they used to have a patient care clinical conferences, and discuss about the policies for the revisions. So these are all some of the things, often maybe monthly or every three months they have to conduct. And supervision supervises the nursing care given to the patients, and the service activities within the nursing unit. Supervise the work of all paramedical staffs of the hospital. Also, it's for responsibility, and records and reports maintenance. So all they have various records already told. So these are all not to be repeated. But problems and challenges faced by the nurse administrator here: lack of adequate training, and problem of personnel management, inadequate number of nursing staff, shortage of trained manpower, lack of motivation, no involvement in planning. So if these are some of the challenges. If the challenge is like that, as being a nurse manager, what are the things? So he is become having headache on that. So staff management, recruitment and retention, it is a big headache. Uncooperative staff, attitude problem, and 100% responsibility without 100% authority. And budget with the financial management is also critical. And self-development also, it is not possible, because all seeing these problems, the self-development of the manager or as administrator also, it is very difficult. Next, move on. So here, day-to-day problem in the nursing services: shortage of nurse, lack of motivation, negative attitude, lack training, lack team approach, inactive participation of program, lack of interpersonal relationship, and less involvement in patient care by nursing supervisors, and lack of supervision. So someone is supervising me above, then automatically we used to keep very alert, and we used to give quality. So that's the thing lacking because of the lack of staffs and proper training or involvement. So these are the reasons. And leadership role and management function associated with the organization of patient care. With regard to patient care alone here, what is the leadership role? Evaluate the effectiveness of organizational structure, determine adequacy of the resource and support, examine the human element, that is staffing, and inspire the work group towards a team effort, inspire a subordinate to achieve the higher, ensures that chosen nursing care delivery model, advance and practice of the professional nursing. So various care delivery models. So it has to be implemented as per the need, maybe ICU or which area it belongs. And managerial function, it examine the philosophy. The management should, as a management function, the nurse administrator should revise or examine the philosophy and select nursing care delivery system, use scientific research and current literature, use a patient care delivery system that maximize the human and physical resources as well intact, effective utilization, ensure non-professional staff are appropriately trained and supervised. So we have to ensure that training, organize the work of activities to attain the organizational goal, and group activities in a manner that facilitate communication and coordination at various levels, organize the work so that it can be cost effective, make changes in the work design, clearly delineate criteria to be used in differential practice role. So that's, so here, so the overall, the administrator, what we need to do for in order to achieve everything. So what need to, she should be the major role is advocate. So as an advocacy, it has to be about the influencing in the people, policies, practices, structures, and system in order to bring out change, if any change. For example, the technology. So the technology, then we have to think about as being as advocate and communicate clearly and concisely. So both the situation that is intended for the audience and nursing students or practice, whoever may be, everything to be considered and should be comfortable in communicating verbal, written, and electronic media or formats. Next. So here, influence the others to action. So also other involvement or a teamwork. So that is influence is built in competence, credibility, and trustworthiness. Hence, all nurse leaders in education, administrator, and even in practice should be computer literate and have a basic competencies of nursing informatics for them to influence others. So this is the need of the hour. So that's administrator to challenge and able to literate all. So all level. So then only the communication will be proper. Otherwise, if they are embedded with the technology, it will be difficult. So we have to literate. Yes. Move. So the previous one. Previous slide. So establish positive. No, next to that. Establish positive collaborative relationship. So the successful collaboration requires careful communication. So that everyone knows. Move. Next. So ensure continuing nursing education. The training of the nurses to use for computer technology. Now, the need of the hour. That previous what we have seen is different. So now in this era, the communication training, it has to be established for the people, the nurses, and source of information for research and application of patient care purposes to be established. And nurses need consistent training to feel comfortable with the use of information technology in their everyday practice. For that, the nurse administrator has to create forum for them to learn, certify. Informatics competency need to be developed at all three levels. So top level, I told middle, lower level, all level of administration or management to be trained for. And promote research in nursing informatics. So here, as very well in the morning also, we had a session, the research to be promoted in all the area. Care bundles was discussed very nicely, and even the software development. So many of areas now it is awaiting for the research. And as a nurse administrator, we have to involve the other all layer to take up challenges and to conduct studies in this aspect. Computerized record keeping, it has to be educated, and then interactive video technology, distant learning, web-based learning, teaching and presentations, everything, it has to be included even in the service side. So that is very vital, because the communication is very vital, touching patients. And after the COVID also, it will be difficult things. They have to be computerly literate, knowing about all the technologies. Next. So the technology change. So now no one can escape as being, so the administrator need to face some of the challenges. And what are the emerging technologies, as rightly told, now we cannot reshape everything. The emerging technology we are going to incorporate, adding with along that available conventional mode of care. So that we are going to see about 7 emerging technologies and 3 skill sets of the nurses and 4 challenges of the nurse leaders. So these are the things we are going to take deep into. So coming to the 7 emerging technologies and challenges. So the first one, it is listed out here, is genetics and genomics. So it have the benefit of majority of the disease risk, identifying the disease risk, and find out it will be influenced by the lifestyles or environment factors and other things. So we have to rule out, that is the benefit. And challenge is many nurses currently in the practice know little about the genetics and genomics, and lack of competence need to be effectively counsel and teach patients in this regard. So the here the genetic and all, now we are not bothering much. So even the but nowadays the trend is changed, because too many anomalies of the childbirth, many of the, even the during pregnant also they do that. So some of the changes are related marriage. So like that all do genetic counseling. So the nurse's role only. So we have to take as a challenge, and less invasive procedures as a diagnostic modalities if you take. So that is also a rate of the challenges here. Minimally invasive, maybe laparoscope or scopy, all type of scopies. So even the nurse can assist for the scopies and everything. We have to increase the competency in regarding their use and their challenges. What are the education to the patient, or creating awareness and applications and everything. The nurse run clinics are also there for in other countries. So it is a challenge. And 3D printing. So the 3D printing and the bio ink, in the morning also we show that not only the bio mark will be more valuable than anything else. So that's the thing they told. But here the 3D means maybe that not only the bioprinters using the biomark made by the living cells to identifying some of the tumors in the, or in the less even less than 4 mm. So someone they presented yesterday. So that and all, it is a recent thing. So we can identify without going for the treatment of surgical intervention. Maybe by identifying early, we can able to prevent further complication. So the healthcare, we have as a nurse, we have to know about what are the challenges, and we have to educate the technology. And if you know about the technology, we can explore to the patients, and then we can able to bring the confidence of the patient and help in identifying in the earlier phase. Robotics. So robotics, you know, it is also another challenge. So many of our previous speakers, we spoke about more, not necessary to discuss more. Move on. So next one is the biometrics. So here biometrics into the security and confidentiality of the health information. So this only, the biometric was the even the morning that class attendance also, the students can enter login ID or mail something there. Anyone can do, but the biomark only that person. So that is a challenge, how it can be measured. So through biometric markers may occur in the less than the ideal situation. Healthcare settings also for having reserving data, changing workforces, everything it has to be keep control, so that biometric system may be incorporated. And confidentiality maintenance also, even access of that records. If everything is online, If anyone knows putting some password, everything is information is. If it is a biometric, we can able to keep control. And electronic health records is another challenge. Implementation cost and getting computer and investing will be more. So, but if it is also a challenge for us to how to go with this accommodations and then applications and procuring also. And computerized physician provider order, that is clinical decision support here, COPE. So in this clinical decision support, fundamentally change the order process, resulting in lower cost, reduced medical error, and more intervention based on evidence, that is best practice. But here, introduction is a challenge. The clinical decision support here, it is resistance is common due to the time spent on the order entry. A lot of that because of the technological literacy, we are not that much of it is a challenge. Implementation and training is required for that. Next. So here the skill set, that and all the seven. So seven, we already we have seen what all the challenges in front, and here, so that issues, and then the skill set challenges will be four at the back. It will come. So now here the skill set is three. So here being able to use the technology and facilitate mobility, communication, and relationship. So they establishing this technological facility means procuring, and communication and relations bringing into is that we have to learn through and select examples for this: email, telehealth, and telemedicine, internet and cellular technology, text messaging, video conference, smartphones, dimension 3D dimension printing, and high fidelity simulation, virtual reality. So everything we have seen so far, such as Second Life, virtual world, social media networking, embedded sensor network, global positioning system, bioelectronics. These are some of the selected technological thing, how we are going to acquire the nursing set skill. So this is the challenge again. These are the skills we have to acquire. No other go, escapism, no. So having expertise in the knowledge of information acquisition and distribution is another skill set. Information literacy, evidence-based practice, clinical decision support, and commercially purchased expert networks. So these are some of the case-based reasoning and understanding cognitive sense theory, science and theories, and adaptation system theory. So this and all we need to take up, and we have to learn more in this literacy. Information literacy is very vital. So this skill we have to acquire. So for that, so for this technological advancement, the required acquisition of skill, we need to update ourselves either through training or learning certifications. Like that, we have to enhance understanding and using of the genomic, as already told, human genomic projects. So many of the thing it is taken place in so various aspects. So we have to take up challenge in learning all these kind of skill. So the regarding genomic also, it is a skill set we have to acquire through. Yes, for diagnostic labs or a treatment lab, for everywhere we have to check through, and we have to disseminate the findings to the people also. So we are between the healthcare receiver and healthcare provider. We are median. So we have to learn both, and we have to disseminate also. Next, follow. Next slide. Next slides. Yeah, here. So here the four challenges which we are as nurse leader, we have to in integrating new technology to learn for or to implement. After that, the challenges are balancing the human element and technology. And second one is balancing cost and benefit. And third one is the training of technology-enabled nursing workforce, and assuring ongoing competencies or training. And assuring that technology use is ethical. So we have to check through whether the technology is, we are dealing with human. So these four are in front of the challenge. So the balancing of human element with technology are, what does all the expanded technology it means? Many of us, perhaps most importantly, nurses need to know and assure that the human element is not lost in the race to expand technology. The human consideration is very vital. Human connection is the art of nursing, and nurses needs to be actively involved in determining how best to use the technology and supplement, not eliminate, a human resource. So we have to think human, and we cannot escape this also. So the human element to be conserved, and the technology usage also has required with the best use of technology, it is vital. One of the most significant challenge nurse leaders will face them in coming decade, then we will find out the balance between the maximizing the benefit of using the technology. So that's the thing we have to check through, but not derailing the human element. So that is the thing. Next. Balancing of cost and benefits. So here there are other leadership challenges. It is nurses must address in conjunction with the healthcare delivery. So driven by technology is the cost, and these technologies are without doubt of saving lives, improving the quality. Everyone we accept, and after that, sometimes, for example, in some places, even without even doing all the diagnosis, symptomatic treatment nowadays, it is not at all possible. All the type of technology they use, whichever they purchase, and even not giving proper even results to that also. Sometimes false results. So like that and all, it will be very difficult. And the technology, we have the technology, we have to utilize it. For that nature also it is there, some of the healthcare systems. So that and all, it is the issue. It is a challenge for us. We couldn't able to say what is justification for why the diagnosis. If the patient asks, we couldn't able to say. In addition, access to technology is often dependent on a person ability to pay for the technology. Many healthcare disparities still exist. Even the patient may not able to pay. They are enforced for the undergoing the technological diagnostic and the utilization, and even for education, the technology purchase and procurement, a lot of issues and challenges. For example, in the online learning, many of the things are we are going to face even for procuring technology also. The training of technology for the nurses, again, another demonstrating competency. To develop the competency, it is vital, and making cutting edge of the practices in the digital era. So to bridge the gap between the clinician and the technology, the leader, it has to be having the expertise in informatics, and they also develop the followers to take up challenges with handling the technology. So the training is essential. They themselves as leaders have to be trained, and the followers also have to be trained. As administrator, as a leadership load, a lot of challenges. This is also a big challenge in front of us. Next. So here, one study. Murphy suggested that nurses can provide a good care with right information to make right decision when caring for an individual. So he is having that conducted study, that having right information to the right decision when caring an individual is essential by the nurses. So that it is when we want to do, so where sometimes writing also we cannot able to say it in right form. So that is the thing. So the study finding it reveals. But sometimes we are no other go. Sometimes we couldn't able to follow that also. Sometimes we couldn't able to say when the right thing to the right time or right. That is the issue. Nursing is an information-based profession, providing a healthcare, and the technology is helping us to bring out all the informations. Okay. So here the computer. So it's helping in all. the nursing practice, education, management, and research, and as well management for administration and research. Everywhere it is having a very big role. The informatics is very vital to learn for. So here, the quality improvement in a hospital, if you take, so that the current status where we are and future state, if you want to go for a improved patient care or improved population health or reduced cost through the people, process, and technology. The people to be trained, the process to be planned effectively, and the effective technology to be utilized. So it should be a meaningful use. So not that unwanted use, it should be a meaningful, cost-effective, and continuous quality improvement in all in terms of effective staffing and effective processing, and then the technology utilization. So this we are in challenge to undergo all these things to improve the quality, and continuous quality improvement is also a big challenge in front of the nursing leader or administrator. Move to next. So assuring technology use in ethical. So this already we have seen that the nurse leader must increase, say, how and why technology should be implemented. So that here, what parameters need to be put into the place of determining the ethical use. That impact of the problem faced by the organizational leader regarding the technology will increase. They have many causes. They are tough to describe, and there is no right answer. So this is the one, the leadership challenge. So we couldn't able to say the right thing in right time. Already we have seen. So that it makes it is an ethical issue. So we for knowing things, we couldn't able to communicate sometimes. Assuring that technology use is ethical. Yes, whether we are we can have to give an assurance through studies report. So here the new technology is bring a significant hope in curing of terrible disease. As well, the fear about the consequences of trying to the enhance of human capability beyond what is normally possible. So here, so what he suggested that new technology bring a significant hope and curing, but the terrible disease as well as the fear is also the concern. So not only the technology is giving benefit, sometimes it may give some fear within the receiver also, and we couldn't able to remove that thing. So that's the thing. So and we cannot able to assure everything will be benefited. So one thing may be positive and one may be negative. So that is the one he just narrated. And Baldwin concluded that blurring of the line between the man and the machine. So here the technology and then the human, there is a line between, will continue to pose concern about the ethics of emerging technologies. In continuation, that ethics only. And everywhere it's a line between. So whether that is utilizing the technology effectively or unwantedly, so we couldn't able to say. And even sometimes they may not be willing to take up that technological diagnostic modality and other thing. We couldn't able to help them. Sometimes we have to convince them, we have to make utilize that facilities, emerging technologies. So that is also an ethical issue. It is nurses are handling that kind of ethical concern. Next please. So here, how beyond to all these challenges, how it can be effectively utilized. So that we have to think little bit more further. So the system have been explored to improve the patient safety. Technology has become a critical part, is responsible to meet the ongoing patient safety challenges, recognize that staff and then the end user of the technology. Who are only the staff nurses or the end users? That as one author in the year 2003 suggested that successful technology implementation can largely influenced by the organizational leader who create the shared vision with their staff. So the shared vision for the leader is essential, and ensure the environment of collaboration of the trust and where the voice of the staffs is valued. So that is, so the leader always give room for the followers to establish a new trust and give a shared vision, then only they can able to implement anything at the bedside. So that then the problem can be solved for. So this is the one which is, he has identified, and through this that leader will be acting as a transformational leadership, where the leader and staff work interdependently to achieve the improvement or apply the technology. And another author, Scotts and colleagues, found that there is a behavior where present in the nurse leader and facilitated successful technology in the medication safety measures. So with the shared vision, they could have achieved the medication safety measures at the home setting. So that's the finding of this. If the shared vision is there, the working group of staff and then the top level administrator or the leader have a shared vision. So in implementing the medication safety measures, and we can able to implement through that records, electronic records and other things where the technology is. Next please. So here the transformational leader means as a nurse administrator should possess some of the 5 important aspects here, so that it is modeling. She should be a role model, an encouraging heart, and inspiring a shared vision, and enabling others to act, the support or facilitate things, and challenging the process. Any process he has to challenge. So these are the transformation leadership. It has to be taken care by the administrator. Then it will be possible for accommodate implementation. So in the another study, if you take achieving a medication safety, as already told, so the previous slide also in continuation, they have conducted 5 Midwestern nursing homes over a period of 2 years. They have conducted a study and implemented that complete electronic health record. So EHR. So we have seen for the last 2 days, the record was implemented, and the electronic medication administration record with that. So how this element of the technology impacted medication safety practice. So study findings reveals. Next one. So that medication error was controlled by using this technology, the integration and maximization of the technology with the shared vision and open communication, and us being that leadership given a lot of importance for the followers also, and shared vision, priority, and medication safety with open communication, provided advocacy and team recommendations, and role model the systems of problem solving. They improve the and or prevent the or minimize the medication error. Yes. So the second study focus the group of intervention. So here they have conducted among the nursing professional. So as being a nursing administrator, so conducted a study, and the study was undertaken the prior to intervention, post intervention. So the intervention which it was given here, so the focus group, even after the intervention, there is not much changes. It is taken place. Why? So that is the study finding. So here they first they started with some all different people in the healthcare, LPN, RN, or like many of the ST and AS. So like many nurses have been utilized in the beginning. Later on, they tried for that implementation. It is not worthwhile. So that's why. So they have trained the people in such a way. Some of the interventional component has been, and they selected the RN alone. So only RN they have taken as a charge nurse and giving report of all the patients, and they have oriented for the daily goals sheet and team leader and everything they put, and as a group, as a team, and they have just have given all orientation with all patients and other things, education and communication, everything, the technology, everything, it is oriented. And the staff attended mandatory educational in-service program conducted by the nursing administrator, which reviewed job description and duties for the various type of the nursing staffs. And here, post intervention, So after the post-intervention, after 6 months, they re-evaluated. So that re-evaluation also, it has become lack of effective leadership from the charge nurses, because here what the study revealed, the middle managerial level, no cooperation. So that is the team building, it is not there. So that is the why, even though the staffs are trained, even though they are qualified for RN, the manager for not having a shared, not having giving room for the followers. So then here that effectiveness, it is not able to implemented in the workplace. So that is the thing. The nursing teams were not effectively adopting the new changes in the work environment. Then what it leads? So that is following one, the negative work environment linked to what? So lower that satisfaction score, the consumer assessment of healthcare provider and system score is reduced. So because of the absence of trust, and then the fear of conflict, lack of commitment, and avoidance of accountability, and then again the inattention to the given role. So these are the things. So that is poor work coordination because of the managerial function lacunae. So that is the one. So even the training or the literacy, everything, just qualified people are there. Nothing, it is not. Here what it means, the teamwork, it will work out with giving a shared vision for all at all level. So that it's one, it is given dynamism. So these are the thing, it is lacking there. So here, if any nurse, if enter into first, what is that milestone of development, it is taking place in the clinical arena. So that is crawl phase, that is 2 to 3 months with the expectations, what are they? It is some of the things it is given. So the accumulation of the novice phase. So what are the things they are going to achieve here? And then the then coming to the 3 to 6 months. So after that, they are putting it to the influence and direct patient care nurses. They will be placed first the initial trainings and other thing within 3 months, and after that they will be placing as a development of placing as a care provider, and knowledgeable resources will be provided, and they are learning, and leadership organization, everything they are and transparency and everything, it will be maintained for another 3 to 6 months. And after that 6 to 9 months, again they determine the best practices they are learning, and the impact of practices and everything, it is going on. And 9 to 12 months, again they here broad generalization of advanced perception. They know I can learn anything, I confidently they can able to function, but even then they are leaving. So that is the thing, because of the leadership inadequacy, and the administrator not able to handle effectively. There may be many job vacancies, they move from one places to other places. So because their expectations and here what they are providing is not adequate. So these are some of the all the time there will be a lacunae in staffing. So that's the reason. So we have to meet the standards of what is their expectations. That to their expectation also it has to be met. So that is also a role of administrator to take care of these people, staffing. Next. So ways to improve the teamwork. So according to Alkin et al. 2002, so 42% of the nurses dissatisfied with their job and intended to leave within 12 months. So this is the one, the previous one. So that within 12 months, within 1 year, that 42% dissatisfaction, they are leaving the job. And compared with only 11% of the nurses are high satisfaction. So that is the imbalance between. So if they recruit, so they have to identify, as a leader, have to identify and what are the needs and what are their expectations, everything to be achieved. Otherwise, the retention will be poor. The negative work environment in the previous triangle we have seen has been linked with the lower hospital consumer assessment of healthcare providers. So that is that is score. So assessment score of that retention. So that it has been very less because of this leadership and administrative poor control and teamwork. So that's the thing. So it has been elicited by this study. For this reason, nurse manager and administrator are urged to consider two ways how to improve the teamwork through educational opportunities and communication. So these are the way, and the conflict resolution, team building exercises, and leadership development for charge nurses. So particularly charge nurses are having that managers and leaders are in between. So the top level administrator cannot immediately coming along with them. So that middle level to be given more important, and then the lower level also have a proper link. So they taken care. The manager to be trained effectively to keep the lower level, and having that reporting to the higher level also, all to be trained by the nursing administrator, middle or lower level. In their level, what type of trainings, either the continuing education or maybe the opportunities or team building, some conflict resolution. So these are the thing, and leadership development. So leader, anyone can be a leader, even the smaller level people also. Leader, all leaders are not administrator, but the administrator has to follow the leadership qualities also, and they have to take up. So that is also one substitute of their role. But here the team building is very vital. So then only they will come to a proper output and retention also of the staff. So here this model as a leader, so advanced practical nurse in the inner circle, as a patient focused leadership, what all their role it has to become. It is in the middle center. So the coaching and the educating, initiating meaningful communication, and managing patient-centered care, advocating. So these are having the role of to improve the patient-focused leadership. And what is the organization and system-focused leadership have that support system or a function like so they have to like a mentoring of coach of the followers, and enhancing professional nursing practices, communication, anything to be communicated effectively to the all level, and improving the quality of care provided, and being an expert clinician, and providing leadership on external and internal communication, and coming to as a facilitator for the collaboration. So these all the things it has to focus for the development of the organization as a system focused, as a leader has to take up challenges with, as a patient focus, as a system focus. We have to work in a different level to help. The administrator is for the responsible for the patient quality care, and again reportable for the system. That is also about to. And coming to nursing education, the some of the challenges, just like that I would add some points in this. So NLN, so National League for Nursing conducted a national survey. They have identified 8 hallmark excellences. So that is where to face the challenges in 21st century of nursing education. So here the simulation as a technology pedagogy, already we have seen the previous presenter also talk about the teaching pedagogy. So civility in nursing education and interprofessional education, and along with the specific descriptions and benchmark for the faculty and administration to assess their integration into program and instructions. So these are some of the things we need to follow. What are the 8 hallmarks of excellence it is given? So that we will see. So that NLN contribute to take up the lead in offering evidence-based best practices in curriculum development, and instruction to the responsible persons who are as the educator, and preparing the next generation of the nurse to provide patient-centered, culturally sensitive, outstanding care to be provided to advance the health of the nation in the national and global level community. Next slide. So here the 8 excellence, hallmark excellence, we need to meet. So the R, engage the students, diverse, well-prepared faculty, and a culture of continuous quality improvement, innovative evidence-based curriculum, and innovative evidence-based approach to facilitate and evaluate learning, and resource to support the program goal attainment, commitment to pedagogical scholarship, and effective institutional and professional leadership. So these all next month. So there's some of the sub-component in this, it is given, all the 8, it has been, we can for each and every one, the letters are very less, I couldn't able to say, you can read later on, all the 8 points, it is to bring excellence in the nursing education with a sub-component in the each circle it is there. So all the previous 8 points which I have said, then NLN, if you go, the site you can take and read, zoom it, and you can read the sub-component within that. What are the hallmark excellence? References NLM. So that National League for Nursing. So here the conclusion. So coming to this here, nursing leaders require a variety of unique skills, including informatics, to support delivery of safety and effective patient care. Strong leadership in nursing required clinical knowledge, interpersonal communication, system thinking capacity, and collaboration, quality assurance, and human resource management. So these are the area to be taken care by the strong leadership. Nursing informatics is defined as a science and practice that integrates nursing, information and knowledge, and management with ICT, so that the information communication technology, to promote health of the people, family, and communities worldwide. Next. So here, nursing administrator must understand the impact of technology on all aspects of the human life and acquire the ability to apply and integrate rapid technologies, change in patient and healthcare. Proactively create the educational models and leadership development program necessary to assure that nurses will have the competencies to apply these emerging technologies. Transformational leadership, already we have seen, strive to raise their followers up by working interdependently and as a team, and create an environment conducive to open communication. Information sharing will lead to a cohesive, whole directed team environment. That team environment facilitate a goal achievement by empowering the team through seeking ongoing team member input, so that is involving the team member, and feedback for the improvement to be implemented. So this is the challenge for the nurse leaders. There are some references, still more, I think some references are there. So with this, I'm concluding. So any of the doubts you can able to clarify, or any chat if it's so. So the only, it is very simple to understand, I think.
Thank you, ma'am.
Yeah.
It was an elaborate and extensive presentation, comprehensive it was, ma'am. And special to mention the tabulations, pictorial representations, like the 7 emerging technologies.
Yes.
That you mentioned. Really highly informative. Thank you, ma'am. It was really interesting, and it was really extensive.
Yes, yes. Because I would like to cover some points for the education also, because it is left over. So I add to that. So I got this point that so if you read that, that is very, very good. That model I didn't read because of the time and other thing.
Yes, ma'am.
So if you zoom it, and then you very well good content is there within all that 8 elements. No, so that is useful for our nursing education.
Yes, ma'am.
So to improve,
highly informative and useful to all of us, ma'am. Thank you, ma'am.
Thank you. Thank you for the patient listening for such a long time.
Yes, ma'am.
So, but anyhow, because of that only, I couldn't able to give a lot of other thing. All it is covered by all other people. So just some few points I would like to highlight to implement. That's what I just.
Yes, ma'am. The nursing administrator's role very well handled, ma'am. Thank you, ma'am.
Yeah, that is the only it is given for me. So I have
Yes,
to
ma'am.
give justice for, yeah. Thank you
Yes, ma'am.
so much for the patient listening, all of you. I
Yes,
think
ma'am.
more than 400 participants are there still. I'm
Yes,
happy
ma'am.
to see. Susi is there. Sushi.
Susila
Susila
ma'am?
is also
Susila
there.
ma'am? You're there online, ma'am? Susila ma'am?
She is there, but maybe internet problem.
Yes, ma'am.
Mute பண்ணல மேம் mute
அப்படியா?
mute பண்ணி
Okay, okay.
Okay, ma'am.
Okay.
Ma'am,
Thank you so
shall we
much.
conclude, ma'am?
Yeah, please.
Yes, ma'am. Thank you, ma'am.
Thank you, ma'am.
Few instructions to the participants. The registered participants should complete the feedback form shared to you through email. Few participants had raised a question whether the e-certificates will be provided every day. Yes, for each day you will get the e-certificate. The registered participants who attended the sessions and who complete the feedback form, definitely you will receive the e-certificate every day. And you should note that you'll have to give your correct email ID. So this is the thing you should, some students have mentioned that they have not received email. Probably you have not given your email correctly. So check that. And this is for today. On behalf of SRM College of Nursing, I thank all the participants, especially who are still online. Thank you for your patient listening, as Madam mentioned. Thank you for all of you. And just as a reminder, we have the third day state level webinar on 17th of July, 17th on Friday. I request all the participants to attend and get benefited. And especially to mention, along with the learned expert presentations, we have debate by the nursing students on 17th. On the topic traditional classes with online classes. I hope definitely it will be useful for all of you. I request all of you to attend the sessions on 17th. Thank you, all of you.
Yeah, yes. And those who are in the alumni, if anyone is attended in this, if they are willing, they can attend for the tomorrow's. You just put a word.
Yes, ma'am. So tomorrow we have the alumni webinar, alumni of SRM College of Nursing webinar.
Yeah, those who are willing.
So the students who are interested, who have attended, if you want to attend, you can attend for tomorrow's webinar sessions, alumni webinar sessions.
You just brief the title on that. If they are willing, they are free, they can attend.
Webinar, alumni webinar titles, I'll have to check.
You have to check.
Yes, ma'am.
Because we don't know, that's why some alumni are there, means they can take up, no problem.
Yes, ma'am. Yes, ma'am.
And others we didn't inform also, no?
Yes, ma'am.
That's what. So if they want to say, means you can put a word. Those who are free, if they are interested, they can able to attend.
Yes, ma'am.
Now we cannot force. Yes. Title alone, at least we have to say, tell, no? Abhirami, you just ask Abhirami. It may be in the mobile. I will check. So that is our certificate only she is.
Kalavalli.
So one title is
Kalavalli.
Yes,
you have the title for the alumni webinar.
So the title is Trends in Public Image of Nursing. Trends in Public Image of Nursing, Florence Nightingale, Image of Nursing, Florence Nightingale to COVID era.
Yes, ma'am. So it is Trends in Public Image of Nursing, Florence Nightingale to COVID-19 era. That is the title, theme for the alumni webinar.
And one more thing is morning and evening sessions are there.
Yes, ma'am. So the topics handled are milestones of clinical nursing practice and education. It is a morning session by Mrs. Ponnilla Srinivasan. from Memorial Healthcare System, Florida. And the next section is Dr. M. Hema Malini, Principal, Hindu Mission College of Nursing. She will be dealing with the evolution or timeline of nursing administration and research. And the next one is dealt by Dr. Jane Vanitha on professional identity in nursing. And the next session will be by Mrs. Lata Venkatesh, Vice Principal, Dr. Mohan Diabetes Education Academy, Chennai. She'll deal on futuristic nursing and visibility of nurses. So
The
this is for
afternoon
the morning session, ma'am.
Afternoon panel discussion.
Yes,
It's a
ma'am.
panel discussion on emotional intelligence.
Yes, afternoon, we have the panel discussion on emotional intelligence, redefining smart employee. So that is the topic for panel discussion, theme for panel discussion. We have resource persons, Dr. A. Arvind Babu, Principal, Chair College of Nursing, Coimbatore, and Mrs. R. Uma, Associate Professor, St. Isabel College of Nursing, Chennai, and Mrs. Manjula, Associate Professor, Sri Arvindo College of Nursing, Karur, and Mrs. Uma Shankari, Associate Professor, Tagore College of Nursing, and Professor Sugantra Devi, Principal, OPR Memorial College of Paramedical Sciences, Vadalu, and Mrs. Parameshwari, Associate Professor, Vijay Mary College of Nursing, Begumpet, Hyderabad. So these are the resource persons. So this is about tomorrow's session, 16. The participants who are interested can register and attend and get benefited.
And any of SRM students will be attending.
Yes, ma'am.
And all others, if they would like to, means let them come and join.
Yes,
because since the audiences can be more, so that's what the benefits. If they would like to attend the title, we cannot force them. But the other day they have to come. Already they registered. No.
Yes, ma'am.
Yeah, that is the thing. There will be a confusion. You tell to the colleges individually. Tell
Yes,
the
ma'am.
teachers to coordinate.
Excuse me, ma'am. Today's attendees actually would have received the feedback along with the 17th webinar link, ma'am. So they will be joining on 17th with the webinar link.
Okay. Okay, that's okay. But in you can confirm with the institutions also.
Yes,
and
ma'am.
for the tomorrow also, you just put a word to the institution. They will disseminate.
Yes, ma'am.
If they are free, they can come and attend. No problem. Okay.
Okay, ma'am.
So, but we as such
We'll
for
inform,
other-
ma'am. Yes, ma'am.
we could not able to what is their problems or their responsibility. We don't know. So that's what. Okay, that's
Yes, ma'am.
okay. Anyhow, I thank all of you for the patient listening to this time, and even still the 360 students are there. I'm happy. So I'm happy for all the participants. So for that students learning, it should be easy. That's why I make it very easily to understand the concepts. That's all. Thank you so
Thank you,
much.
ma'am.
Thank you, ma. Thank you. Thank you, Vijay. Thank you, Kala.
Thank you, ma'am.
And thank you, Sushila. I couldn't able to come, and then I will call her through phone.
Yes, ma'am.
And Mahalakshmi, she left. And irukangla. Because it's 5 o'clock.
Yes, ma'am.
Where are they? Kalavali is still there.
Kalavali is there, ma'am.
Why she doesn't left?
No, ma'am. They are in the bus, ma'am.
Okay, bus very good. So that's technological advancement is very
Yes,
good.
ma'am. Yes, ma'am.
சரி சரி பரவாயில்ல நல்ல
Okay,
கம்ஃபர்டபுளா பஸ்லயே அட்டெண்ட் பண்ணிட்டு போறாங்க நல்லதா போச்சு இந்த ஐடியா முதல்லயே பண்ணிருக்கலாமா நீங்க போய் பஸ்ல கேட்டுட்டு இருக்கிறதுக்கு பதிலா ஓகே தேங்க் யூ ஆல்மா
Thank you, ma'am. We'll conclude the session. Thank you, ma'am.
எஸ் தேங்க் யூ கண்ணன் சார் இல்ல
Illa, ma'am. Informed him, ma'am. He said he will come and leave the exit.
Okay, ma. Thank you.
Okay.
Thank you so much. All. Thank you all.
Thank you, ma'am.
Yeah.
Kannan sir. Hello, Kannan sir.